We are on the record at the beginning of media number 1, volume 1, contracted by Hahn and Bowersock. Please begin.
This is the testimony of Elizabeth Holmes going on the record in San Francisco, California at 9:00 a.m. on July 11th, 2017. Ms. Holmes, please raise your right hand. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Thank you. My name is Jessica Chan, and with me are Rahul Kolhetkar, Monique Winkler, Michael Foley, Mark Hatz in the back, and Jason Habermeyer. I and Rahul Kolhetkar are staff attorneys in this office. Mr. Foley is a staff accountant. Ms. Winkler is an assistant director in this office, and Mr. Habermeyer and Mr. Hatz are trial counsel in the San Francisco Regional Office of the United States Securities and Exchange Commission. We are officers of the Commission for the purposes of this proceeding. This is an investigation by the Securities and Exchange Commission in the matter of Theranos, Inc., SF 4030, to determine whether there have been violations of certain provisions of the federal securities laws. However, the facts developed in this investigation might constitute violations of other federal or state, civil, or criminal laws. Prior to the opening of the record, you were provided with a copy of the formal order of investigation in this matter. The formal order will be available for your examination during the course of this proceeding. Have you had an opportunity to review the formal order?
I'm not sure if I've reviewed it, but I know our team has it.
Do you have any questions about it?
I don't.
Prior to the opening of the record, you were also provided with a copy of the Commission Supplement Information Form 1662, which has been marked as Theranos Exhibit 1. Have you had an opportunity to review Exhibit 1?
I have.
You also received this Form 1662 with your subpoena for testimony, correct?
Yes.
Do you have any questions about Exhibit 1?
I don't.
Ms. Holmes, are you represented by counsel today?
I am.
Would counsel please identify themselves, and if you wouldn't mind providing your firm name, address, and phone number as well.
I'm Stephen Neal with Cooley. My phone number is 650-843-5182, and I'm one of the attorneys representing Ms. Holmes.
John Dwyer, also of Cooley, 650-843-5000.
David Taylor, the General Counsel of Theranos.
Chris Davies of Wilmer, 202-663-6187.
Bill McLucas, Wilmer, 202-663-6622.
Allie Leeper with Cooley. Give me a minute for my phone number. 650-843-5376.
And would you also provide your office addresses as well?
For all three Cooley people, our office address is 3175 Hanover Street, Palo Alto, 94304.
For Theranos. 1701 Page Mill Road, Palo Alto, 94304.
And Bill and I are at 1875 Pennsylvania Avenue, Washington, D.C. 20006.
Do you represent Ms. Holmes in her personal capacity?
I represent Ms. Holmes in all capacities.
Okay. And what about Mr. Taylor and the attorneys from Wilmer?
I represent the company, Theranos.
Represent the company, and Ms. Holmes is CEO.
Same, the company and Ms. Holmes.
Before we start today, I want to go over some ground rules with you. The court reporter will be recording and transcribing what we say, so it's important for us to talk only one at a time. So if you could please wait until I finish my question before you answer, and I'll try and do the same. I won't ask the next question before you finish your answer as well. For the same reason, it's important that you answer audibly and don't respond with gestures. Even though it's a less formal setting, the oath you just made has the same effect as if you were testifying in court and carries with it the same penalty for perjury. It is also a crime to knowingly present false information during the course of this investigation. Do you understand?
I do.
If there's anything you don't understand, please let me know so that I can repeat or rephrase the question. If you don't tell me you don't understand, then I'll just assume that you do understand the questions asked. If you need to take a break at any time, just let me know and we can take a break. The only thing that I ask is that you not ask to take a break while a question is pending before you.
Yeah.
Are you taking any medications that would impair your ability to understand my questions or answer fully and truthfully?
No.
Is there any reason why you can't give full, complete, and truthful testimony today?
No.
I'm handing to you what's been marked as Theranos Exhibit 191. one more copy.
That's all right. Thank you.
This is a subpoena that we issued for your testimony. Are you appearing here today pursuant to this subpoena?
I am.
Thank you. And you can put that to the side over here. We'll start making a pile in the center of the table. Okay. Also going to hand to you what's been marked Exhibit 192.
Thank you.
Exhibit 192 purports to be a background questionnaire that's dated July. July 10th, I believe. Or is it July 2nd? July 2nd, 2017. Did you also send us a revised questionnaire yesterday, which is July 10th?
We did.
Okay. Have you seen Exhibit 192 before?
I have.
What is Exhibit 192?
The completed background questionnaire.
Did you complete the questionnaire on or about July 2nd, 2017?
Yes.
Is the information in Exhibit 192 true and correct to the best of your knowledge?
It is.
And if you would turn to page 4 of the questionnaire. Under securities accounts, question number 15.
Yes.
You noted here in this questionnaire that was.
Yes. I'm not sure exactly, but I'm not completely sure.
And if you would look over at page 5, then there are 2 bank accounts listed there. What are the source of funds for these accounts?
Just my paycheck from Theranos.
If you turn to page 7, is this an accurate reflection at the bottom, your answer to question 26 regarding your educational history?
Yes.
And then going on to page 9, under your employment history, which is question 32, and going on to page 10, is that an accurate reflection of your employment history?
Yes.
Thank you. You can put that aside. So, thank you. So, I wanted to start with the time period starting in 2010, and let's just focus on the year 2010 for a moment. If you could just tell us the state of Theranos at that time, I think that would be helpful, just in terms of how many employees you had, where you were located, if you had an office, just some information about where the company was at that time.
Absolutely. It was 7 years ago, so I don't remember exactly. I think our offices were at 3200 Hillview. We were probably about 100 employees or so, I would guess, maybe 150. And we were beginning to engage with retail pharmacies on the idea that we had to bring our technology to retail locations.
Who was working with you in management at that time?
I believe Sunny Balwani was our president at that time and chief operating officer.
Was there anyone else who was operating the company with you besides Mr. Balwani?
I'm trying to remember. I don't think we had other senior management members at that time. We had, I think, a couple of side from a technology perspective.
And who were they?
I believe on the assay development side may still have been there, and I believe was there at that time. I don't know if he was. There's probably a couple others.
What were his roles at that time?
I was focused on the two aspects of our hardware, which is the consumables and the device. I think at that point probably more on the consumables than the device. Started focusing on computational biosciences, which is sort of the algorithms, and then expanded into a broader product role over time.
Just to understand, what do you mean by consumables?
I'm sorry, the pieces of plastic that go into the device. We call them cartridges. It's the plastic pieces that our chemicals go into for our distributed testing device.
So tell us what products Theranos had at the time, had developed at that time.
So we had an earlier version of what we call our mini lab system that is the distributed testing device. And we'd invested in development of a large number of chemistries for a very broad range of different tests. And then the associated software, sort of foundational pieces for doing predictive modeling.
What did the mini lab do?
The mini lab in 2010?
Yes.
It ran a set of, well, we had two versions of it, I think, at that point. There was the 3.5 device, which ran a set of immunochemistries, and then there was a 4-series platform that we were working on that could run a broad range of test methods.
So the 3.5 version, how many tests could it run at that time in 2010?
I don't know exactly what the number was. I think just from the development reports that I've seen that there was probably tens of tests. I mean, we got up to about somewhere between 70 to 90 immunochemistries. I'm not sure exactly what time we finished them, so it would have been tens at least in that period of time.
Okay. And you say that you reviewed some development reports. What are those development reports?
The reports for all the chemistries that we had worked on for our small sample testing method.
Are these development reports, are they put together by the chemistry groups at Theranos?
Yes.
Okay, so they're the development of an assay and the chemistries that go along with it.
Exactly.
Had you transferred those chemistries onto the platform, onto the MiniLab platform at that time?
Yes. A number of them. There's probably some that we hadn't, but yes.
How many had been transferred onto the 3.5?
I don't know specifically in 2010, but again, I think it's probably at least tens of tests.
Okay. So when you say tens of tests, you mean something less than 100?
Yes.
And who would know how many of these tests have been transferred onto your platform?
As of 2010?
Yes.
I don't know specifically. I'm sure as a team we could go back and try to look at the dates of all the development reports. I don't know that there's one person that necessarily knows that now. I'm not sure.
Had those tests, you said tens of tests, had those tests been validated on the MiniLab at that time, on the 3.5?
They had, to what we understood validation to mean. Our understanding of what was required for validation changed later, but at that point we thought they were.
Okay, and what was your understanding of what validation meant in 2010?
There was a basic guidance document that we had become familiar with through the work we were doing for pharmaceutical companies on assay development, and we thought that if we developed and tested or validated the test to that guidance document, the test was validated.
What guidance document is that?
I don't know specifically. I think it's based on FDA guidelines for development of a test.
Who provided that guidance document to you?
I believe through the development work that we did for either Centicor or Celgene, it at least affirmed our understanding of that guidance document. I'm not sure if we had it specifically before that.
Did you review that document?
Did I personally review it?
Did you personally review that document?
I don't think so.
Who reviewed it on your team?
Whoever was leading the assay development at that time.
Who do you think that was? Was it?
I don't know. I don't know.
Okay, and then also for your mini lab, I think you mentioned, was it a 4.0 device?
So I called it 4 series,
4
which
series.
is, there's been many of them in that iteration that we've been working on.
Okay, so what could the 4 series mini lab do?
So at that point, I think what we'd shown was the capability of the different detectors that are in it to function with these different methods. Namely, different tests use different methods to measure things, and we were trying to get a range of methods so that we could measure more things on the device.
Okay, so how many tests could that device perform in 2010?
I don't know.
Is it fair to say that the device was still in development then?
Absolutely.
Okay, what were you using the 3.5 device to do? Were you using it for patient testing or for any of your clinical trials?
We did, and to be clear, I'm not sure if it was the 3.5 or the 3.0 at that time in 2010. We used that system for pharmaceutical clinical studies, and then also for a study we did for the DoD at Fort Sam Houston and a series of burn hospitals.
Okay, so you were using, you said there was a 3.0 and a 3.5. What was the difference between the two versions?
They were very similar. The core architecture was the same. I think it was essentially more robust.
Robust in what way?
I don't know specifically. I believe we improved our manufacturing processes, and I'm not sure what else we did.
Who would know what the difference was between the 3.0 and the 3.5?
I believe would know. Yeah.
Would know as well?
Depending on when we cut over to the 3.5, I'm just not sure. I can't remember in the 2010 time period where we were on that, and I don't remember when exactly he left the company.
You mentioned the use of the term mini lab.
Yeah.
Is that what you called it back in 2010?
So when Walgreens asked us to go to Johns Hopkins for due diligence, they called it a mini lab at that time, and we began using that term, but there were other terms that were also used.
So I guess, just because, I'm not a scientist, I just want to understand the different terms that might be used. So you've got the mini lab, I think you said 3.5 and a 4 series. Were there any other kind of terms that the company called its distributed testing device in the 2010 timeframe?
I know that people referred to it as an Edison device, and we later referred to it as a TSPU device. There may have been others.
Thank you.
So you mentioned that the company was doing some work for pharmaceutical companies. What type of work was the company doing?
We were developing chemistries to work on small volumes of sample, and then in some cases putting them onto this distributed testing platform, an earlier version of MiniLab. We were also working on models to simulate the way that drugs would work in people.
You said you were working on models to simulate the way drugs would work in people. What were you trying to understand in that process? Or what were the pharmaceutical companies trying to understand, and how were you helping them?
Yeah, they're trying to understand if they dose in a certain way, is it going to work or is it going to have a safety issue? And we were building simulations that you could feed data into to help predict that, so that you could speed up the amount of time that it would take to actually test it in humans.
And then you also mentioned a second project you were working on was being able to test smaller samples. Was that something that pharmaceutical companies were discussing with you, the possibility of doing clinical trials for?
Yes.
Okay. And was this something that they initiated, or something that you initiated where you were requesting their help to conduct these clinical trials?
I think both. I mean, it was a number of interactions over over multiple years before 2010. We certainly sought partnerships early on, and then had the opportunity to look at other partnerships as we started to build relationships with those pharmas.
How many companies did you have contracts with at that time?
In 2010?
In 2010.
I don't know specifically, but I would guess it was around 10.
Was the company generating any revenues in 2010?
I don't think so. Again, I don't remember specifically. Maybe a little bit from the burn study.
When you say burn study, what are you referring to?
That was the DoD study through Fort Sam Houston.
Okay, and who were you dealing with on that study?
At the DoD?
At the DoD. What was that study for?
It was seeing if the ability to test smaller samples would allow you to get more frequent time points in people who'd been burned, so that you could tell whether the filters that you were putting into their kidneys worked well enough to flush out their systems.
Do you know how much money the company was generating in revenues from that?
It would have been
study?
very small. Yeah.
When you say very small, what do you mean?
I think the whole contract was a few $100,000.
I'm going to hand to you what's been marked Theranos Exhibit 193. Exhibit 193 purports to be a January 22nd, 2010 email to Elizabeth Holmes with the subject line there's an attachment to the email, but the starting base number is THPFM 0000690035, and the attachment starts with 39. Have you seen Exhibit 193 before?
I don't recognize it, but I might have seen it a long time ago.
What is Exhibit 193?
I'm not quite sure. Do you mind if I take a minute to read
Sure.
the email? It looks like some type of draft financials that prepared for the communications referenced in the email.
Okay. And did you receive Exhibit 193 on or about January 22nd, 2010?
Yes.
So you'll see that you're preparing to give a presentation to ATA Ventures. Do you know who ATA Ventures was?
They're one of our investors.
Okay. And had you given a presentation regarding Theranos' financial situation before this?
To them or to anybody?
I'm sorry?
To them? To
ATA Ventures. Was this a regular occurrence? Were you expected to give presentations to their board?
No.
So if you turn to the attachment, there's some financial statements. And if you turn to the monthly PL, which is the second page of the financial statements, you'll see that Theranos is on track to generate about $5 million in revenues in 2009. Is that consistent with your understanding of the revenues that Theranos was generating at that time?
You know, I don't remember what my understanding was at that time.
Do you have any reason to believe that this is an accurate representation of the revenues that the company was generating at the time?
Do I have a reason to believe it's inaccurate? Is it?
Yeah. Do you have any reason to believe that it's inaccurate?
No.
Okay. And would these revenues have been generated from those pharmaceutical companies and from DoD?
It looks, just based on the email exchange, reading it here, that they're all associated with pharmaceutical companies.
If you look back at the email, since you're looking at it right now, the third email down on the first page, she says, this revenue includes potential adjustments. Need to agree with KPMG for Celgene, Centocor, Schering-Plough, and Novartis. And there are a number of dates that she puts next to those pharmaceutical company names. Some in 2009, assumed completion, some in June 2010. Were all of these contracts coming to a conclusion around the 2009-2010 timeframe?
I don't know. I just can't remember.
What is your knowledge of when these contracts came to an end?
I have in my mind that the Celgene relationship went on for a period longer, and I thought that Centocor was also looking at doing additional programs with us. I'm not sure about the other two.
So if you go back to the financial statements, which is the attachment to the email, the monthly BS, which, do you understand BS to stand for balance sheet?
Yes.
And if you look at, in December 2009, cash and investments is about $3.7 million. Is that consistent? Do you see that?
I'm sorry, December 2009?
Yes.
Yes.
Is that consistent with your understanding that Theranos had about $3.7 million in cash at the end of 2009?
I can't remember.
Do you remember Theranos being short on cash around this time frame?
In December of 2009?
Or late 2009?
You know, I remember that when Sonny joined the company, he bridged the company, so I'd actually thought that we'd ended up getting cash in before the end of 2009. I'm not sure from this email. I'm not sure.
So you said Sonny Balwani joined the company and he bridged the company. What did you mean by that?
He did a bridge loan for the company when he joined the board, which I thought was before the end of 2009, but my dates could be wrong. It was a long time ago.
When did Sonny Balwani join the company?
I thought in about September of 2009 or August of 2009, but that's from memory. It may be off.
Okay. Why did Sonny Balwani need to provide a bridge for the company?
Well, I knew that we needed cash, and we were deciding whether to do an equity raise or not, and he had offered to do this for the company.
Okay, so you knew sometime towards the end of 2009 that the company was short on cash?
Yes, yeah.
What was his bridge to the company? What was the amount of the loan?
I don't remember specifically. I think it was about $20 million.
What were the terms of that loan?
I don't remember.
Was it paid back?
Yes.
When was it paid back?
I don't know specifically.
Has it been paid back, though?
Yes.
Did there come a time when, around the 2010 timeframe, that you decided to change the business model from working for the pharmaceutical companies to a different business model?
We decided we were going to work to bring our technology to patients and physicians. We thought we would always continue the pharmaceutical studies around the retail model, but that could serve as a channel for it.
Okay. And so you said you decided to change the model to provide services to physicians and consumers.
Mm-hmm.
So what did you do to realize that vision?
Just so I can best answer the question, what do you mean by that?
So it sounds like, you know, the company was focused on the pharmaceutical trials, I guess, pre-2010, and it sounds like you might have done a little bit of work after that period, but that the company was looking then to reach out to consumers and physicians to provide its blood testing to them. At that point, did you decide that you were going to reach out to some business partners to realize that vision? What happened?
We did. We thought a lot about what the right channel was to make lab testing more accessible, and we became very interested in the retail pharmacy as a channel for lab testing. I know we reached out to some, and I think some may have reached out to us at that time as well, and we engaged in discussions around partnership.
Whose idea was it to start focusing on the retail pharmacy business?
I don't remember specifically. I mean, it related to what we were doing with testing of drug levels, and so it almost became a progression from that.
Okay. So now I want to sort of focus on the state of the company in 2013. Mm-hmm. So this is 3 years later. What had changed about the company?
So 2013 was the year that we launched our retail infrastructure. And so we'd spent a lot of time getting ready for that and figuring out how to operationalize that, and most importantly, moving to a different business model, which we've referred to as a phase 1, phase 2 approach to introducing our technologies, where you start with centralized testing and then you work to get your distributed testing platform out.
Okay. How many employees did you have at the company at that time?
I don't know specifically.
Had it grown?
Absolutely.
And you know, in terms of I guess, what divisions of the company had grown since 2010?
I know we'd grown our assay divisions in terms of the work on the chemistries that we were doing. We at that point had established a clinical lab and had brought in a lab director to run it, and I'm sure there was growth across the board.
Were there any changes in management at that time?
I don't know specifically whether there'd been changes on the product leadership side by that point. Sunny was still our president and COO, and was largely running operations.
Were you still at the same Hillview location by 2013, or had Theranos moved to another location?
I think it may have been in 2013 that we moved to 1601 California. I'm not sure exactly when we moved.
And from the time in 2010 until 2013, had the company also raised money?
I believe we raised money in 2010, and then George is a director invested in 2011, and then again, I think in the end of 13 or early 14.
Okay, so you did some fundraising in 2010, some in 2013, and then some in 2014?
Yes, I'm not sure if it closed in the end of 2013 or early 14.
So,
Sorry, when you said George is a director, you refer to George Schultz?
Yes, sorry.
so just want to turn for a moment to management of the company. So you mentioned that you and Mr. Balwani were, would it be fair to say that you were the senior most executives at the company?
We were.
This is during the 2013 timeframe, so I just want to focus on the 2013
Yeah.
timeframe. Who else were senior managers at the company at the time?
Well, you said in the 2013 time period?
Yes.
By that point, clinical lab, and on the product side, there would have been a number of technical leaders. I don't know who specifically was in leadership in 2013.
Who did report to?
I'm not sure in his offer letter, Sonny managed him as part of his oversight of the clinical labs.
And then we talked a little bit about when Mr. Balwani was hired, but why was he hired?
He originally joined our board, and at that point, because we thought we were going to really be building out these models and that the ultimate value of the company was data, that a large portion of our business was going to be being a software company, and we thought he had a really good background in software and that he would bring that leadership as we worked to build on that.
Okay, so you just mentioned that a large part of the company was the software and you were going to become a data company. So
That we
explain
thought it would be.
Okay, so
Yeah.
explain that a little bit more.
The purpose of what we try to do with Minilab and getting people access to the health data is so that they can use it, hopefully for purposes of early detection. And the way that will be realized is through models and algorithms and decision support systems. We had started with Celgene and building out those models, and we'd done it in a couple other places, and we saw that as the ultimate product for the company as we went to go toward serving consumers and physicians. And so we thought that Theranos would be a sensors and software company, and that the investment in decision support was how ultimately people would be able to use this data for early detection.
What were Sonny Balwani's qualifications for the job? You mentioned that the company was hoping to be a software company. Did he have qualifications in that sector?
He did. He built a software company, and he had worked at Microsoft and I believe Lotus when it had started out here.
Okay, and did he have any qualifications in the lab testing business?
He did not.
Or in pathology or anything like that?
Not to my knowledge.
Handing to you what's been marked Theranos Exhibit 194. Exhibit 194 purports to be an organizational chart of some sort, but at the top of that chart is you, Elizabeth Holmes, as founder and CEO, with base number TS 0000001. Have you seen Exhibit 194 before?
I don't know.
You don't know that you've seen this before?
Yeah, I don't recognize it, but I might have.
Did the company keep organizational charts for the business?
Very, very loosely.
As you look at the people on this chart, when do you think this structure might have existed? This was produced to the SEC by the company in, I believe, 2015. Would this have been an accurate reflection of the managers who were present at the company at that time?
I'm just looking at it. So, I mean, it must have been as of 2015. Yes, these people were all managers in the company.
Were there any, going back to 2013, would there be any changes to this chart for the 2013 timeframe?
Yes.
What were those changes?
Many of these people didn't work for the company at that time, and I thought of our operating structure a little bit differently than this.
How did you think of your operating structure in 2013?
I was very externally focused at that point in time, and we essentially had, we didn't have marketing or even internal general counsel at that point. We had a product organization that was really partnering with the CLIA lab to try to get assays to go live under the LDT model, and so there was sort of one thing that the company was doing at that point, which was taking these assays live in the CLIA lab.
Sorry, you used a couple acronyms then.
I'm sorry.
CLIA and LDT, could you just explain to us what those are?
Absolutely. CLIA I used in the context of referring to the CLIA lab, which was our clinical lab. CLIA is the Clinical Lab Improvement Act, which is the regulation for labs. LDT is laboratory developed test, and those are tests that are developed and validated in-house. And so that's why I was referring to essentially the product and clinical lab organization as being very tightly integrated as of 2013.
So who was in charge of that product team?
I didn't hear that.
Who was in charge of the product team in 2013?
There would have been assay leads, and I'm trying to think of whether there was a single hardware lead at that point. I'm not sure. We didn't have a senior vice president of product.
Who were the assay leads?
I'm not sure. I think his name was still there. Working really closely with the assay teams at that point, and there would have been others.
What was Sung's role at Theranos in 2013?
You know, again, it's hard to pinpoint at specific points in time. He got involved in product development and was I believe at that point helping with the core product development initiatives.
Did he have any qualifications in lab testing or in pathology?
I don't believe he had prior experience in lab testing. I had understood that he ultimately met the requirements for someone to be a lab director.
What was his background?
He had so this is my memory of it, this could be incorrect. I understood that he had a predictive modeling I was talking about for modeling biology systems, and then had experience at Theranos.
So you mentioned that you understood that he had the qualifications to be a lab director. Was he a lab director at Theranos?
He was, yeah.
What were the dates between which he was the lab director?
I don't know exactly. Certainly until we closed it. I don't know when he became the lab director.
And what was your understanding as to how he was qualified to be lab director? What sorts of degrees did he have that made him qualified to be in that role?
I didn't know specifically. I just knew that Sonny and the team that had looked at that said that he was.
And then you mentioned that you weren't sure who was in charge of the hardware, of the manufacturing side at that time. Is that right?
Yeah.
Was he still around?
I don't know whether he'd started at that point. I'm not sure.
Was there a team that was in charge of putting the chemistries onto the hardware?
I don't know.
Who would have done that?
It would have been part of the clinical lab operation.
Part of the CLIA lab operation, is that right?
Yeah, I mean, the product team, because we were focused on lab developed test, was very tightly integrated with the clinical lab at that point. Mm-hmm. I don't know if they had a specific team that was focused on that.
Okay, And the person who was in charge of the clinical lab would have been?
Yes.
How did you split up your responsibilities with Mr. Balwani?
He was focused on operations. I was focused on our vision to the extent I was involved on the technology side and inventing, and on ultimately some of the policy work, like the work to change the law in Arizona, and strategy.
Were there particular areas that you managed versus areas that he managed?
I tried to stay involved with all of the creative aspects in terms of the creative sort of invention side of the technology and the creative side of the way we were trying to change the way people thought about their right to access lab results along the line of the Arizona law that we passed. He was focused on the clinical lab operations and the internal operations of the business.
Okay, so if you look back at Exhibit 194, and I know this is probably sometime in the later time period rather than 2013, but it looks like a number of, for instance, the chief creative officer was reporting to you, the chief marketing officer, general counsel. So there were a lot of corporate functions that reported to you at that time. Was that the same in 2013? For instance, the controller also was reporting to you at that time.
I don't know where on the org chart they were. We didn't have a general counsel in 2013. We didn't have any of these. I don't think we had any of these marketing people in-house at that time. They may have been, I think they joined after that. I'm not sure who functionally was reporting to me in 2013 on the product side.
Okay, and then you'll see that there looked to be on the, and I guess as well.
Mm-hmm.
So these were all products, and assays people. Were they all reporting to you back in 2013 as well?
I don't know. I can't remember.
Was there some, even if on paper they were reporting to you or Sunny Balwani, was there often some crossover between who people reported to, whether it was you or to Mr. Balwani? How did the reporting structure work?
Yeah, we did not do a good job at maintaining org charts, and I think there was an understanding of how functionally we were operating, especially pre-2015. Which was essentially along the lines of what I described.
Okay, so you mentioned before that Mr. Balwani was overseeing the lab and some of the product development, particularly also on the software side. What were you overseeing in that process? Were you also involved in product development?
I was the CEO of the company, so I would engage with different teams. My sort of involvement, to the extent I was engaged on the product side, was mostly on the creative parts and the invention sort of side, or if we ran into challenges, could we figure out a way to solve them technically from an invention standpoint, and then on some of the other things that I was alluding to from a strategy perspective.
Were you kept apprised of developments in the products area and in the clinical lab?
Generally, yes.
Who would apprise you of those developments?
Mostly Sunny, but occasionally others.
Okay. What about the company's partnerships? Who was overseeing that process?
I had a very close relationship with Steve Bird at Safeway. Sunny managed the Walgreens relationship.
What about other business partners? Did you also similarly split up the other partners?
I would have to think of who specifically to think of who managed them. Those were, to my memory, the two major relationships that we were interfacing with at this period of time.
What about the DoD, the Department of Defense?
We had board members who were very engaged in talking to people within DoD, and then we had, I was certainly in some of those meetings, and then internally we had at least one project manager who was helping to coordinate logistics. We spent a lot of time developing technology there, but we never really focused on getting those systems off the ground because we were so focused on the retail deployments.
When you say that you were, you never got those systems off the ground, what do you mean by that?
You were asking about managing partnerships, and it wasn't the same kind of active partnership that Walgreens was.
Okay, so when you say this is for the Department of Defense projects,
yeah,
you weren't able to get the projects off the ground. Do you mean that you weren't able to deploy Theranos services with the Department of Defense in the end?
We, beside the Institute for Surgical Research and a couple others, we didn't fulfill the contract opportunities that we had.
Why didn't you fulfill those contract opportunities?
We didn't have the bandwidth to do anything except for try to make the retail relationship successful.
What were the other two divisions within the Department of Defense that you had contracts with that you were able to fulfill besides the Institute for Surgical Research?
From memory, we did a little bit of testing with AFRICOM, and we did a little bit associated with the NASA space program that someone else within DoD had referred us to.
And what happened to those relationships?
They were positive. We just didn't take any next steps with them based on focus and bandwidth internally.
Did Theranos receive any revenues from AFRICOM or NASA for those projects?
I don't think so. I don't know about AFRICOM.
But you think for NASA, Theranos didn't receive any revenues?
I don't think so.
Okay, what about, I'm sorry.
You mentioned Theranos board members were involved in facilitating your communications with the DoD. Who on Theranos' board
Yeah, and
took on that role?
I'm sorry, I meant to respond to her question about who was managing the relationships. And I made that comment in that context. Who on our board? George Schultz, primarily.
Who is managing the regulatory strategy for the company?
Again, in the 2013.
I'm just talking about the 2013 timeframe.
We tried to hire some of the best outside lawyers in the medical device and clinical lab space.
Okay, and who from the company was overseeing that process?
I don't remember specifically in 2013. I believe, I'm not sure.
Were you and Sunny Balwani jointly involved in the regulatory strategy, thinking about what approvals needed to be obtained and so forth?
Yes, absolutely.
What about the company's financial condition? Who was overseeing, for instance, I think in 2015 it looks like it's reporting to you. Was she also reporting to you in 2013?
To the extent Sunny was at the company, he primarily interfaced with her on just financial operations and cash management. So as of 2015, I'm sorry, the question was 2015?
I'm actually talking about 2013. I want to understand who was in charge of the financial conditions of the company, making sure that the operations were going smoothly, that there was enough cash. It would be Sunny Balwani.
Yes.
Were you at all involved in that process? Were you consulted?
I may have been. I mean, I had very constant interactions with Sunny.
What about human resources, personnel issues? Who was overseeing that?
I don't know when she joined for a period of time, and she may have been there in 2013.
Did she have the authority to hire or fire personnel?
She had the authority to make recommendations. I believe there's a couple instances in which she hired directly, but not regularly.
Did she need to obtain approval from either you or Sunny Balwani before she hired anyone?
That was certainly the expectation, yeah.
And what about if she needed to fire anyone? Did those instructions come from you or Mr. Balwani?
Or the manager, if there was a manager who felt that an employee had a performance issue.
Were the managers at the company who were below you and Mr. Balwani, did they have the authority to fire personnel under them without running that by you and Mr. Balwani first?
You know, it may be on the manufacturing side with assemblers, but generally we would have wanted to have been involved in those conversations.
So generally you and Mr. Balwani would be involved in firing personnel?
I think so, yeah.
How would you and Sunny Balwani communicate with respect to your work?
Just help me understand
Just the
question.
method of communication. Did you text each other? Did you call each other on the phone? What did you do typically?
All of the above. We texted. We were working in a very open space format. Our offices were near each other, and we would talk.
Were there times when you would meet face to face? And were there regular meetings when you did?
Yes, we met face to face a lot.
Were there regular meetings that were set up, maybe weekly or monthly?
I don't think they were scheduled like that. It was very sort of dynamic.
How did Mr. Balwani keep you apprised of the areas of the business that he was responsible for?
We would talk, but as you, we operated as peers, and so he would run the areas that he was operating and talk to me about the things that he thought were relevant.
So were you consulted about decisions he would be making on the product development and clinical lab side?
It depends on what they were. On some of them, yes.
Did you expect him to run those decisions by you?
I expected him to share with me anything that would be material to making sure we were properly executing on our plans.
Were there areas in which you disagreed? Yes. What were those areas?
We disagreed all the time about a lot of things. We're very different leadership styles.
And how would you resolve that discussion if you disagreed on an issue?
Depends on what the issue was. I would generally defer to him because he was there as our president and COO.
Were there areas that he would defer to you?
I'm sure there were. I would need to think specifically about a specific issue to better answer the question.
So I think we mentioned a number of different areas of the company, but for instance, on business partnerships, who would be the one who would make the ultimate decision if the two of you disagreed?
If it pertained to Walgreens, it was Sunny. If it pertained to Safeway, probably me, but it depends on what the issue was. If it had to do with something that was in a functional area that he was managing, I would defer to him.
What about the Department of Defense?
I think it would depend on what it was. Again, that was a different type of relationship than the active commercial partnerships that we deployed.
What about your regulatory strategy with either FDA or the Center for Medicare and Medicaid Services?
In general, we would defer to outside counsel on that.
Were there times when you would decide that you wouldn't follow counsel's advice?
Not during that period.
What about the financial condition of the company? Were there any, who would be the ultimate decision maker with respect to the company's operational and financial progress?
I mean, in general, Sunny was.
It sounds like you had a very dynamic relationship, and you would talk with Mr. Balwani a lot about different areas that you were working on. Were there times when you would also draft email communications to third parties? For instance, I think you said that you were in charge of the Safeway relationship that Mr. Balwani would then edit and revise before sending out?
Yes.
And did that happen in the other way around, where he would be drafting emails to third parties that you would also revise for him before sending out?
I'm trying to think of a specific instance. I mean, our dynamic was that I generally sought his advice on how to handle things.
But were there instances in which he would draft emails, which you would then review and edit and approve before he sent them out?
I wouldn't be surprised if there were. I can't remember a specific instance sitting here, but it was, as you said, a dynamic interaction.
Where on Theranos' electronic system did you keep your working files?
What do you mean by that?
So, is there a document management system at Theranos?
There is, and there's shared drives that different people have access to, as well as local document files for a given person's computer.
Okay, was there a particular folder on that shared drive that you would use to keep, for instance, notes from meetings or draft documents that you were working on?
I generally kept my documents in my document folder. My assistants also had a drive that they would put documents on.
Okay, so you had a document folder. Was this on your hard drive or was it on the shared drive?
It was specific to my computer. I think it was technically hosted on a network, but it was only I had access to it.
What did you call that folder?
My documents.
It was called My Documents?
Yeah.
Okay. And you said you think it might have been backed up by the system. Is that what you mean?
I expect it would have been, yeah.
Okay. Are you aware of a folder called the CEO folder?
Generally, I think so.
And is that the other folder that you're talking about, which your assistants would put documents into?
I think so.
Okay. Would you ever edit documents in that folder?
I don't think so.
So this folder was only for your assistants and others to put documents into?
Yes.
And would you access the documents in that folder?
I could access it. I don't know that I ever have.
I guess, what is the purpose of that CEO folder?
If we had documents from a meeting and they were trying to scan them because they were going to get rid of a hard copy, they would put them in that folder. Or other documents that they felt should go in there. They had control over it.
And did Sunny Balwani also have a working folder as well?
I believe so, yes.
What folder was that called?
I don't know.
Are you aware of a folder called the 300 folder?
I am.
What is that folder?
I think that is where he kept strategic documents, and I think he had some of his models in there too.
Did you have access to that folder?
I did.
And did you go in from time to time to review or edit those documents?
I don't think I have.
Did you ever review documents in that folder?
He would show me documents from that folder before certain meetings.
Okay. When you say he would show you certain documents from the folder, do you mean that he would print them out and show them to you?
No, I would sit in front of his computer and he would open it from that folder.
Would you ever sit at your own computer and review files in his 300 folder?
I mean, it's possible. I can't remember that, but it's possible.
But you don't think that you might have edited any of his files from that folder?
I don't think so.
So I wanted to talk about the clinical lab for a minute. So you mentioned was the lab director in 2013. Mm-hmm. Was there somebody who was in charge of the clinical lab before he came on board?
Yes.
Who was that?
I believe it was, there may have been someone in between them, but at least.
What was the clinical lab doing before it was certified?
Before it was certified.
Before it obtained CLIA certification?
Nothing.
Okay, so it was it just constructed? Was it processing any blood samples?
So the CLIA certification was in 2011, and it didn't exist before it obtained CLIA certification. Post 2011, I believe there was some what we call reference testing, which is traditional testing for Safeway while we were working to refine our operational procedures, and then otherwise we were trying to put good systems in place to launch the lab.
Okay, so you mentioned that you were doing some reference testing for Safeway. What do you mean by reference testing?
They had a wellness center at their headquarters, and they asked us to be the place that would process the samples that were drawn traditionally, and we would either process them at our lab or send them out to a reference lab and report them back to the ordering practitioner there.
Okay. And so you mentioned that the blood draws would be done traditionally. What do you mean by traditionally?
Venipuncture on commercially available machines.
So the blood would be drawn via venipuncture, and the blood samples would then be tested on third-party commercially available devices?
Or a reference lab, yes.
What is a reference lab?
It's a place where you can send samples to have analyzed by a third-party lab, and they will report them back to your lab, and you pass those results on to the ordering practitioner.
And does he have a role at the company as well?
He does.
What was his role in 2013?
I don't know in 2013. I think it was in product management, but I'm not sure.
What did that mean, product management?
I believe his role was primarily focused on managing business relationships with people who are important to the company, but I'm not completely clear. I mean, the product managers worked on sort of important projects for the company, and there was a wide range of projects that they worked on.
Who did he report to in 2013?
He reported to Sunny.
And you mentioned there were a number of project managers.
Mm-hmm.
These were project managers that reported to...
They reported for a period of time, I don't know when, and then directly to Sunny after that.
Who were these project managers?
I'm not going to get them all by name. At what period of time?
In 2013.
I believe was there at the time. There were others. I don't remember them all by name.
I just wanted to go through each of the people that you just named and just
Yeah.
understand what they were responsible for. So
Sure.
I think you mentioned first. So what was his role?
So I outside of knowing that Sunny was using them to help manage key projects, I don't know specifically what they were doing. I believe they were generally involved in retail operations and management of relationships, but I wouldn't be able to say that it was doing this and Sunny was doing that.
Were you familiar with what he's doing?
He worked closely with me in supporting meetings that I was doing and communications.
Okay, what kind of meetings was he involved in?
Broad range of meetings. It could have been with partners, with investors, with others. I don't know if he was working closely with me yet in 2013. He was before he left.
What about?
Again, I believe operational projects related to the retail rollout.
You mentioned what was his role?
I believe same thing.
And
Yep.
he was also an operations person?
I don't know what he was doing in 2013.
What about, is he also a project manager, or was he also a project manager in 2013?
I don't know that he was. He was working within the software organization, and I don't know exactly what he was doing within 2013.
And when you say software organization, what do you mean?
We had a team that we called the software team, and he was part of that team.
And who did he report to?
Up to Sunny. I don't know if he directly reported to Sunny.
Did all of these project managers have a prior relationship with?
Not all of them. Some of the ones that I just listed did.
Okay, what was that prior relationship? Were you involved in hiring all of them?
I was. That group, yes.
That group, yes. Yeah. When did you hire them?
I don't know. I think 2011, maybe 2012. I'm not quite sure.
Why did you hire them?
Because we were working 24/7 almost, trying to do something good, and we needed people who wanted to work that hard and would put their heart and soul into it.
Did you use the project managers as sort of a liaison between you and Sunny Balwani and other employees at the company?
No, not to my knowledge.
Were there specific areas that the project managers would be overseeing, sort of a way for you and Sunny Balwani to delegate particular responsibilities to another group of people?
I don't know specifically how he was using them. I don't know.
How did you use them? I
The
think you
only
mentioned
one-
you had a relationship with.
Yeah, I used him generally for follow-ups.
What do you mean by you used him generally for follow-ups?
In a support role, so if we had a meeting, setting things up for the meeting, making sure if we needed to send a note to follow up on the meeting, the note was sent, those types of things.
Was he also having communications directly with, for instance, some of your business partners or even the Department of Defense?
I think he did, yeah.
Okay, what kind of communications was he having with them?
I mean, it was many years, so I'm sure it's a broad range. Generally coordination with different people who we were interfacing with.
So when you say coordination, do you mean coordination of meetings?
Coordination of, I mean, it could be meetings, could be discussions, could be follow-up, could be response to a request.
Would he run, every time that he was communicating with them, would you expect that he would run that by you first?
I wanted generally for him to do that. He did not always do that.
Okay. Were there times, though, when he would send you, for instance, draft emails that he was planning to send out to a business partner that you would then review and edit and send back to him?
I'm sure there were, yeah.
We've been going a little over an hour and a quarter. Should we take a short break?
Let's take a look. I just have a few more questions and then we can take a break.
Okay.
So, did you have regular meetings with the project managers?
I did not, to my memory.
Do you know if Sunny Balwani did?
I would expect that he would have. I don't know whether it was meetings that were regularly scheduled.
Okay, we can take a quick break now. Okay. Take a...
This concludes Media 1 of Elizabeth Holmes. We're off the record at 10:16.
Okay, let's just take a 5-minute break.
Yeah,
So
you can. We are back on the record at the beginning of Media number 2 of Elizabeth Holmes. The time is 10:30.
And Ms. Holmes, I just wanted to confirm, we didn't have any substantive conversations during the break, did we?
No.
Okay, and I just want to make that give you that question after every break, just to make sure that nothing was said off the record.
Absolutely.
Okay, so I'm going to hand to you what's been marked as Theranos Exhibit 195. For everyone else, this is tab 10. Exhibit 195 purports to be a document entitled Theranos Confidential Summary Capitalization. The starting base number is TS-000603. I'll represent to you that this was produced by Theranos to the SEC as part of a binder that was provided by Theranos to Rupert Murdoch when he was considering whether to invest in Theranos in December 2014 and January 2015. the cover letter to the binder states that it was signed as of December 4th, 2014. Have you seen Exhibit 195 before?
You know, I didn't recognize this first sheet sitting here now, but I'm sure I did.
What is Exhibit 195?
It looks like our cap table, and behind it a series of projections.
Did you review Exhibit 195 on or about December 4th, 2014?
I don't have memory of whether I reviewed it at that time, but I know I've seen it.
So I'm actually just going to start on the first page, which is 603 is the Bates number at the bottom.
Yes.
Is this an accurate reflection of Theranos' capital raising since the company was founded?
As of what period of time?
I guess as of 2013. That's a good point.
As of 2013. No. I think this was as of a later period of time.
Okay. So what was the date at which this document was prepared then?
The C2 didn't happen until I think 2014 was the first part of the C2.
Okay. So you think that this is an accurate reflection of the capital raising the company did as of 2014?
No.
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 Okay. So what happened in 2014?
Oh, I'm sorry. As of 2014, I was missing my years. Yes, I think that as of the end of 2014, this looks about right.
This looks
Yes.
about right. Okay.
Yeah.
And how much was raised during the C2 round?
It was several $100 million. I don't know exactly the end number. I think it was over 500 million.
Okay. So if it was over 500 million, then do you think that this chart maybe isn't an accurate reflection? At least it doesn't include some of the C2 round?
Correct. It doesn't include some of the C2. I don't know exactly when this was prepared and what period of time it was supposed to be reflective of.
Okay. But you think that the total for the C2 round would have been something like over $500 million?
I believe so.
So I just want to focus for a period on the C1 and C2 rounds. What were those financing rounds? What was the purpose of raising money during those rounds?
So they were different at different points in time. C1, we began developing strategic relationships with long-term shareholders, and some of the hospital systems that we wanted to partner with came in through a fund. And then C2, we had decided that we wanted to try to structure Theranos as a private company, and we were looking for family-owned businesses or family-controlled companies and leadership who wanted to invest in something for the really long term. And we identified a group of people to try to bring in for that.
So you said for the C1 round, I just want to make sure that I understand. For the C1 round, that was mainly money coming from strategic partners like hospitals and
when it started,
businesses?
yes. Yeah, I mean, we had also another family that invested through one of the funds that came in C1, and then a couple of the hospital systems that we were hoping to partner with came in that as well.
Which family came in C1 that you're thinking of?
It was family.
Okay. And did family and the hospital systems, did they all come in through Pure Venture Group?
They did.
What is Pure Venture Group?
It is a fund.
What was your relationship with them?
For a long time, and I met him through.
Okay. And so how did that relationship come about? Who initiated talks of potentially investing in Theranos, and what happened? How were you able to get that investment from Pure Venture Group?
So the first one was in 2010, so I don't remember specifically, but my memory is that had expressed interest about investing in Theranos, and specifically sort of having a fund that focused on investing in Theranos, and strongly encouraged me to meet with him and the people that I think he was working to raise money from, and to invest.
Okay, and then you mentioned for C2 that was mainly for you to raise money in order to establish a long-term shareholder base. Is that right? Can you explain a little bit more about that?
Yeah, over a period of time, we became convinced that becoming a private company for the long term would best allow us to do something that was going to be a very long-term venture. And so we were trying to find investors who wanted to invest in private companies and wanted to make really long-term investments, and generally who had built family companies. And so we identified a series of people who had done that and went to meet with them to talk about this vision. And so that was the majority of the C2.
What was the money that you raised during the C1 and C2 rounds used for?
A lot of R&D and operational investments. Like we built a big manufacturing facility in Newark, California, where we do our own injection molding and machining and reagent production, and I think primarily those two things.
Going into both of these rounds of financing, did you have a particular target that you were aiming to raise? And what were those targets?
I don't know. I'm sure we did. I can't remember exactly what the numbers were. I think it was also a bit dynamic in terms of responding to interest and people who had expressed interest in being shareholders in the company.
So if you look at the price at which the shares were sold during these two rounds, the first C1 round that took place in 2010, the price was $3 a share. The second C1 round, it went up to $15. What precipitated the change in price?
So my memory is that was a price per share that was established through the relationships with the retail pharmacy partners who were thinking about what the value of Theranos could be if we had these retail frameworks in place, and that's where that number came from.
So are you saying then that the retail partners actually valued Theranos at the $15 a share?
I don't know if they valued it, but to the extent there were provisions in the contract that gave them potential rights to equity, that was the value that they put on the equity rights that they had.
Who came up with the $15 per share valuation?
I don't know. I'm not sure.
Was that a number that Theranos requested of its retail partners?
You know, I don't remember. I know there was a lot of work with the retail partners to create models together of what this could be. I'm not sure who settled on that number in the end.
Was it negotiated?
I don't think so.
Who would know the answer to that question?
I mean, I assume our team could look back at documents and try to figure it out. I don't remember. I'm not sure.
Would you have been involved in those discussions with your retail partners?
I would have, yes.
Would Sunny Balwani have been involved?
Yes.
Okay. I'm going to hand you another document. You can put that one aside. handing to you what's been marked as Theranos Exhibit 196. Exhibit 196 purports to be a spreadsheet. The title at the top is detailed 2917. Starting base number is TS-0558077. Have you seen Exhibit 196 before?
You know, I don't remember seeing this version, but I recognize it as our cap table.
Did you review Exhibit 196 on or around February 9th, 2017?
I don't remember doing that.
I'll represent to you that that's the date at which that appears on the document, and would have been around the date that Theranos produced the document to the SEC.
Yep. So
I want to focus on some of the C1 and C2 investors on this list. So if you go down, there's an investor called Bendel Fund. Do you see that on the first page?
I do.
And they invested, let's say, in 249,998 shares in the C2 round. Who is the Bendel Fund?
I believe this is he's an individual company.
How do you know him? Or how did you get to know him?
I met him through this process of trying to find family-controlled companies and investors, and I'm trying to remember who made the introduction. He knows a number of people affiliated with the company. I'm not quite sure who made the final introduction to him.
Who does he know at the company?
He knows some of our investors. He knows some of our board members specifically. I'm just not sure who made the first introduction to him.
Who are the investors that he knew?
My understanding is he knows most of our C2 investors, the other large family investors.
What about Central Valley administrators? Who are they? It's on the second
So I
page.
think that Walgreens introduced us to when they were talking about deploying in California.
Who's okay? And why was he interested in Theranos?
I think he really believes in the need for lower cost, more distributed testing.
Were you in talks to partner with him in any way?
It was our hope that had we deployed in Los Angeles with Walgreens, we would work with his physician groups.
So was he also considered a strategic partner, a possible strategic partner?
Yes.
So in other words, even though he invested in the C2 round, it looks like there were also opportunities for strategic partners to come in the C2 round in addition to some of these families.
I'm trying to think if there are any others beside him. I know generally the focus of C2 was the families. But had there been a strategic, I mean, there's no reason why we wouldn't have looked at that in the context of involvement.
If you turn the page to page 3, what about Dynasty Financial? It's also a C2 round investor.
I believe that's the DeVos family.
The DeVos family. How did you know them?
I met them at a conference for family-controlled companies, and I talked to them about our vision.
What conference is that?
That was the conference. I think it was in Chicago.
And so they invited a number of family offices to come for a conference?
I think so, yes.
When did that happen?
In the fall of 2014, or maybe winter of 2014.
Why did you attend?
I was asked to speak at it.
What did you speak about?
Had asked me to serve on a panel, I think, about innovation. I don't remember what I talked about. I'm sorry.
You don't recall what you talked about at that conference?
I don't. I mean, I guess. I don't remember it specifically.
Did you meet the DeVos family at that conference?
I did.
Who was your main contact there?
Initially, it was now.
Who's?
She's. My understanding
And
is her boss.
Is he? Or?
I think so. I'm not sure.
What about Hall Black Diamond 2, which is towards the bottom of page 3? Who are they?
So that is a fund that was created for one of the limited partners of Black Diamond to be able to have direct holdings in Theranos.
And who?
Black Diamond, and I think a successful business person.
How did you meet him?
I believe I met him after he had invested in Black Diamond's fund that invested in Theranos, so through Black Diamond.
And was there somebody else at Black Diamond that you knew prior to this relationship? Who? If you turn the page to page 4, at the very top, who is?
That is, my understanding is it's the foundation affiliated with his family.
And who's?
He's a businessman.
When did you first contact with him?
I think in 2014, but I'm not completely sure.
How did you meet him?
I met him. I think I met him at someone's house, and we started having a conversation about healthcare.
Do you recall whose house you met him at?
I think it was a Silicon Valley venture capitalist.
What did you talk about?
We talked about the need to make lab testing lower cost and more accessible, and the need to invest in technologies that can leapfrog over traditional lab infrastructure, kind of like cell phones did over landlines, and how important that's going to be for healthcare.
Is he in the healthcare business?
He is, yes.
What is his business?
And also a number of other businesses. He owns retail grocery stores that include pharmacies and many other businesses.
Did you ever have any discussions about partnering with his businesses?
We did.
And how did those discussions go?
They were very positive. He has a foundation that we've interacted with most closely that's talked to us about a number of different projects, including our current focus on Zika virus testing in low-income and distributed areas.
Did you end up entering into a contract with him or his companies?
I don't know if we have a contract with their foundation. I'm not sure. Not his laboratory business.
Okay. Let's turn the page to page 6. Towards the top of the page, there's an investor called Stanhill Financial Company, Sandbox Co-Investment Fund. Who are they?
So I think these are two different ones.
Oh, they're two different ones.
Yeah.
Okay, then I am asking about Sandbox Co-Investment Fund, since they're a C1 investor.
Yes, so they are, as I understand it, the fund that manages the investments for the Blue Cross Blue Shield Association.
And how did you get in contact with them?
So this is, I think, in 2010, and I'm not sure. I think it was our board member Robert Shapiro was an advisor to the Blue Cross Blue Shield Association Fund and part of Sandbox, and I think he made the introduction. It may have come from somewhere else, but that sounds right.
What was your understanding of why they were interested in investing in Theranos?
Because the lab companies have been charging them at extremely high rates, and they've been negotiating for years to try to break up the duopoly of pricing between Quest and LabCorp, and they thought that we could build a lab company that would offer really low cost testing.
And then further down the page, Soda Spring Partners. Who are they?
That is Alice Walton, part of the Walton family.
Part of the Walton family. And how did you get to know the Walton family?
I can't remember the first introduction. I think my first contact with them was with Greg Penner, who's the chairman at Walmart. I don't know who introduced me to him. He was certainly one of the families that, as we brainstormed on who were the types of people that would want to be part of taking something like this on, that we thought about.
I think you just said he was one of the people, so do you mean the Walton family or do you mean Walmart?
Well, what I was referring to was that the Walton family is one of the great, sort of family-controlled businesses that's been built in this country. We absolutely were also interested in the relationship with Walmart, and that was early on part of our discussions with Greg.
Part of your discussions with Greg were to potentially partner with Walmart in the retail pharmacy space?
Yes. And specifically, I think he wanted them to evaluate the promise of this.
Did you ever enter into a contract with Walmart?
I don't think so.
Did you have any other business relationship with them, aside from having these discussions?
Prior to meeting Greg, we'd had a fair amount of interaction with them. There was no formal contract about how you would roll out. The concept was $4 lab testing, like they'd done $4 pharmacy prescriptions.
Okay. And did anything come of that? Did you end up either piloting or rolling out any services, even if you didn't have a contract?
No, we were prohibited under the terms of our Walgreens and Safeway contracts initially from doing that for some period of time.
Did Greg Penner introduce you to Alice Walton? Or did someone else introduce you to the Walton family members?
I believe was the point person for Alice. I met Alice at a dinner separately. I think she was sitting near me. But I know works with her.
Did you ever meet Rob Walton?
I did.
What do you recall about that?
I recall talking to him about this concept of $4 lab testing and the vision for what we were trying to do in the lab space in terms of access to health information. I recall telling him about the technology we were working to implement, and I recall initially focusing on what this could be if we did have the opportunity at some point to partner with Walmart. And then later he became an investor. He's Greg's father-in-law.
How did he become an investor?
So
You mean what vehicle?
Yeah, or is he, is he on the list, or was there an entity invested through?
Yes, the Madrone entity is him and Greg and the associated fund partners.
So in looking through Exhibit 196, we actually noticed that Rupert Murdoch doesn't appear on here. Do you know why? Is he an investor? Or was he an investor in Theranos?
He was an investor in Theranos, yes.
Oh. Was he taken out? Is he still an investor in Theranos today?
He is not.
Is that the reason why he doesn't appear on this list?
I don't know why he doesn't appear on this list.
Do you know who prepares, the capitalization table for Theranos, or who maintains it?
It's changed over time. It used to. I think now it's done by one of our legal firms.
Okay. But in the 2013, 2014 timeframe, it would have maintained it?
I believe so, yes.
So were you involved in discussions with the investors in the C1 and C2 round to invest in Theranos?
I was.
What was your involvement?
I would talk about the kind of company we were trying to build, talk about the vision, talk about why we were interested in structuring this as a private company and sort of the long-term nature of it, and what we thought we have the potential to do here.
Were you involved in providing materials to them for their due diligence purposes?
I was involved. Just so I answer the question correctly, what do you mean by that?
So were you aware that these investors would sometimes request materials or documents from Theranos?
Yes.
And were you involved in compiling that information or collecting that information for them?
I don't know if I specifically did that, but I knew that the materials were going to investors.
Okay. Would you review those materials or documents before they were sent to investors?
You know, I would need to think about a specific instance to be able to speak about it specifically. I certainly was generally aware of the types of content that we were sending to investors.
What were the types of content that you were sending to investors?
I mean, we had a very informal process in place, which was decks that we used for a number of different purposes in terms of slides. We would share. They had data on the performance of our chemistries. We would share other information that we thought just gave people a perspective of what we were trying to do. Right? It was a startup, so we didn't have the systems in place to do this in a formal way.
Would you sometimes be the person sending the materials to investors, either through email or?
I could have been. I can't sit here and say I remember a specific instance in which I did, but it wouldn't surprise me if I did.
What was Sunny Balwani's role in those discussions with investors?
I would generally do the first meeting or two and talk about the vision, and then he would follow up on any questions that they had from a diligence perspective and provide them with that information.
Did he attend those initial meetings that you had with investors?
Most of the time, yes.
Did he participate in those meetings? Would he be presenting material as well, or was it mostly just you talking?
The meetings that I was in, which were sort of the initial meetings, we didn't frequently present anything. It was just discussion, and yes, he would be involved in the discussion as well.
Was there anyone else from the company who was involved in those investor discussions besides you and Mr. Balwani?
I'm sure there were others in the room for certain meetings. I would need to think about a specific meeting to be able to talk about who else was in there.
Okay. Would there be others who would be making a presentation to investors during those meetings? So I'm more interested in the people who would have been speaking at those meetings. Can you think of anyone who would have, besides you and Mr. Balwani, who would have been speaking at those meetings?
I mean, if you give me a specific meeting, I could try to think back to it. There's a lot of meetings over a period of many years. We had people we generally tried to respond to any questions that an investor had. So if they wanted to focus on a specific area, we might have had people who were specific to that area engage. But I can't sit here and recall a specific example.
Were there particular areas that you would present on and particular areas that Mr. Balwani would present on? And what were those areas?
Yeah, I presented the vision, right? What we're trying to build, what we've invented, and what we think it could do. Sunny would present on our projections, what we thought it could mean financially, and on the operations of the business, whether it be on manufacturing or the clinical lab.
When you were sitting in meetings with Mr. Balwani and you're having these discussions with investors, were there times when Mr. Balwani would present something to investors that you thought was not right or inaccurate?
I don't remember an instance in which that ever happened. I generally understood at least what I saw to be the assumptions behind how he characterized our potential.
So when you say you saw the assumptions behind how he would characterize your potential, what do you mean by that?
I mean, our projections were generally based on an assumption that we would have a certain retail footprint, and I knew that we had the ability to get that footprint if we executed, and so I assumed that those numbers made sense in that context.
So you would have reviewed the assumptions before Mr. Balwani was presenting these financials to investors?
Not necessarily. I'm sure sometimes I did, but not as a necessary normal operating cadence.
But you can't think of an instance in which Mr. Balwani would have presented, for instance, the financials to investors that you thought was incorrect or inaccurate?
You're talking about the projections?
I'm talking about the financial projections now, yes.
Not at that time, no.
Can you think of any instance in which Mr. Balwani made any other inaccurate or incorrect statements to investors, setting aside the financial projections?
I mean, not when I was in the room, not that I can remember.
Had he made an inaccurate or incorrect statement to investors, would you have corrected him?
Absolutely.
And were there times when Mr. Balwani corrected you while you were making your presentation to investors?
I mean, he was not shy about jumping in on things that I would say, so he was definitely very vocal in those meetings.
Was there ever a topic in those discussions with investors in which you felt like you were not sufficiently familiar with it and so couldn't speak to it?
Me personally?
Yes.
For sure.
What were those topics?
I mean, this is why I deferred to other people on the operations of our clinical lab, on our operational infrastructure internally in terms of production, on financials and financial modeling. I didn't have any training or background in that.
Were there any other areas?
I'm sure there were. I mean, I try to be good in a couple of things, which generally have to do with inventing and sort of ideas and vision. I tried to surround myself with people who I thought were better than I was in other areas.
What about the product development area? Were you sufficiently familiar with that area to be able to speak to investors about it?
Insofar as the architecture of our technology, like the idea of, for example, putting a robot in a distributed testing system, yes. Insofar as how to interpret the data or the standards, I relied on our teams.
Okay, and so I think you said two things. In terms of the data and what standards should be applied, you relied on your teams. So who was in charge of those two things at the company?
So it depended on what data and what standards. From the perspective of R&D, it was our development or product leads who were the different team leads that were in place at different points in time. From the perspective of our clinical lab, it was...
So in the 2013 timeframe, that would have been, are you talking about, was there another person that you mentioned earlier?
Yeah, I'm trying to go back and remember who the team leads were in 2013, because it evolved and we were generally trying to promote these scientists from within. Mm-hmm. But yes, those are the types of people who would ensure that the assays were developed to the standards that we thought we were developing them to.
Okay. And then you said the lab director for the clinical lab. So was that then in the 2013 timeframe?
At that time, yes.
Okay. Would you be kept apprised of what assays had been developed over the course of time? Was that something that you would be apprised of?
It was, yes. I mean, we had sort of tracking spreadsheets at different periods of time to say, okay, how many assays have sort of hit these different steps that we thought were required to develop and validate the assays.
And then would you also be kept apprised of how many of those had been transferred onto the hardware, onto the devices, the analyzers that would be analyzing the blood samples?
I don't know that we ever tracked it like that. We always thought about it as you're developing chemistries that could work on small samples and with these standardized tube types, so you didn't need all the different color tubes. And then you could put them onto different hardware platforms. And that ultimately became a business decision around the business model that we decided to go with.
So you just said that you didn't really think about that too much, but why wasn't that important to the process, actually putting the assays onto the machine? Because the machine is the device that would actually be conducting the testing.
Well, you first need to know what your deployment is, right? So if you're trying to deploy for a pharmaceutical clinical trial and you're trying to put machines in a distributed setting, then getting those assays validated on those machines makes sense. And during that period of time, we were mostly trying to develop a wide assay menu to show that this belief we had that any of these chemistries could be made to work with small samples was possible. And so that was our primary focus. And then when it became time to go into the clinical lab, we focused on putting them onto the specific hardware platforms that we decided to put them on.
So were you kept apprised as to, so you said at some point it was important to actually validate the tests.
Yes.
But were you apprised of that process and how many tests have been validated on the platforms?
I think generally, yes. In terms of like the total number of tests that we were working to bring up in the lab initially is what I'm thinking about.
So generally you were apprised of the number of tests that were validated on each of the platforms?
I don't think I knew specifically how many were on each platform. I knew, for example, when we launched, that generally we were working to bring up a menu of 70 tests on fingerstick, and we thought that would cover the ordering patterns we were going to see. I knew that there was certain general numbers on different platforms, but it wasn't like, okay, today something came up on this platform and I was alerted to that.
Okay, and were there any areas, going back to my question about areas that you weren't familiar with to speak with investors about, were there any areas that you had an understanding Mr. Balwani wouldn't have felt familiar with or comfortable talking to investors about?
No.
So he would have been familiar with all aspects of the company, including, for instance, the vision and the mission of the company as well?
Yeah, I mean, he's very confident, and he was confident that he was able to fill the role that he was in and supplement the knowledge that he needed with other people.
So you can put that aside now. So I want to go back to the 2010 time period for the time being. And I want to start by asking sort of a series of questions, but if I use the word analyzers, would you understand that that's what I mean is the device that's used to process blood tests?
Yeah, and I would then ask you which
ones? Analyzer.
Yeah.
Okay, so I think we'll go through, and it would be helpful if you could actually explain what the different devices are and the versions. And if I'm not being sufficiently clear, please let me know if I'm not being clear.
Sure.
So in the 2010 time period, I think you mentioned previously there were two devices that had been developed and that were in use. There was the 3.5 mini lab and the 4 series mini lab. Do you remember that testimony earlier?
Yes.
Okay.
And just to be clear, that's referring to what I'm sort of generally referring to as this mini lab family, or the devices that were intended to be distributed.
Okay. So And then you mentioned there was also a 3.0, but that was similar to the 3.5 version.
Yes.
But we're not sure as to what the differences are between those two versions. Do you have any understanding?
I don't know specifically.
Okay. So starting with 3.5 machine, was that the machine that you believed would be used for clinical testing, or was ready for clinical testing at that time?
In 2010, we're talking about?
Yeah, I'm just talking about 2010.
Used for clinical, what do you mean by used for clinical testing?
Well, in 2010, were you thinking about getting into a relationship with Walgreens and Safeway and thinking about rolling this out to retail pharmacy partners?
We were.
Okay, so that's the clinical testing that I'm thinking of.
Yep.
So, well, let me step back. So the 3.5 version, was that the version that you were thinking would be used for clinical testing purposes at the retail pharmacies?
At that time, we believed it could be.
Okay, you believed it could be. What do you mean by that?
What I understood as of that period of time is that the standards that were required to satisfy the assay criteria for a pharma trial were the FDA standards, I thought, and the FDA standards that meant your data was good enough for clinical decision making. So we believed that the exact process that we'd gone through for validating the assays there would allow it to be used in a clinical setting. We knew you would need to get the CLIA waiver and regulatory approval from the FDA.
Okay. I'm sorry, so you said you knew that you needed to get approval from the FDA?
Yes.
Before using it for clinical testing?
Yes.
This was back in
a distributed setting.
In a distributed setting. So
Yeah.
what do you mean by distributed setting?
Outside of a certified clinical lab.
Okay. And we're talking about 2010. Is that right?
I think so.
Okay.
I think so.
And then you mentioned that your understanding as to how the machines needed to be validated was how they were validated for the clinical trials you were doing for pharmaceutical companies.
Yes.
Is that right?
How the tests were, yes.
Okay. So what was that validation process that you undertook for the pharmaceutical companies?
My understanding was that there's an FDA guidance document on a series of steps. There's like 15 steps on sensitivity and specificity and other measurements that ensure that the data is good enough to be used for clinical decision making. And at that time, we thought that was what was in our development reports and what was going to be required for FDA submission.
Okay. And who was in charge of the process of validating the devices to make them ready for clinical testing? Who was overseeing that process?
In 2010?
In 2010.
I don't know. We always think about it in terms of tests, not devices, and I again defer to whoever was leading the assay initiatives at that time.
Who was leading the assay initiatives?
I can't remember in 2010. I don't know.
Who would know who was in charge of that process?
I'm sure we can look back and tell you. I don't know if Sunny would remember. We could talk to some of our other scientists internally.
Okay. And then on that version 3.5 mini lab,
Yes.
I think you mentioned previously, earlier in testimony, that that version could conduct, you said, tens of tests?
I think so.
Okay.
Yeah.
What? And I think we talked about how that was something less than 100.
Yes.
What types of tests could it conduct?
So that version of the device was focused on a method called immunochemistry, and it was running those types of tests for, I believe, small molecules, proteins, maybe metabolites, and antibodies. I'm not completely sure.
So what about, and then I guess we talked a little bit about the 4 series as well, the 4 series mini lab.
Yes.
So I think you mentioned that that was in development and there were different sectors that were being developed in the machine. Do Do you remember that discussion?
I do.
So what was being done with the 4 Series mini lab?
So the core of our invention was the concept of taking a robot that could replicate what a human does and putting it into a small box that could be used outside of a lab. The 3 Series detected the signals from the chemistries through one form of detection called luminescence, which is measuring light, measuring photons. And what we wanted to do was add other detectors or capability of other light forms like fluorescence. So we were mounting other detectors around it, and that's what the 4 Series is.
Okay. So what could the 4 Series test in terms of, like what were the numbers of tests that the 4 Series could perform at that time?
I don't know. I think I'd be guessing. Yeah.
Could it perform any number of tests?
We had essentially, I mean, my memory is we'd essentially shown proof of concept of the ability to do what I just said. I don't know how many chemistries we'd actually put on it at that time.
Yes. So just to understand the adding the additional, let's say the fluorescence capability.
Yep.
Would that enable the 4 Series to conduct tests in theory beyond the immunochemistry set? Is that a fair understanding?
Yes, and most importantly, we were trying to invent a platform that could do, the objective was anything that a lab could do, so we needed the full range of options that are in a lab so that if a test came along that we hadn't tried to develop yet, we had a box that could do it, right, architecturally.
And I mean, just broadly, what kind of tests are immunochemistry tests?
So those are the ones I was talking about: proteins, antibodies, small molecules, drug levels, could be metabolites, essentially anything that you bind to with an antibody.
And then what were sort of, other than the category of immunochemistry tests, what were the other kind of categories of tests that were sort of in that universe that you wanted to have the architecture for the 4 Series?
Yeah, and so just to be clear, immunochemistry is a method, right? It's not a category of tests.
Okay.
There's many different types of tests that can be done with the method of immunochemistry. We wanted to be able to do essentially a broad range of methods, right? So we wanted to have what's called a microscopy method for imaging of cells. We wanted to have fluorescence as a readout for measuring RNA and DNA for pathogen detection. And I can list the other detectors that were in there and what they're for if it's useful.
Sure. That'd be great.
Okay. So imaging, fluorescence, microscopy, we still had the luminescence capability and absorbance. So it's essentially the full range of readouts. What we were trying to do is take the lab and put it in a box, right?
Did you ever use that phrase when talking to other people, lab in a box?
I wouldn't be surprised if I did. I can't sit here saying I remember a specific conversation. Yeah, we most often talked about the concept of mini lab, which was miniaturized laboratory.
So I want to skip forward then to a few years later now, and we're talking again about 2013. Mm-hmm. So tell us what devices Theranos had developed to process blood tests at that time.
So when the clinical lab went live, which I believe was in, I think we did our first sort of official patient testing around the end of October 2013. The date is probably not exact. We had both our 3.5 mini lab devices, as well as what we called at that time high throughput platforms, which are open systems that you can put your proprietary protocols on to run small sample testing. And so those included a number of different devices, one of which was the Advia 1800. There was a cytometry one that was made by Becton Dickinson, and I believe there was a couple others.
Okay, so just going back, so you said there was the TSPU, or the mini lab. What are we calling it at this time?
At that time, we were calling it the TSPU.
Okay, so there's the TSPU. Which version was it?
I believe that was the 3.5 version.
It's still the 3.5
Yes.
version. Okay, and how many tests could be run on the 3.5?
Do you mean how many were run in the clinical lab or could be run?
I mean, how many were validated to be run for clinical testing?
I believe that we brought up about 15 in the clinical lab at that time.
About 15?
Yes.
Okay, and what time frame in 2013 are you referring to when you say about 15? Are you thinking about before the launch of Theranos services in Walgreens?
I was thinking of sort of the initial launch of the services in Walgreens. So when the lab formally started seeing patients through to the next few months, let's say 3 to 4 months after. I don't know exactly when the tests were validated in that range.
Okay. So you think about 15 tests were validated on the TSPU 3.5. Yes. And then you mentioned there were other open platforms, including the Advia 1800, some machine that was manufactured by, what was it, Beckman?
Yes.
What's the name of the company?
Not the Advia, but there was another one that was manufactured by Beckman Coulter.
Coulter, okay. So what did Theranos do to those machines?
You know what? It could have been Becton Dickinson. I'm sorry. I'm not sure. One of the two.
Okay.
Yeah.
So what had Theranos done to those open platform machines in order to make it capable for these machines to be processing tests on smaller samples?
Yeah. So different modifications for different platforms. Speaking about the Advia specifically, we had taken our protocol, which is essentially our formula for how to make the chemistry work with a small volume, and as I understand it, overtaken essentially the software in the instrument to implement our protocol, and then we modified the physical hardware. There's little cups that are used to contain the sample, and one of the reasons that people take so much blood in blood testing is that those cups have a lot of loss. So even though you only take out a tiny amount, you have to leave behind a lot of loss in the cup. And so we changed the geometry so that you didn't have that loss. And then on other open platforms, like for the cells, it was our chemistries that were run on them too. So we actually made like the antibody in the chemistry that binded to the cell that lit up to go into the assay.
Okay. So the Advia 1800, you mentioned a couple other machines that were made by another company. These were all machines that weren't manufactured by Theranos. Is that right?
Correct. We purchased the machines and then we modified the hardware.
We modified the hardware. So, so we might be talking about this a lot during today. So if I said, if I refer to these machines as third-party commercially available machines, would you understand that I'm talking about the Advia 1800? Anything that the Theranos had not manufactured? Would you understand that?
So I think it's important to distinguish that there were also actual third-party commercial machines that were not modified that were in the laboratory as well.
Okay.
So we had both platforms that we were doing hardware modifications as well as unmodified commercial machines.
Okay. So it sounds like there were 3 categories of machines then, right? There's the TSPU 3.5 version that Theranos had manufactured.
Correct.
Is that right? And then there was the some third-party commercially available machines that Theranos had modified.
Correct.
And then there were also just other third-party commercially available machines that Theranos had purchased in order to conduct testing. Would that be via
Yes.
venous draw?
Yes.
So these machines would be conducting testing in sort of the traditional venipuncture way.
Yes, and I believe there was also a couple of point-of-care devices that were in the lab. Like, I don't think it was a glucose meter, but kind of like a glucose meter. But they were commercial, unmodified. You just wouldn't be putting venous blood on them. Does that make sense?
Okay. I think I understand that.
Can I ask for just a clarification on the hardware modified commercially available devices, sort of that second category that you just referenced?
Yes.
And you mentioned the hardware modification was, I guess that the modifications were sort of the software programming the machine and then the geometry of the cup. Is that fair?
Yes, and on other instruments, it was also our, what I sometimes call chemistry, which is essentially we did the work to make the antibody or the binder, and then we made all the other reagents, like for the cytometry assays, and then put them on these platforms that could then run our tests.
Earlier we sort of talked about the idea of a consumable being what was put in the device.
Yes.
Is the modified geometry tube, for lack of a better word on my part, is that sort of also a consumable for that platform?
It is. I was speaking specifically to the conversation about the TSPU and what a consumable was to it, but there's consumables there and there's other consumables like the nanotainers.
Okay. And is it would you consider at the time a reagent to be a consumable as well?
No.
Okay.
Yeah. I don't think so. I mean, I wouldn't now.
So we've been going about an hour. Can we take another break, short break?
Sure.
We're off the record at 11:30. We are back on the record at 11:46.
Ms. Holmes, did you have any substantive conversations with the SEC staff during the break?
I did not.
So we were talking about modifying some of these third-party commercially available machines in order to test smaller samples before we left on the break. When were these machines modified?
So I believe the way I think about it is the implementation of our protocols onto them happened in 2013 before the clinical lab went live, I think.
Okay. And why did Theranos have to develop these modified protocols during that time period?
Well, just to be clear, the protocols themselves date back to our original inventions in like 2005. The reason that we had to implement them on those open platforms was because we needed to process large numbers of samples in a centralized lab environment, as opposed to the TSPUs are designed to be near a patient and process one sample at a time, and I think it takes like 30 minutes to an hour per sample, and we needed to be able to run a lot of samples at the same time in a centralized setting. So that was why we were trying to figure out how to do this in a high throughput way.
So the TSPU could only process one sample at a time?
That's right.
Okay, and you mentioned how long would it take to process that sample?
It depends on the chemistry. It could be anywhere from 18 minutes to an hour.
And I think you mentioned...
It could be different times too. I mean, it varied per test.
Okay. You mentioned before we took the break, at the time in 2013 when you were getting ready to launch Theranos' services through Walgreens, that the TSPU was validated to run about 15 tests. Do you remember that earlier testimony?
I do, and again, forgive me, I think there were 15 tests in the clinical lab that were validated on the TSPU, if that makes sense.
Okay. What,
Yeah.
what was the distinction between what I was saying and what you were saying?
Yeah, sorry. The way that I think about it is that the TSPU itself, we had thought at that time was validated to run a lot of tests, which, at one point we got up to about over 300 chemistries that we developed, and many of them, like 90 or so, I think were actually on the TSPU. 15 we had validated as laboratory developed tests in the clinical lab as of that time, I believe.
Okay, so just so that I'm clear and I understand what you're saying.
Yeah.
So you're saying there were about 300 or so that the TSPU was, or that Theranos had developed assays for.
Right.
About something I think we had talked about in 2010, something like less than 100 were, maybe you should explain it again, because
Sure.
I'm not really understanding what the difference
Yeah.
is between what was validated in 2010 and what was validated in 2013.
Yeah, so by the end of 2013, I believe that from an R&D standpoint, about 90 or so tests had been, we thought, validated at that time on the TSPU. A subset of those went live in the clinical lab on the TSPU. I believe that was about 15 around 2013. There were also other chemistries that we had developed that were running on other platforms beside the TSPU. Does that make sense?
Okay, so 90 tests were validated to run on the TSPU in 2013.
I believe so. About 90.
Okay, but only 15 were being run in the clinical lab.
Yes.
Why weren't you running the other remaining tests out of the 90?
We put, out of the 90.
Why weren't you running the other 75 tests on the TSPU?
So the reasons changed over time. Around 2013, I think we were initially working to bring up in the clinical lab setting additional tests on the TSPU. And then at some point in time, we stopped and focused on the modified platforms, as well as just trying to get those tests through the FDA so that they could be used in the phase 2 setting. The business model evolved and the strategy evolved.
Okay, so even though you had 90 tests validated on the TSPU, you decided only to run 15 on the TSPU because you had to get approval for the tests? And you decided to focus more on the modified protocol with the third-party commercially available machines?
Yeah, and so just on that point, there were, I believe, about 90 development and validation reports with tests on the TSPU. The remainder we had done through other platforms. The subset of those went live in the clinical lab on the TSPU. The remainder of the focus in the clinical lab, as I understand it, was on the systems that could process a lot of samples at the same time. I think there was some work to get more than 15 up, but I know that work stopped, and I don't know when.
You mentioned sort of the distinction between the 15 tests that were ready to go as LDTs versus the 90 that were, in your words, validated on the platform. In your mind, what was the difference between having a test be an LDT versus it being validated for the platform? I guess, what's the difference between the two?
Sure. So when I use the words validated for the platform, I was referring to our understanding of the development guidelines that were required for these tests, namely the FDA assay development reference. The clinical lab had its own separate validation process for any tests that went live. And so there were separate activities that were underway for each of those 15 prior to the lab director signing off on them.
And did you have an understanding at the time about substantively what that meant? I mean, in terms of, what the folks in the lab were doing to?
No, I knew that they had a separate validation process. I didn't know what the differences between the two were in a substantive way.
So it sounds like there were two different kinds of validation processes that were being performed on the TSPU. The first was, according to what you said, the FDA guidelines.
I think, in retrospect, it's what we had interpreted to be FDA's guidance document for assay development. And so when I use the words developed and validated, that's what I'm referring to.
Okay, but you mentioned before there were some characteristics of that validation process, including certain measures like test specificity and precision and some of these other categories. That was
Correct.
what your understanding was with respect to how to validate the device under the FDA guidelines?
Yes, those are elements of that process, and then there were certain criteria that were acceptable for each of those sets of experiments that we had used that guidance document as an indicator of making sure that we were as good as we had wanted to be.
Okay. And then you mentioned there was a separate validation procedure that the CLIA lab was doing. Is that right?
Correct.
Okay. And so as of 2013, only 15 tests had been validated under the CLIA procedure.
Correct.
On the TSPU.
Yes. I think.
But you have no understanding as to what that CLIA procedure for validation is.
My understanding is that it's similar, but that there's some parts that are different, and that it's specific to essentially what the lab director determines are the acceptance criteria for a lab-developed test. I don't know specifically what aspects were different from our own development and validation of the assays.
Okay. And then going back to then the third-party commercially available machines that Theranos had modified, how many tests could those machines perform?
And just so I answer the question best, could they perform, meaning how many LDTs had we validated in the clinical lab
Yes.
on them? I believe there was about 60 or so. I'm not sure what the exact number was.
Okay, so about 15 were validated pursuant to the CLIA procedure on the TSPU at
Yes.
that time, and 60 were on the modified commercially available machines.
Yes.
Okay, and then
And just to be clear, those numbers are not exact, but it's about those numbers.
Okay.
I don't know the exact numbers.
okay, but in terms of the numbers, you would think it would be something less than 100 on the modified machines?
I do. Yeah.
Okay. And then in terms of the third category of machines, which would have been just the regular third-party commercially available machines that were running venous blood, how many tests could those machines perform? Would it just be the remainder of the tests that Theranos was offering?
Well, we ran the remainder either on those or by sending out to the reference labs, and I don't know exactly how many were on the commercial machines.
Okay, but they would either be performed on the third-party commercially available machines, or they would be sent out to reference labs.
Correct. Yes.
Just a couple clarifications there. So the 15 or so that were on the TSPU and the 60 or so that were on the modified commercially available, are those mutually exclusive sets, or is there any overlap between the LDTs on those
Great
platforms?
question. I think the way we're counting them, it's mutually exclusive. So the open platforms were capable of running a couple of the tests that we put on the TSPU. I don't know whether we ever ran them on both. I think for the purpose of this discussion, it's okay to consider them as different tests.
And then you sort of just thinking back through your answer about you understood that there were 15 LDTs that were on the TSPU. There were about 90, again ballpark, that were validated in the company's view at the time on the TSPU.
No, oh, sorry, yeah.
Was there ever a situation where someone at the company told you that additional LDTs weren't being brought onto the TSPU because of challenges in getting those, one of those 90 validated to the Theranos understanding tests up to the LDT standard?
I can't remember any specific conversations. I knew that there were ongoing sort of initiatives and challenges in general in bringing LDTs up, but I thought that the fact that our lab director had signed off on the reports for the first 15 meant that there were no fundamental issues in the ability to bring up more tests, and certainly believed that. As we worked to then take those same tests that we'd done the development on into the pre-submission process for FDA.
Handing to you what's been marked Theranos Exhibit 197. Just tap through for everyone. Exhibit 197 purports to be a June 11th, 2013 email from Sunny Balvani to Elizabeth Holmes. The subject line is forward demo next Tuesday, 6/11 at noon, with starting dates number TS-0902-539. Have you seen Exhibit 197 before?
I don't remember it. I'm not sure.
Is this your email address at Theranos, eholmes@theranos.com?
It is.
Do you have any reason to believe that you might not have received this?
I don't.
What is this email about?
Do you mind if I take just a sec
Yes,
to
of
read
course.
it? It looks like it's an exchange on trying to do a demonstration of one of the mini lab devices.
Okay. And do you recall who that demonstration was for?
No.
So if you look at the initial email on the bottom of the second page, which is 540, is writing to, see that email?
I do.
And he states, or he writes rather, Sunny mentioned that he'd like to run a demo during an exec meeting next Tuesday. It runs from 12 to 2 p.m. in our office here. Do you know what he's referring to when he says exec meeting?
I don't.
Is exec short for executive?
I'm assuming so, yes.
And did you have executive meetings at Theranos?
Honestly, I'm not quite sure what an executive meeting is. I currently hold executive team meetings. I don't think that's what this is referring to.
Okay. Do you think it might be referring to a meeting with a business partner or someone from the outside?
I'd be guessing. I have no idea.
So So if you then flip to the first page at 539, you'll see that as they're setting up this demonstration is then writing on June 10th to a number of individuals at the company, including, and he's copying Sunny Balwani at the bottom. He says, for tomorrow's demo, as listed below, we'd like to have a mini lab and either a 4S or mono bay with the Normandy shell uploaded, whichever works better. So he's mentioning a number of different devices. There's the 4S and the mono bay. Do you know what he's talking about here?
So I'm not sure specifically. I think just looking at the chain here and the reference to mobile labs up above, that he's distinguishing 4S as the device that we'd been investing in for the DoD deployments that we had wanted to do, and the mono bay as the version of it which we later began to think about as the mini lab that could be used at retail or physician offices.
What was the difference between the 4S and the mono bay?
The 4S was designed to be much more compact and to try to be developed to some of the standards that were set by Special Operations Command for things that could be lifted and transported in a way that their command could handle. And it also had a lot of investment in things like vibration mounts to make it more robust for use in more difficult settings.
Okay. And so how is the mono bay different from that?
It was not intended to be used in sort of more extreme environments. It was designed for sort of a routine clinical setting, kind of like our wellness centers.
So in other words, was it bigger then than the 4S?
I think it was bigger, but it just didn't have the same vibration control and other things that would ultimately be required if you were going to do those types of deployments the DoD was interested in.
Were there any differences in capabilities between the two devices?
I don't know. There might have been. I'm sure there was. I don't remember specifically what.
Who would know the answer to that question?
Just looking at the email to. I don't know specifically. The product teams that were working on it at the time, who's listed here, I'm sure would have known what this was referring to at the time.
Okay. And when it mentions the Normandy shell being uploaded onto the machine, did you understand what he meant by that?
I'm not completely sure what he means by that. It's a piece of software, and I don't know why he wants to put that software on it. It must have been for some type of demonstration purposes.
What is the Normandy shell?
I don't know. I'm not sure.
So you just said it's a piece of software. Did you know what the software did?
I don't. I know that there was a reference. I know it's software because it says Normandy shell, and so that is probably some type of shell software system. I don't know what code it refers to. It might be a version of the software that allows you to report results from the device, but I'm purely guessing based on looking at the email now.
What is Normandy?
Normandy is a word that was used to refer to a number of different projects internally. Insofar as I was familiar with it, it referred to the concept of having samples sent to a central lab through the nanotainer in phase 1 of our sort of business model, and then later deploying the device. I know Sunny used it in the software setting, and I think even in the lab setting for a number of different purposes. I'm not quite sure exactly all the use cases.
So if you look at the response then back from, which is just above email, he says, I've just finished getting the device OS installed with the Normandy app and properly running the null protocol on mobile labs 4 and 8. So what did you understand him to be saying there?
Hey, just so it's clear, you're asking to interpret the document now, or are you asking whether it refreshes a recollection going back to that time period?
I'm asking her what her I mean, it sounds like she doesn't necessarily
remember, yeah.
recall this
Yeah,
this
okay.
email, but I'm asking what her understanding is of what's being written in this email now.
Yeah, I mean, looking at it now, it says he's installed software on it. I don't know what the null protocol was. And I think that the mobile labs is a reference to the version of 4S at that time, but I'm not sure.
So you don't know what null protocol is referring to?
I don't.
Have you ever heard that that phrase before?
I don't recognize it. I may have heard it before. I don't know what it is.
Okay.
I would guess it's a test protocol, but I'm not sure.
What do you mean by test protocol?
A lot of times when you want to make sure that the instrument is functioning properly, you have it's kind of like a QC protocol or a test protocol that allows you to ensure that whatever software you've installed or whatever configuration you've put the device in, it operates properly.
Okay. Did you ever conduct demonstrations where a blood sample was actually put into a device and the device, tested the blood sample? Did you ever conduct a demonstration like that?
Yes.
When did you do that?
Very frequently. Many times over all the years.
And would you, after putting the blood sample into the device, would that device then generate a result?
If we put a blood sample into it?
Yes.
If it was programmed to, yes.
And were there times where you generated that result while, whoever you were conducting that demonstration for was present?
Yes.
Who do you recall doing that for?
Well, I know we gave one of the early versions of the Minilab to Walgreens to keep at their headquarters so that they could do that themselves whenever they wanted. I don't have specific recollections of the meeting, but I believe we brought devices to at least Safeway to use in their conference room and run samples on when we were first forming that relationship. I know we would do it. We've done it for board members a few times. I mean, whenever it was a relevant part of talking about that part of our business model.
Do you ever recall instances where you instructed others at Theranos to run a program on the devices so that it would look like the machine was running even though it wasn't actually processing a test?
We have test protocols that essentially allow you to show the device functioning. We will do that a lot, including for open systems of the open demonstrations of the device where you want people to see the architecture.
Okay.
So it runs essentially a, for lack of a better word, dummy protocol so that you can see how the inside of the instrument moves or see the user interface or those types of things.
Right, so even if it's not processing a test, you would be able to see that the machine is actually running inside? Is that what a test protocol is for?
Either running inside or seeing how the software GUI works on the outside.
And do you recall using those test protocols a lot during your demonstrations?
I mean, again, we would do demonstrations in response to questions or interest in certain parts of the system. So we do it a lot now because we show open sort of versions of the device to show people the architecture. I know we did it at certain points in time in the past, depending on what the context of the meeting was and what people were interested in seeing about the device.
Was there a name for, so in those instances in which you were actually testing a blood sample and it's going into the machine, was there a name for the program or the software that would be uploaded to the machine in order to do that?
I don't know.
Who would know the answer to that question?
Name for the software to run the test protocol? I would
I'm actually talking about the instance. It sounds like, from what I understand, what you've just been saying is that the test protocol is something that can be put on the machine to sort of mimic how the machine would work if it was testing a sample. But
Sure.
is there a separate program that would be put on a machine in the case that you're conducting a demonstration where you're actually putting in a blood sample?
So if you're putting in a blood sample and you're reporting a test result, then the test result will be specific to whatever chemistry is on that cartridge, and that's what's reported out to the end user in the end. If you're, I'm not quite sure.
So maybe I don't understand how the machines work. Are they already, as a default, programmed to conduct tests on blood samples? So in other words, you would put the blood sample in, the machine would conduct the test, and the test result would be generated?
So the way that our TSPU systems work is that on each cartridge there's a barcode, and that barcode can be specific to a chemistry that's loaded into the cartridge. It could be specific to a test protocol, like a QC protocol, or if it was going to go through the movements but not actually run an actual chemistry, and anything else that you would want the instrument to do. So it would be determined by whatever on the cartridge, if that makes sense, whatever barcode is on the cartridge.
So the barcode on the cartridge determines whether it's running one protocol versus another?
Yes.
So when you're talking about the test protocol, is it not a software that's being loaded onto the device?
I'm not aware of so there's an operating system on the device. The protocol, I believe the barcode calls a server, and then it determines what protocol to run based on what's on the barcode.
Okay. And then if you look back at Exhibit 197 then, responds that same day, and he says, right now we're not planning to run anything on the mini lab, unfortunately. The general chemistry and ELISA assays are not performing adequately for a demo at the moment. So is that right? Is ML referring to the mini lab?
I think so. Given the references here to mobile labs and mini lab, I'm not quite sure exactly what it's referring to, but it could be.
Okay, and so he's actually responding back to Sunny Balwani's question about what you're planning to run on the ML. Do you see that?
I do.
Okay, so it sounds like the general chemistry and the ELISA assays were not performing, or were not, I guess, performing accurately or adequately on the mini lab at that time. Does that refresh your recollection that the mini lab was not actually performing assays in this time frame?
It doesn't. I mean, there's a lot of reasons why they could have had issues with it. I mean, we, as you know, been doing immunochemistries for many years on earlier versions of this platform.
Okay, but they're actually talking about the 4S and the monobay.
I don't know.
Was it? So is it your understanding that the 4S and the monobay could conduct testing?
Yes.
How many tests could, we had this conversation earlier, but how many tests could the 4S or the 4 Series mini lab perform?
My understanding was that we were going through the process to take all of the chemistries that we had developed, the few hundred that we were talking about, and put them onto the 4 Series platform. I don't know which of these this is referring to, and begin the process of getting them into the FDA later in 2013.
Okay, and so was it your understanding then that those tests were validated on the Minilab 4S?
The development and validation work I don't think was on the 4S device, but it was my understanding that the validation on the 3 Series translated to the 4 Series. So you would have to run it again on the 4 Series hardware, but it was essentially the same architecture of a robot moving fluid around, now with more detectors for different readouts.
So maybe I don't understand. So Was the Mini Lab 4 series performing any tests in 2013? Was it capable of performing any tests?
I thought it was. I mean, I'm saying that just based on remembering engaging with the FDA. We brought it to the FDA and we began the pre-submission process on it with the FDA that year.
And had you validated those tests on the Mini Lab for us?
Again, I think the development and validation reports were on earlier iterations of the hardware, but we believed, and I believed, that you could basically take the same chemistry that's been created and run it on this iteration of the hardware. Just to be clear, you said 4S. I'm speaking generally about Mini Lab. I don't know if it was 4S or another version of the 4 Series platform.
Okay. I think probably we should clarify that when we're talking about the Mini Lab, at least with respect to this email, we're talking about the 4 Series Mini Lab.
Yeah, exactly.
Okay.
Yeah.
Okay, so you think that maybe during this time frame there were some issues with being able to adequately perform the general chemistry or ELISA assays on the Mini Lab 4S, but that generally speaking, your understanding was that these devices could conduct the test?
My understanding was that architecturally, what we had created with the 4 Series from a hardware perspective was sound, and that all the chemistries that we'd made over the years could be put on it and taken through the FDA, as we later did with HSV, which got cleared. I certainly knew that, like with any new technology that was coming up, there would be issues, but I was never aware that there were any showstoppers in being able to do that with the 4 Series platform.
Okay, you can put that one aside.
Appreciate it.
So I'm going to turn to you what's been marked Theranos Exhibit 198. This is tab 4. Exhibit 198 purports to be a January 23rd, 2014 email to Elizabeth Holmes with a copy to a number of individuals. Starting dates number is TS-0469692. Have you seen Exhibit 198 before?
I recognize it. I don't know if I've seen it since sending it, but I recognize it.
What is Exhibit 198?
It's an email exchange between me and the FDA.
So if you look at your initial email on January 22nd, 2014, you're noting in your email, I think you're getting ready to provide a copy of some updated plans for some pre-submissions to the FDA. Do you see that?
I'm sorry, where are you?
Your email too.
Okay.
Do you see that you're providing him with a copy of an updated plan?
Yes.
That's in the first sentence
Yes.
of your email.
Yes.
You then say, for your reference, as of now, VIT-D, is that short for vitamin D?
Yes.
TSH, PSA, and FT4 ELISA assays are the only assays run through the Theranos processing device in Theranos' CLIA lab on patient samples collected at Theranos Wellness Centers. Was that consistent with your understanding that there were only 4 tests that were being run on the Theranos, I guess the TSPU, from patient samples being obtained from the wellness centers at Walgreens?
I'm sure it was at that time. We were making sure to keep the FDA completely apprised of everything we were doing.
Okay. Do you know why only 4 of the assays were being run on the TSPU during this time? And this is January of 2014.
I don't. If all 15 of them had been brought up by then this is probably just based on the orders. We also hadn't really seen that many patients on fingerstick by this period of time.
Was there a time when the number of tests that were being performed on the TSPU changed? Was it just a matter of bringing the next, 11 or so tests online and having them validated?
No. We generally looked at this based on ordering patterns, and our belief was, and still is, that about 70 assays will cover almost 100% of the orders that you'll get from the types of physician practices that we were trying to serve. So the goal was to match that test menu. As I said earlier, I think there was a period of time in which we thought more than 15 would go up. I know that changed, and I'm not sure exactly when it changed, but we weren't necessarily just linearly looking at bringing up more assays on an ongoing basis.
Okay. So what is your understanding as to the maximum number of tests that the TSPU ever performed on patient samples from Walgreens?
I think it's that 15 number.
It's that 15.
Yeah.
You can put that one aside. I'm handing to you what's been marked there, and it's Exhibit 199.
Is the difference here that mine's two-sided?
Yes,
Okay.
that's why it's a little thicker. Exhibit 199 purports to be defendant Theranos Inc.'s responses and objections to the plaintiff's first set of interrogatories that were filed in the Court of Chancery of the State of Delaware in the Partner Investments LP versus Theranos Inc. case. Have you seen Exhibit 199 before?
I don't know. I might have.
Are you aware that there was a lawsuit that was filed by Partner Investments and PFM Healthcare Master Fund against Theranos?
Yes.
Were you involved in preparing responses to their interrogatories?
I certainly was engaged with our legal team on responding to them. I don't know what my specific role was in responding to the interrogatories. I'm sure I talked with our team about it. I may have seen some of the documents. I don't have a specific memory of what exact documents I looked at sitting here.
Sure. If you could just turn to the page with Bates number ending 3465. And just for the record, the starting Bates number on this document is SEC-PRM-E-000343. So are you on 3465?
Yes.
Okay. So here in interrogatory number 15, Theranos has submitted a response, and it looks like PFM is asking about the number of blood tests that were being processed through the TSPU beginning in January 1st, 2013 for clinical patient testing. Do you see the response here?
I do.
Okay. And Theranos responds that there are a number of tests that were being performed on the TSPU, and by my count, there are about 12 of them that start, and that list starts at 3465 and ends on 3466.
Yes.
You see that? Is that consistent with your understanding of the tests that were performed on the TSPU?
Yeah, I mean, I don't have any reason to doubt this.
Okay. And looking at the list, were there any other tests that you believed were being tested or performed on the TSPU that aren't being listed here?
You know, if there's 12 here, I had the number 15 in my head. It may have been that either they weren't up by this period of time, or they were never run, they were validated, or I could be wrong about the 15 number, I'm not sure.
Okay, so do you have any reason to believe that otherwise that only 12 tests were being performed on the TSPU?
I don't know. If that's what this says, I don't have any reason to doubt it.
Okay. Did you ever share the fact that the TSPU was only performing about 12 tests with Walgreens?
I don't think so. I don't know.
You're not aware of an instance in which you might have told Walgreens that the TSPU was only performing 12 tests?
I'm not. Yeah.
Are you aware of ever informing Safeway that the TSPU was performing 12 tests in this time frame, 2013?
I mean, after the CLIA lab went live, I don't think we had any discussions with them about what we were doing in the clinical lab.
Did you ever share, or did you ever discuss the fact that the TSPU was performing about 12 tests with Sunny Balwani?
I can't remember a specific discussion about it. Yeah, I know there were discussions that we had about sort of stopping using the 3 Series platform, working to get the 4 Series into the FDA, and then our hope and goal was that we would be putting all the tests on that platform as fast as we could.
Okay, so do you know whether Mr. Balwani knew that the TSPU was only running something like 12 or 15 tests at the time?
I don't know, but I assume he would have.
Why do you say that you assume he would have?
Because he was managing the clinical lab.
What about others at the company? Did you ever discuss the fact that the TSPU was running about 12 tests with, for instance?
I don't think I ever had a specific discussion about the number of tests on the TSPU with him that I can recall. We had a lot of discussions about technology, including the TSPU, so it may have been an element of a discussion, but I can't remember a specific discussion about it only running 12.
What about the project managers? Did you ever discuss with them the fact that the TSPU was running something like 12 to 15 tests?
I don't think so. I mean, what the chemistries were running on in the clinical lab was not a focus of any of our discussions internally or really externally at that point in time.
Why wasn't it a focus of discussions?
Because in phase 1 of our model, it was about the chemistry. It was about redeveloping the assays to work with small volumes. And then phase 2 was about use of the TSPU in a distributed setting. And that was the vision, that was what we were spending most of our time working on. But how we operationalized the tests in the clinical lab in the meantime was just not something that any of us really focused on very much in conversation.
So can you explain for me, I guess, why Theranos decided to pursue commercial testing in phase 1? So I think I understand what you described there. Phase 1 is about getting the chemistries ready. Phase 2 is about the TSPU being out there. Why conduct commercial testing in phase 1 at all?
Yeah, so I think there's 2 parts to that. The first is our business model shifted when we formed the partnership, after we formed the partnership with the retail pharmacies. And there was a lot of discussion about getting CLIA waiver on the devices and a concern about how long that would take and the regulatory model for it. No one had done this before. And so the decision was made to become a clinical lab. The concept with phase 1 was that the value is the retail footprint, right? Bringing lab to the retail footprint. And you've seen now Quest and LabCorp immediately go partner with Walgreens and Walmart to do that. To the extent we were focused on small samples, we invented the nanotainer to be able to work with the chemistries that we had redeveloped for small assays, and that was the concept for fingerstick-based testing in phase 1. In phase 2, the value proposition was to bring the device to the wellness centers to get tests even faster. And so that's what TSPU was about, because it processed one sample at a time. And in phase 1, you were going to have a lot of samples coming in at the same time. So phase 1 was retail footprint, access, low cost, transparent pricing, the $4 lab test concept, and then to the extent you were doing small samples, the nanotainer implemented with our chemistries. And then phase 2 was distribute the device. Right? And phase 2 was what we really wanted to do, and is what we're still trying to do right now.
Is there a business plan or anything that articulated that? What you just
Not in a systematic way at that time. We did not have organized documents the way we do now that really lay all of this out.
Okay, you can put that aside. And actually, let's make a separate pile. Put that there, thanks. To you what's been marked. There it is, Exhibit 200. This is tab 9. Exhibit 200 purports to be Defendant Theranos Inc.'s first supplemental responses and objections to plaintiff's first set of interrogatories. Filed in the Court of Chancery of the State of Delaware in the Partner Investments versus Theranos Inc. case, with starting dates number SBC-PRM-E-0005120. Have you seen Exhibit 200 before?
I don't know, but again, I worked with our legal teams as we worked to respond to PFM.
So if you take a look at 5128, there's a supplemental response to that same interrogatory that we were just looking at in Exhibit 199, interrogatory number 15. Mm-hmm. And it says here, by way of further response, Theranos states the version 3.5 of the SPU is the only version of the SPU used since January 1st, 2013 to process blood tests for commercial testing center patients. And that's consistent with your understanding that the TSPU version 3.5 was the only device ever used for patient testing. Is that right?
The only version of the mini-lab family that was used, yes.
The only device manufactured by Theranos that was used for patient testing. Is that right?
That's right, and just for the sake of being explicit, we considered we actually injection molded and made the little cups that went into the hardware ourselves in our factory, so we considered ourselves as manufacturing some elements of the hardware for the other platforms as well.
Okay, so the sample cups that you were using with the Advia 1800, those were Theranos manufactured cups as well?
We made them, yep.
Okay.
What were those called internally at the time?
So, I don't know. I've seen a lot of references to different words used, I think, in describing the general concept. I've seen the word teacup. I don't know if that explicitly refers to what I'm referring to. I had understood that to refer to Theranos Cup, but I could be wrong about that.
Okay. And then if you turn to And actually, yeah, turning to the next page, 5129. Actually, at the bottom of 5128, if you want to follow through, it says by way of further response, Theranos identifies all other iterations of the SPUs since January 1st, 2013 as follows, and then there's a list on 5129, which lists, the 3.0, the 4.0, the mini lab tower, the 4S, and the 4.1. If you take a quick review of that, of the descriptions of all of those versions, is this consistent with your understanding of those versions and what they were used for?
I think so. Generally, I don't have any reason to doubt it.
Okay. And what did the TSPU look like? And maybe they looked differently, so what did the 3.5 look like?
So they all look like a box with a screen on it, with a hole on the front that has a door, and you can stick what we call a cartridge, which is the piece of plastic that has all the chemicals in it, into it. And the cartridge has a little hole where you can put samples. You can put urine, or you can put blood from your arm, or you can put the little nanotainers with the finger stick in there.
And you said they all look very similarly?
Generally, yes.
Generally. What was the size of one of the 3.5s? What were the dimensions of that?
I don't know the specific dimensions, but we would sort of refer to it as being similar in size to a desktop computer that you would have under your desk.
And then turning to 5155 in Exhibit 200. You'll see there's a supplemental response in interrogatory number 27. Do you see that?
I do.
And what PFM is asking Theranos is to identify any non-proprietary or commercially available machine, equipment, or technology that you use to perform tests. Do you see that?
Yes.
Okay, and on the next page, Theranos provides its response with a table of devices purchased from third parties, and it goes from 5156 to 5158. Is this consistent with your understanding of the third-party devices that Theranos was using to conduct patient testing?
I wouldn't know, but I don't have reason to doubt this document.
And was that also your understanding, in 2014, so this was as of 2013 or since January 1st, 2013, but would this list be of devices that were being used by Theranos that were purchased from third-party companies? Was that consistent with your understanding as of 2014?
Again, I wouldn't know. I didn't have direct involvement in what devices were being procured for the clinical lab.
But you don't have any reason to believe that this information is incorrect as of 2014 either?
I don't know. I don't know. I know that the business model shifted. I know that as of a period of time, we were understanding the value proposition on low cost and therefore trying to achieve automation and standardization in the clinical lab. So there was a big investment in standardizing on Siemens equipment. I don't know when exactly that happened. So these might have been different in different periods of time.
Do you need to switch the tape?
We just break for lunch. Doesn't make sense now.
He's got 2 minutes left on this.
Yeah. No, why don't we switch the tape? If you guys don't mind, go ahead and switch the tape. We are off the record.
Yeah, it's been an hour.
This concludes media number 2 of Elizabeth Holmes. We're off the record at 12:43.
Let me just.
We are back on the record at the beginning of media number 3 of Elizabeth Holmes. The time is 1:36.
Ms. Holmes, did you have any substantive conversations with the SEC staff during our break?
No.
I'm going to hand to you what's been marked as Theranos Exhibit 201. Oh, sorry. Exhibit 201 purports to be Defendant Theranos Inc.'s responses and objections to plaintiff's second set of interrogatories filed in the Court of Chancery of the State of Delaware in the case Partner Investments versus Theranos Inc. with starting base number SEC-PRM-E-0003334. Have you seen Exhibit 201 before?
I'm not sure.
If you turn to the page with ending or Bates number 3358, you'll see there's a request from PFM, and you understand PFM to be Partner Fund Management.
I do.
Okay. There's a request from PFM to Theranos, and PFM's asking Theranos to identify any commercially available machine that Theranos has modified for use to process tests on capillary or microsamples. Do you see that?
I do.
Okay. And Theranos then responds on 3362, which is, well, there's a response starting on 3359, but there's also a list that starts on 3362. And Theranos is responding that there are 4 commercially available machines that Theranos has modified for testing on smaller samples. You see that there's Siemens, I think it's Advia 1800?
I believe so.
Okay. Does that look like a misspelling where it says Adva?
I think it is.
Okay. And then there's the BD Biosciences LSR Fortessa, the BD Biosciences FACS Canto 2, and the Drew Scientific Drew-3 hematology system. Do you see that?
I do.
Was it your understanding that these were the 4 machines that Theranos modified in order to conduct testing on smaller samples and used these machines for patient testing?
Yes.
Okay, and did you have that understanding back in 2014 as well?
I'm not sure what my understanding was in 2014. I know that I was aware of use of all 4 of these platforms. I don't know when I became aware of each one.
Okay. But you were aware in 2014 that Theranos was modifying commercially available machines for use in patient testing.
I was, and certainly of the 1800 platform. Again, I'm not sure when I was aware of the other ones.
Okay. And then if you turn the page again to 3369, I'm sorry, 3363, then the next page. You'll see there's a list of a number of tests here, and under little d, towards the top of the page, it says Theranos states that the following blood tests were available to run on modified Siemens Advia 1800 analyzers in the approximate time frames indicated below. And there's a number of tests below that, about 49 tests that go over into page 3366. Do you see that?
I do.
And was it your understanding in 2014 that the Siemens Advia 1800 analyzer was being used to conduct testing for about 49 tests?
I don't think I would have known in 2014 that it was 49. I knew that we were using the Advia with our, what we called proprietary chemistries at that time.
So you knew that you were modifying the Siemens Advia to conduct tests?
Yes.
And I think before you'd said it was something in the range of about 60 tests?
Yes.
Do you recall that?
Yes.
So do you have any reason to believe that it was something more like 49 tests?
I don't have a reason to doubt anything that's in this document.
And then further down on 3366, Theranos then states, by way of further response, Theranos states that the BD Biosciences LSR Fortessa flow cytometer, the BD Biosciences FACS Canto 2 flow cytometer, and the Drew Scientific Drew-3 hematology system were used to process the complete blood count test panel. So was that consistent with your understanding in 2014 that these 3 devices were being modified in order for Theranos to conduct testing on the complete blood count test panel?
So again, I don't know when I understood that we were using those platforms. I believe on these we were putting our own proprietary chemistry. So these were the ones where we were making the antibody ourselves and then making the chemicals and then making the test and running it on these. And just going back to your previous question, my comment about the number 60, I don't remember your question specifically, but it may have been just on any open platform, not just specific to the ADVIA, so it may have included these Becton Dickinson devices.
Okay, so it might have included the test panel.
Yes.
The complete blood test count test panel. Okay, and what do you understand that the CBC test panel, is that a short name for complete blood count?
I'm sorry, here. Yes.
I'm just using CBC because that's my experience with that test. Would you understand that I'm referring to the complete blood count test panel if I say CBC test panel?
Yes.
So how many tests comprise the CBC test panel?
I always get this wrong. I think there's 13, but I could be wrong. It may be more than that.
Okay. So taken all together, the 13
It might
that
be
are
19. I'm not sure. Yeah.
the 13 or the 19, something like that, something less than 20.
Yes.
So taking the complete blood count test panel together with the 49 tests and I think the additional, say, 12 or 15 on the TSPU. So is it fair to say that Theranos was offering something less than 100 tests on all of its platforms not all of its platforms, but on the TSPU and the modified platforms? Is that
I think so, yes.
Okay, and with respect to the remaining tests then that Theranos was offering during patient testing in 2013, were those tests being conducted then on commercially available machines that had not been modified by Theranos?
In 2013?
Yes.
Again, I think that they would have been both in-house and sent to a third-party reference lab, but I don't know that for sure.
How many of the tests that Theranos was offering to clinical patients were being sent out to reference labs?
I don't know.
Who would know that information?
Sunny and our lab directors should know.
Excuse me. Did Theranos ever try to patent the modified protocols on these third-party machines?
Yes.
And was Theranos successful in patenting the methodologies?
So I know we filed applications. I don't know how many of them have issued and where they are in the prosecution state.
Is this was the patent process something that you would have been involved in?
It depends. For the ones that I'm an inventor on, yes. For ones that I'm not an inventor on, that's not necessarily.
Were you an inventor on any of the modified protocols?
So I don't know. If they used some of my original IP, then I would have been, because we would have, we essentially incorporated that into the chemistries that we implemented on these big devices. But to the extent it was specific to that implementation, then I don't think so.
Did you ever tell investors or prospective investors that Theranos was using third-party commercially available machines to conduct a lot of its testing?
So I don't remember specific conversations to that effect, but I know that we were very open about the use of or the venipuncture essentially in our wellness centers, including for people who would show up in the store, and that people who were interested in the company would sometimes go to the wellness centers and get a venous straw.
Okay. But the venous straw would be whatever blood samples were taken through venipuncture would be put on, that would be put on just commercially available machines that hadn't been modified. Is that right?
Generally, yes. We did also sometimes put the venous straw onto our proprietary platforms, depending on what the test order was and what period of time it was.
I see. When would you be putting the venous straw samples on your own Theranos manufactured devices?
My understanding is that was mostly early on in the process of launching the clinical lab, and that later as we evolved the business model and sort of understood that price was the most important factor and therefore increased the venous straw testing, that we did not do that as much or at all at one point.
Did you ever tell investors or prospective investors that Theranos was modifying these commercially available machines to conduct patient testing?
Again, I don't remember specific conversations in which we discussed the modified hardware. I think I generally talked about high throughput ways of processing assays or tests that we had modified for small sample analysis, but I don't remember specific discussions.
What about Walgreens and Safeway? Did you ever tell Walgreens and Safeway that Theranos had modified its commercially available machines in order to conduct testing on smaller samples and was using those devices?
Yeah, again, when we moved to sort of the phase 1, phase 2 business model, we invented the nanotainer to accommodate that. And I thought that I had discussions in which we explicitly talked about the purpose of the nanotainer being to be run with these assays we've developed for small samples in a high throughput setting, and then that we would use the device in phase 2.
So you think that you would have talked about developing a nanotainer for use on the modified machines?
For use with the chemistries, or the tests, and using the chemistries in a centralized setting where they could be run with many samples at a time.
Had Theranos developed a different nanotainer that would be used with the modified machines that was different from the nanotainer that was used for its TSPU?
So before we created that phase 1, phase 2 business model, the nanotainer did not exist. You didn't need it, right? You could put your sample directly into the cartridge. The nanotainer was created for phase 1, where the service offering became the chemistries with the nanotainer, and the TSPU was intended at that point to be used in phase 2, primarily where you would collect the sample right there and put it in the cartridge.
So the TSPU can actually take a sample from a person without it going through a nanotainer?
At that time, the version of it that we had, yes, you could deposit the blood sample directly into the cartridge. You didn't need a nanotainer. It was designed as a near-patient device, so you would put the blood right in.
So what prompted development of the nanotainer then was because Theranos had modified some of these third-party machines in order to conduct smaller sample testing.
What prompted the development of the nanotainer was the business decision that instead of doing what we had wanted to do, which is place our devices in the retail stores, we would first become a clinical lab, and all these samples would be shipped at the same time to a central location. And the invention of the nanotainer was we can still collect a small sample, because that's what the patient cares about, is the small sample, and then still run the small sample chemistries that we'd invented. And that was the purpose of the nanotainer. And then in phase 2, once we could get the mini-lab family through the FDA, use it in the wellness centers. Does that make sense?
Sure. So whose decision was it to change the business model to this phase 1, phase 2 model, in which in phase 1 it would be development of the clinical lab, phase 2 would be deploying the Theranos devices to stores?
So a large part of it came out of our discussions with Walgreens. There had been a lot of back and forth about the business model and the timelines and the regulatory framework. We also worked very closely with FDA and regulatory counsel to try to figure out how to do this right, because we wanted to bring up a large number, relatively speaking, of tests on small sample analysis. And so it was in partnership with Walgreens and based on guidance from both of our counsels that we decided to first become a clinical lab while we worked to take the technology through the FDA.
Okay. And when you say we at the company, who made that decision on behalf of the company?
I don't know that it was sort of a single decision that was made. It was months of engagement with Walgreens, feedback from counsel, and ultimately a business decision that we, I guess you could say, was consummated with the amendment to the Walgreens contract at a later point in time. I don't think it was sort of a single meeting where we said, okay, let's make the decision. It was sort of an evolution over time.
Okay, but were you the decision maker on behalf of Theranos, and did you sign the Walgreens contract or the amendment?
I did. I signed many of the Walgreens agreements. I don't know if I signed all of them. And yes, I mean, I'm the CEO. I'm the ultimate decision maker for the company. I don't think this was a case where we sort of sat down and had a meeting and said, let's do this. I think it was, after a lot of iterative feedback, a mutual decision with Walgreens initially.
I just want to circle back to a couple of questions. You mentioned sort of the phase 1, phase 2 model being the sort of the genesis of the nanotainer development.
Yeah.
When did, what time period did that take place?
So I don't know when the initial sort of invention happened. I remember as we worked with Walgreens on how to solve the business model questions that we were contemplating, bringing to them the nanotainer and trying to convey that you could still do small sample testing even in a centralized setting while we were working to get the TSPU through the FDA. I can't remember exactly what year that was, but I know it was certainly before 2013.
Can I just ask a clarification question on that? So what did you mean by centralized lab setting?
So sort of the way I think about it is either you have the TSPU intended use case, which is you're with the box outside of a lab in a place where people don't necessarily traditionally do lab testing, like a pharmacy or a home or somewhere where a person is, and you're just going to want to do one sample at a time. Or you're in a clinical lab and you have samples from other locations being sent in at the same time, so 1,000 samples may show up or 10,000 samples may show up, and you need to be able to process all of those as fast as possible. That's a completely different use case than when you're with one patient at a time.
So you were saying that the model changed. So previously was the model that Theranos would be placing these devices in Walgreens stores?
Yes, when we signed the contract.
Right. And so how was Theranos envisioning processing all of these samples if there were going to be, all of these people coming into Walgreens stores to have their blood tested?
So it's a different use case where you're doing one patient at a time. So one person would come in, their cartridge would be placed into the device right there, the results would be reported, then you do the next one. As opposed to at a lab, you're collecting samples all day, then you ship them, and so a large number of samples come in at the same time.
I also want to follow up on another answer you gave about being open about Theranos' use of venipuncture.
Yeah.
I think the question involved, disclosing the use of third-party analyzers. I guess, in your mind, what was the relationship between the use of venipuncture and the use of third-party analyzers?
So, in general, we associate and sort of talked about venipuncture as being synonymous with the use of third-party analyzers. I want to qualify that by saying that we did take smaller samples and did sometimes run the smaller venous samples on our proprietary platforms, but over time, as we began to do more and more venipuncture testing, for example, our Arizona lab was only commercially available equipment, and that was sort of what we associated with being synonymous with venipuncture for the most part.
And I guess, did you, so in answer to the question of whether you ever disclosed to investors or potential investors Theranos' use of third-party commercial analyzers, did you ever discuss the fact that venipuncture meant blood was being tested on predicate devices?
I don't know. I don't remember specific conversations. The best place that I can think of where that would have been explicit is when people came in for tests at Walgreens and got a venous straw. If those samples were sent out to a reference lab, that would have been part of the lab report that went back to their physician, so they would have seen it there. And otherwise, I know our lab openly discussed with physicians who were calling, if this test was run on commercial equipment, what the commercial equipment was and what the testing parameters of that commercial equipment was.
You mean the lab report would identify the analyzer that was used to process the sample?
The lab report would identify that a reference lab was used, and so that some type of commercial lab was used to do the samples. I don't know if the equipment was spelled out. I actually don't think that labs generally disclose what equipment they use.
Okay, so I guess, so just to walk through the example.
Sure.
If someone, if a potential investor goes and gets a venipuncture at a Walgreens location.
Yep.
Would the results ever get processed in Theranos' lab? I guess if a reference lab isn't used in that situation, would the physician ever be notified that a third-party device was used for that sample?
So the instances in which I'm aware of it is if the physician had a question about the lab results and the lab test was run on commercial equipment. It was my understanding it was the practice of the lab to convey to the physician that it was a commercially available piece of equipment and what it was, and any information about the specifications of that equipment in conversation with those physicians.
What was that understanding based on?
Conversations that I've had internally with people when we would talk about customer service and trying to provide good customer service and answer questions, and sometimes even to give confidence to people about lab results that this was a commercial machine and this is how it performed and this is why you can trust these results.
Who was in charge of customer service at Theranos?
So it changed at different points in time. At one point, there was a head of our call center. I believe his name was, but I could be wrong. And there would have been other people before that who were serving on point for the call center. I don't know who.
Okay, so would you hear that from them, or would you hear it through other people at the company, that the information would be provided to physicians as to which equipment would be used for the testing?
My memory is hearing it from the project managers who would talk about how sort of customer relationships were going. I don't remember a specific conversation with call center personnel.
So you mentioned earlier in your testimony that at some point Theranos developed a nanotainer and it was communicated to Walgreens that this nanotainer would be used with the central lab model. Did you ever tell Walgreens that the nanotainer would be used with third-party devices that Theranos had modified?
I thought I had conveyed that the nanotainer would be used with hardware that could handle a lot of samples at the same time. Again, it's my recollection that people were really, to the extent that I was involved in conversation, the bulk of the conversation was about the chemistry and not about what hardware platform we were using in phase 1. Certainly people were really interested in the TSPU for phase 2, but I don't remember specific conversations about the hardware platform for phase one.
So you said people were interested in talking about the chemistries more than the hardware, but and what do you mean by the chemistries?
So if you take a step back, the value proposition to the customer, to the extent we're talking about our proprietary technology in phase one, was that they get a finger stick.
Right.
The act of getting the finger stick and then trying to ensure that that data was good on the test was the focus of discussions. In phase two, it's about a box, you want to get rapid results, you want to put it outside of the lab. But in phase one, it was about, can you get a test to run from a really small sample, and can you do it well?
So, but why, I mean, there's no way to, let me just step back a little bit. So you're saying that the chemistry was really important, but the way that it's being processed, or the way that a test is being processed and how it's being processed and what machine is being used, how is that not integral to the conversation?
I think in terms of what people were interested in for phase one, it wasn't, in any conversation that I was in, ever a discussion point. It was about, do you have a method for making this chemistry work on a small sample? And part of that was the protocol, part of that was, instead of having to collect a lot of tubes, standardizing that down to 1 or 2 tubes. And then can you implement it in a way in which you can handle volume? In phase two, because you're trying to not be in a lab, there's a lot of focus on the machine, because now you're trying to put the lab in a box. But that was not what we were trying to do in phase one. And for the most part, most of our conversations focused on phase two, because we were trying to get there really fast, and as fast as we could.
So what about other people at the company? Did you ever have discussions with anyone at the company about, and maybe I should specify who, did you ever have any discussions with, for instance, Sunny Balwani about the use of these proprietary modified methods on these commercially available machines and using those modified protocols for patient testing?
I don't remember a specific conversation, but I'm sure I had interactions with him about it. I was aware that we were doing it.
And what about with?
I mean, I also don't remember specific conversations with him. I don't know whether that's something he and I would have talked about. To the extent we had conversations about the lab, they were more on the customer side.
Did you ever discuss the way the company was modifying protocols on these third-party machines with the project managers, or others?
I don't think I did. I can't remember instances in which I did directly.
What about with Theranos' sales team?
I don't think I did. I didn't have much interaction with our sales team.
And the marketing team as well?
Did I discuss modifying protocols with the marketing team?
Yes.
I don't think so.
Were you
It's possible, but I don't think so.
Were you overseeing the marketing team in the 2013-2014 timeframe?
When it started, she reported to me.
And did you know what she was doing in marketing?
I did, generally, yes.
Did you have regular meetings with her?
I had occasional meetings with her, but I missed a lot of them.
Were there any times when Theranos, I think we talked earlier about some of the technology demonstrations that Theranos conducted for certain third parties. Did you conduct those demonstrations for prospective investors?
We did do technology demonstrations for prospective investors when they were interested in it, yes.
And did you also conduct these demonstrations for business partners as well, like Walgreens and Safeway?
We did.
Okay. Were there other people that you would conduct technology demonstrations for?
I'm sure there were. I can't. I think I mentioned earlier, I know we showed the technology to our board. I can't remember other general categories, but I'm sure there were.
Did you conduct demonstrations for the Department of Defense?
I think I'm aware of one instance in which we did. And then, of course, the deployment that I mentioned earlier where the TSPUs were actually in a number of burn hospitals.
So you remember conducting demonstrations at the burn hospitals?
No, the burn hospitals were using the TSPU on an ongoing basis.
Okay. Do you ever recall conducting a demonstration for the Institute of Surgical Research and part of that burn study?
I don't know if we did a demonstration before we put, I think that contract was 2008. I think we may have just shipped them the systems. I'm not sure.
Which version of the TSPU was sent to the burn hospitals for use?
I don't know. I'm guessing the 3.0, just based on how early the study happened. We may have later also used the 3.5s. I'm not sure.
So take us through the process of a technology demonstration for one of these groups of people. First of all, was the demonstration always conducted similarly? Did you make any distinction between investors or business partners or the board?
We didn't make distinctions that way. We made distinctions based on what people were interested in seeing. So there were some people who really wanted us to sort of show them what the retail experience would be like. There were some people who wanted to see what decision support software would look like on the touchscreen. There were some people who wanted to see the TSPU running right there. And depending on what we were trying to show, we would do different things. Some people just wanted to test the experience themselves, so they would show up at retail without scheduling something with us.
Okay, so I guess let's focus on the technology demonstrations that were not done through people just walking into a Walgreens store. Did you conduct these demonstrations at your office?
Sometimes, and sometimes we would bring the TSPU to other places and allow people to run it there.
Okay, so let's talk about the demonstrations that happened at the Theranos office then.
Sure.
So take us through the process of how a demonstration would occur. You know, would it be at the end of a meeting with either the investor or the business partner, whoever the third party is, and what would you show them, and how would you show them that the device worked?
Yeah, again, I don't think it was that systematic. I think we were very reactive to the audience and what we thought was most relevant to the discussions that we were having. There were some discussions that were focused on how you could deploy the TSPU, in which case we would run a sample right there on the TSPU. There were some discussions that were focused on the user interface of the TSPU and how it could be used for decision support, in which case we would show that. There were some samples where we would try to process the sample like we would in the clinical lab, and we would send it to the lab. It was run through essentially the product teams as a technology demonstration, and then we would report the result back like they would have gotten it if they'd gone to a retail location.
So in that last example you said there would be instances in which you would place the sample in, but the results would be generated sometime later and shared with
so we
whoever.
had.
Sorry, let me just finish.
Oh, sorry.
Whoever was getting the sample. Is that what you were describing just now?
The last example?
Yes.
No, so that we had little rooms in one of our facilities, the 1601 facility, that were intended to replicate exactly what Walgreens looked like or was intended to look like if we were able to roll it out broadly. And you could collect a sample in there similarly to how you would at Walgreens, and then it was sent to our lab just like the sample would be at Walgreens, and then we would run it except it was outside of the traditional clinical lab process. It was actually product teams who were doing it, and we would report results back to people, is my understanding of how the process worked.
Okay, so in that circumstance, the blood would be drawn in a room,
Yes.
and then the sample would then be sent to the CLIA lab to be processed?
Yes.
Okay.
So just
But just to be clear, I don't think it actually got processed through the lab. It was processed through equipment that was in the lab, but not the same way a sample that was collected at retail would be. Does that make sense?
Not really. So how is it different from how a retail sample would be processed?
There's some R&D activity that occurred in the CLIA lab, and I believe that these technology demonstrations were done through essentially the product teams, as opposed to the way a sample that was collected at retail would be accessioned and then run through the lab. So same physical space, but not through the formal clinical lab process.
And why wouldn't you put it through the same clinical lab process as other patients?
In the instances that I'm thinking of, you didn't have a requisition from a physician, so it wasn't an official lab order.
But I guess I just don't understand. Why wouldn't you just have that sample put on the same types of machines that a clinical lab sample would go onto?
It was my understanding you're supposed to treat R&D samples differently from clinical samples, and the clinical samples have to be ordered by an ordering physician, and they have to go through your essentially certified collection process, which would include our service centers that were listed for being able to collect samples and then run through our lab.
But it sounds like the clinical samples were being put through sort of a higher standard process than some of the R&D samples. Because
it was a more controlled process.
It was a more controlled process.
Yeah.
There was a different validation process that the CLIA lab had to go through in validating the test. Why wouldn't you just, since you already had that framework in place, why wouldn't you just put the demonstration samples through that same higher standard process?
In some cases, if someone wanted to go to a retail location, you would. It's my understanding that there had to be a separation between anything that was done sort of in a research or demonstration type setting and something that was actually ordered clinically as an official medical result.
So what were the machines that were being used to process the technology demonstration samples?
I don't know specifically. It would have been generally reflective of what we were doing in the clinical lab, but not necessarily the same.
So, but were you aware of instances in which those technology demonstration samples were run on third-party but modified devices?
I can't sit here and recall a specific instance, but I certainly knew we were running what we called our chemistries on modified systems in the lab. So if that was used for a demonstration, it would have been reflective of what we were doing for traditional lab testing.
And were you also aware that sometimes these technology demonstration samples were being tested on just commercially available third-party machines without any modifications?
To the extent we were running fingerstick, I don't think we generally did that. There may have been an exception or two, but that wasn't our general practice.
So if you were doing a fingerstick demonstration, it would generally be put on, or your practice at least, and what you were aware of was that they would be tested either using the TSPU or the third-party modified devices.
Yes.
Yeah, you mentioned the building at 1601 a few minutes ago, and if I understood your answer, you said that there was a CLIA lab space there, but that there were some R&D activities conducted in there. Did I understand that?
Yes.
Correctly. Was there where was the CLIA lab at 1601?
So I think originally it was upstairs and downstairs, and I'm trying to remember if it started upstairs and then expanded downstairs. I'm not completely sure, but there was a part of the clinical lab was on our first floor, and then I think it later expanded to the second floor downstairs.
And where was the sort of the Walgreens mock-up room?
Right by the entry lobby to the building.
On the first floor?
Yes. Yeah. That's what I'm calling upstairs.
All right, I think I lost you. So,
Yeah.
so the entrance to the building is on the
Ground floor.
The ground floor, and then there's a basement to that. Okay, and so is it the original CLIA lab was in the basement?
No.
I got it backwards.
Yeah, maybe I didn't explain it well, sorry. The original CLIA lab was on that ground floor, which I was calling the upstairs.
Okay.
And then later we expanded to that downstairs floor, which I was calling downstairs.
Was there a separate R&D lab at that 1601 address?
There was.
Where was that?
That was also on the ground floor, the upstairs.
Okay. And I guess how are these labs separated anyway?
The CLIA lab that was on the ground floor was physically isolated. We constructed it to be a dedicated space, and then the R&D facility that was on that same floor was also its own contained space. The lab that was on the downstairs facility was also self-contained, although there was some R&D equipment in it at different points in time that was being used to evaluate new lab-developed tests to come up. And I think there were the dividers that you can put in rooms that just separated off that space so that they would be isolated.
Okay. And you mean contained space? There's like a door or a wall?
Yes.
Something.
Yes.
Was there a distinction in terms of where the commercially available analyzers were placed, either on the upstairs or downstairs labs at 1601?
I believe the commercially available analyzers were in the upstairs lab at 1601.
And were there ever, I guess, actually I think I understand your answer. Thank you.
Actually, could we take a quick break?
Yes.
We're off the record at 2:18.
If you wouldn't mind just taking a...
We are back on the record at 2:35.
Ms. Holmes, did you have any substantive conversations with the SEC staff during the break?
No.
So we were just talking about the technology demonstrations before we went on the break. And I think we were talking a little bit about the instance in which third parties would come to Theranos' office and a demonstration would be conducted there. So I just wanted to talk a little bit more about that process.
Yeah.
So when you did invite others to come to your office, and there might be a different purpose for that visit, but part of the purpose was also to demonstrate the technology, what would you do to prepare for that demonstration?
I don't know. I didn't generally interface that deeply in the preparations for anything that was associated with the clinical lab or sort of the demonstrations that ran in it.
So you mentioned there was a room at Theranos somewhere on that ground floor where blood draws would be taken. Was that also the room in which if devices would be shown to third parties, that room would be used to show those devices as well?
No, I believe there was a different room that had the devices in it, and it, to my memory, had a number of different devices, the 3 series and the 4 series models that we were working on.
Where was that room located?
Also on the ground floor.
Was it next to the blood draw room?
No, it was further down the hallway.
Okay, so you said that there were some 3 devices, some 4 devices in there. You're talking about version 3 or 3.5 and version 4 of MiniLab?
Yes, and that would have changed at different points in time. That's just a memory I have of the room, but it wouldn't always be the same.
Okay, and so were there already devices in that room? Or before a demonstration, would you need to instruct somebody to bring the devices into that room?
I think it depends on the specific demonstration. I mean, there may have been devices in there for periods of time, and then there wouldn't be.
Were there ever, did you recall any times in which you would request for Theranos employees to help prepare a room and to actually bring in sort of rows of the TSPUs into the room to make it look like they were sort of stacked one on top of each other in a row? Did you ever recall that ever happening?
For a demonstration? I don't think so. I mean, there were periods of time in which we had the TSPUs on racks in the R&D lab, and when we were at different points in time thinking about how we could use them in hubs, but I don't have any specific memories of demonstrating that necessarily.
Okay, so you just mentioned that there was a time in the R&D lab when they were on racks.
Yes.
And you said you were thinking about using them in the hub. What did you mean by that?
We would look internally at if you were to try to use a lot of them together, what would it look like? So they were on racks for that purpose, but I don't remember demonstrating that at 1601.
Why were you looking at running all of them together? What was the purpose of having them all on racks?
My memory was at different points in time we were trying to see if you needed more than one in a location, how you would put them together, and looking at things like whether they overheated and these types of things.
Why were you looking into having them all together, though? What, were you having discussions with another party about possibly putting these machines in a room, or why were you doing this exercise?
I can't remember. I just remember that early on we looked at a lot of different models of what you could do with these TSPUs and what the best way to build out the business model around them was.
Okay, so you mentioned also earlier before the break that typically you would use the same types of devices to conduct testing on demonstration samples as you would use for clinical samples. Do you remember that testimony?
I do.
So sometimes there might be an instance in which a commercially available machine that was modified by Theranos would be used to conduct testing on a demonstration sample.
That's my understanding from what I've learned about the demonstration process.
Okay. And did you ever bring one of those commercially available machines up to that demonstration room with the other TSPUs, or bring the third party down to your lab to see that machine, to say, this is the machine that's going to be conducting the testing on your sample?
You can't move the commercially available machines. They're very large. I don't think we very often walked people through the labs. There may have been a couple of instances in which we did. I don't have specific memory of visits in which I was ever in the lab with people.
Okay. And do you ever recall telling the people whose blood was being drawn and tested that their blood would be tested on commercially available machines?
Not in the context of a demonstration, no.
So you just mentioned that the commercially available machines are typically very large.
Yeah.
How large are they in comparison to the TSPU?
And just to be clear, you're talking about commercially available machines, meaning the ones that were used for venous straws?
Well, are they any different from the ones that you had modified? Were you using the Advia also for venous straws?
We were, yes.
Okay. So I guess let's compare the Advia, the Siemens Advia 1800 analyzer to the TSPU. So how would you compare the two in terms of size?
The TSPU is about the size of a desktop. The Advia is probably, I don't know, almost half of this table, maybe a little bit smaller.
Okay, so something like 10 feet across, would that be?
6, maybe 5.
5 or 6 feet across?
Yeah.
And the TSPU is something like 2 feet?
I'll be wrong about the dimensions, but yeah, 2 by half of, I don't know, less than 1 foot, I think.
Okay, so it sounds like the Siemens Advia machine was much larger.
Yes.
By maybe 5 times the TSPU. Would that be fair to say?
Sure, about that.
Okay.
Yeah.
Were you aware of times when Theranos would choose only tests that could be run by fingerstick to be tested on people coming in for demonstrations, rather than tests that could only be run through a venous straw?
It was my understanding that to the extent we ran fingerstick, there were a limited number of tests that we could run on fingerstick, and so we would only run those tests on fingerstick.
Okay, but if somebody came in and asked to have a test done and that test could only be done through a venous draw, were you aware of occasions when you or somebody at the company would make the decision not to run that test because it would require a venous draw?
So it's my understanding our practice at retail was that we would tell people that we would need to drop a test to be able to run the order on fingerstick, and it was my expectation generally that the same thing was done for demonstrations unless we were trying to do something different, but that was my general understanding of the process.
So your general understanding was that if somebody came in for a demonstration and they requested a test that could only be done by venous draw, that test would be dropped and they would be told?
Yes.
So what would they be told about why the test was being dropped?
I don't know specifically. I wasn't personally involved in a lot of those conversations. I think generally our messaging at retail was that if you want a fingerstick order, you're going to need to drop this analyte. Would you like to go ahead with the test? And people would say yes or no, and we'd then fulfill the order based on their response.
Were you present at these technology demonstrations?
I'm sure sometimes I was. If we were talking about the TSPU and it was in the room, then yes.
Was Sunny Balwani also present?
In general, yes. I mean, I would want to talk about a specific instance to respond completely, but yes.
Okay, and were there instances in which neither of you was present, that somebody else from Theranos would be running the demonstration?
It could have been.
Who would have done it if it wasn't you or Mr. Balwani?
I don't know specifically. It could have been some of the different project managers, but I'm not sure.
So if we would talk about the devices, and you mentioned having a room with kind of multiple iterations of the device.
Yeah.
At one point in time, did Theranos attempt to develop a TSPU that had multiple ports or multiple cartridge receptacles?
We did.
When was that, and what was it called?
So wonderfully, it was, I believe, also called Minilab, and I don't know what years we were working on it. I would guess it was between 2011 and 2013, but I'm not sure.
Was it? I mean, did you consider it to be a 4 series device or a 3.5 iteration? I guess, in your mind, what category did it fall under?
I don't know if it was either. It was closer to the 4 series than the 3 series, but it was sort of its own category.
What was did anyone ever call it like a multi-bay device?
I recognize that name. I think that was an internal name.
What was the purpose in designing that device?
That was in response to Safeway's request to invest in and develop a specific version of Minilab that could fit into the cabinets that they were building in the Safeway stores.
Did you have a understanding of why Safeway was requesting kind of a TSPU of a specific kind of cabinet size?
The CEO at the time had a vision for what the wellness centers in Safeway could look like, and he thought that based on the volume that they would be seeing in the stores, that multi-bay design would be the best design for the Safeway stores, and so we began investing in developing it.
Is it fair to say that the multi-bay TSPU was sort of another solution to sort of the throughput problem that you've described earlier?
It's a different throughput problem. This is a throughput problem at the point of care, but yes, it also would allow for handling throughput at the point of care.
What happened to the development of the multi-bay?
We stopped it at a certain point, and I don't remember when and why specifically we stopped.
Okay, so heading back to the demonstrations now.
Yeah.
So Were there times when you chose not to perform certain tests because they could only be done on a venous draw than a finger stick, or that you decided to pull them from the list of tests that people would be coming in to do during the demonstrations?
I don't know that I completely understand. The question is whether we stopped doing demonstrations because we couldn't do it on finger stick?
Were there any times that you can recall where somebody came in with a list of tests that included a venous draw, a test that could only be done through venous draw, and you chose not to perform that test because you because it just couldn't be done through either the TSPU or the modified protocol on the third-party device?
I don't recall instances in which we chose to do that. I recall instances in which we asked people whether they would like it to be dropped, and they indicated yes, and we proceeded.
Okay. And do you recall any instances in which you chose to perform certain tests on the list that people were coming in with, but to limit the number of finger sticks that would be done, and so it would only be performing certain tests because it could be performed using a limited number of finger sticks?
I don't recall that. I know that, ultimately the number of tests you do correlates with how much blood you can get.
Okay, and do you recall an instance in which, you or somebody else at Theranos made the decision? It wasn't the decision of somebody who came in to do the testing?
Specifically, what decision? So I best answer that question.
The decision to drop certain numbers of finger sticks from the draws because, let me just start over again. Was there ever any occasion where you or somebody else at Theranos made the decision not to run certain tests because it would require a larger number of finger stick draws? And so you would drop tests so that it would only require, say, 1 or 2 finger stick draws.
So I know that generally we were trying to limit the number of finger sticks you would do on a patient, and we had different rules at different points in time in our service center. And I'm aware that generally we focused on trying to have as few finger sticks as possible to improve the demo experience.
Okay. So why did you do that?
It just makes it a better experience for the patient.
Okay. But if somebody's coming in with, say, 10 tests, and that required 5 finger sticks, even if it doesn't create a better experience for them to do the 5 finger sticks, why wouldn't you just do the 5 finger sticks for them? If you understand, I'm not really understanding why the better patient experience trumps what a patient would want to get done.
I don't think we offered that. I think we, as part of the service offering, set a limit of finger sticks. I believe it was 3 at retail, and if it was ever more than 3, then we would just automatically revert to the butterfly needle draw in the arm. And for demos, I think we generally tried to have it be as few as possible.
How many tests could be run on a single finger stick draw?
So it depends on how much blood comes out of the person's finger, which is different, person by person.
Okay, let's say you're able to get the max amount of blood on a single finger stick. How many tests could be run on that finger stick draw?
A large number. You can get hundreds of microliters out of a finger if you get the max amount of blood. So a complete order.
What is a complete order?
It's generally 3.2 CPT codes, which is 30-something tests or more.
So Theranos was able to run 30-something tests on a single finger stick draw of blood, so long as it was the maximum amount. Is that?
That's my understanding.
Your understanding?
Yeah.
Well, there's this kind of finger stick.
I'm going to hand to you what's been marked as Theranos Exhibit 202.
Do you want?
Oh, you can put that aside. Thank you.
Thank you.
Theranos Exhibit 202 purports to be an August 13th, 2013 email from Elizabeth Holmes with a copy to Sunny Balwani. Subject line is read devices in the demo room for tomorrow's meeting starting with Bates number TS-0375316. Have you seen Theranos Exhibit 202 before?
I don't recognize it, but I see the email to and from me.
Did you draft and send Exhibit 202 on or about August 13th, 2013?
I don't have any reason to doubt it.
Okay. You'll see in the bottom half of the email is sending an email to you and Sunny Balwani. Do you see that email?
Yes.
And he writes, the following devices are planned to be in the demo interview room. Number 1, 3.5 Edison with demo app set to run null protocol. Number 2, 4S with demo app set to run null protocol. And number 3, Mini Lab with demo app set to run null protocol. And then finally, number 4 is Mini Lab with demo app. Note that this will not be able to run the null protocol due to old pipette nozzles that fail once they initialize in the protocol. We can keep this in the room for show, but if we demo on a Mini Lab, it should be the other Mini Lab. Do you see that?
I do.
What is the demo app that is being put on these machines?
I don't know.
And what did you understand null protocol to mean when you received this email?
I'm not sure what I understood at the time. I was speculating earlier that it's probably one of the test protocols or QC protocols.
Okay. Do you think the demo app and the null protocol could be the same thing?
I don't know. I'm not sure.
Did you ever ask Lynn what he was talking about after he sent this email?
I don't know. I assume I had some understanding of it at the time, but I don't know.
You assume you had some understanding at the time?
That we were going to be showing Mini Lab technology for some purpose. I don't know if I knew specifically what this software was referring to or not.
So in number 4, where it says that the Mini Lab will not be able to run the null protocol because of old pipette nozzles that fail once they initialize in the protocol, were you aware of this issue back then in 2013? An issue with the pipette nozzles?
I don't know if this was a specific issue with pipette nozzles or just that this instrument hadn't been maintained, that there was just old nozzles on the device, so it wasn't, I'm inferring from this, able to run whatever protocol the other ones were running.
Okay. And then number 5, he writes, we haven't discussed this, but would you also like to have the 3.0 Edison that can run the H1N1 military demo on it? And so what is the H1N1 military demo?
I believe this was the decision support application that we'd built, the user interface.
What is that decision support?
So when we were talking earlier about different purposes of different demos, on the software side, one of the greatest utilities that we thought we'd have with the device was the ability to have untrained operators put a series of inputs in based on symptoms and then be able to show on the screen, based on the inputs they put in, what condition they had. And so that one just ran, I think, that specific software.
So the H1N1 military demo, that's where people put in symptoms and what it tells you what test to run?
No, this one I think tells you based on the symptoms whether you have a certain infection.
Okay. So what does that have? What's the connection with blood testing there?
So the same machine that had the decision support could then also incorporate the technologies that we were doing for laboratory testing. And the concept is, in remote settings, you could use both the decision support as well as the lab data to facilitate care.
Okay. So you then respond in your email, yes, re 3.0, thanks. So you're telling him, yes, let's include the 3.0 mini lab. Is that your understanding of what you're responding to here?
Yeah, it looks like it.
Okay. So this email chain was being sent August 13th, 2013. Do you remember what demonstration this was for?
No, I don't.
It seems like as preparing a number of TSPs to be put in a room. Do you recall if he might have placed a commercially available machine in the room for view by whoever was coming by for the demonstration?
No, commercially available machines, to my knowledge, were only in our clinical lab.
Okay, so they wouldn't have been in that same room with these other machines?
I don't think so.
You can put that one aside. Handing to you what's been marked Theranos Exhibit 203.
Thank you.
Exhibit 203 purports to be an October 10th, 2014 email to Sunny Balwani and Elizabeth Holmes. Subject line is re-visitors to WAG Saturday, with starting dates number TS-083091. Have you seen Exhibit 203 before?
I have.
What is Exhibit 203?
It's an email to Sunny and myself about a demonstration.
And did you receive and review Exhibit 203 on or about October 10th, 2014?
I don't know if I received it at that time. I reviewed it later in preparation for testimony here.
How many documents did you review in preparation for testimony?
I don't know specifically. A number of them.
And what did they pertain to? What topics did they pertain to?
Generally, I don't know if I would categorize them all in one area. Our operations of the business over the course of the last many years. I'm trying to refresh my own memory and recollection on a lot of different areas, some of which I wasn't that involved in.
Were there any documents that you reviewed outside of being shown documents by your counsel?
No.
So if you take a look at this email, you'll see in the initial email on 982, which is the second page, there's an email to you and Sunny Balwani. And he says, where can I find the list of names you mentioned who could come into WAG on Saturday? Do you understand WAG to be referring to Walgreens?
Yes.
We will send over the different workflows for how we will accommodate fingerstick regardless of what's on the order and possible issues associated as requested. First of all,
we were discussing earlier.
Okay. Were they at one point a potential investor in Theranos?
They were.
So what?
At this point in time, were they a potential investor in Theranos?
I think at this point in time we'd engaged with them to be an advisor to us, and then later they became a potential investor.
When do you think how are they engaged? What advisory services were you engaging them for?
In general, the restructuring that we wanted to do by bringing in family controlled sort of funds or companies, investors, and then trying to structure ourselves as a private company, and they were going to be our financial advisor in that context.
And do you recall, I guess, how soon after the time period in which they were sort of in that advisory role, they also became a potential investor in Theranos?
My understanding is that the term sheet discussions with them were in December of 2014. I don't know when exactly the transition from thinking of them as someone we wanted to retain as an advisor moved to when they were looking at us as an investment.
Was there any discussion with you about them forming a fund through which these other families would be investing through?
I don't know. I don't
So,
know.
so when you said that they were performing an advisory role to Theranos, was it mainly sort of a finder's role to introduce Theranos to some of these families that Theranos was looking to obtain as investors in the company?
But initially, when I first met, the concept was that he would advise us and me on how to structure the company as a private company for the long term, and he has an advisory role with a lot of the people behind these companies, and so I thought he could be a partner in helping us to think about who to bring in and how to structure it, and ultimately, if we tried to say private, how to structure the company. Then as some of these families became interested, we were talking with him about it, and I think they became interested in potentially being an investor. There was a lot of discussions about that.
Okay, so when it talks about the different workflows that he'll be sending over for how to accommodate fingerstick regardless of what's on the order, what did you understand him to be referring to there?
So I don't know if I read this at that time. In having reviewed it recently, my understanding is he's trying to communicate around doing a fingerstick for whoever is coming to do the demonstration.
And why was it important to accommodate fingerstick regardless of what's on the order?
My understanding is that this was the type of situation in which whoever was coming wanted to experience a fingerstick, so we were going to try to offer a fingerstick for the demonstration.
And just so I understand, that's your understanding now, after having reviewed the materials. What was your understanding back at the time in October 2014?
I don't remember receiving this email or engaging on this at that time.
Okay, so then if you turn back to 981, there's another email from to you and Mr. Balwani, and he writes at the top, also wanted to send along our thoughts for how to accomplish the FS in the scenario their orders prompt Venus. So do you understand FS to be referring to fingerstick?
I do.
And would you sometimes use FS in your emails to refer to fingerstick as well?
I don't know. Maybe. I don't have memory of that, but I wouldn't be surprised if I did.
Okay. And would you use, would it be surprising to you if you used it in other methods of communication, whether in text messages or in other documents?
Again, I don't have memory of it, but I believe that's what it's referring to here.
He goes on to say, assumptions here from EAH are that we must not do Venus drawn. We cannot tell them that their order prompts Venus if it does. Is EAH referring to you?
Yes.
Are those your initials?
Yes.
Okay. So what is he referring to here when he says that the assumptions here from you are that we must not do Venus drawn? We can't tell them that their order prompts Venus.
Honestly, I don't know. My understanding in looking at this now is that this is a situation where whoever was coming had told us they were coming and that they wanted to do a fingerstick, and we were trying to be prepared to do a fingerstick. That's my best understanding of it.
Do you recall telling that that a Venus draw must not be done?
No.
Do you recall telling him that he shouldn't tell them if the order prompts a Venus draw?
No.
Why would it be important not to tell people that their order requires a Venus draw?
I think this was a case, and this is my best understanding from having reviewed it recently, in which whoever was coming wanted a finger stick, and so we were trying to communicate to our teams. They've told us that they're coming to do a finger stick. Please do a finger stick.
Did anyone communicate to you that they wanted a finger stick for this visit in the October 2014 timeframe?
I don't know. That was my best understanding from looking at this document, that they'd communicated that to somebody.
But you don't have any memory of, back in your mind, back in the October 2014 time period, recalling a conversation with?
I don't.
Okay, so if you look down towards the middle of the page, there are two scenarios. I wanted to focus on scenario 1 first. So scenario 1 says, scanned order from VIP contains tests that prompt for venous draw. Do you see that?
Mm-hmm.
And then there are two use cases, use case A and use case B. Why don't you take a look at that section of the email and let me know when you're done. What's the difference between use case A and use case B here?
I'm just looking at it again in that context. I'm actually not sure.
So use case A says venous is prompted due to some tests not yet being on FS or finger stick, but would otherwise prompt FS. Do you understand what that means?
Reading it now, it looks like he's referring to a hypothetical scenario in which there are some tests that have not yet been brought up on finger stick, but I'm not completely sure.
Okay, so in the next bullet point he says remove tests that are not yet on FS and complete transcription.
Mm-hmm.
Do you see that?
Yes.
And then the visit is completed per SOP, and then he goes on to say negatives need to either tell the patient at the store that we will not run a few tests. This would require calling the store to have them tell the patient, since it cannot be handled through the app, or tell them on the back end that we could not run certain tests. You see that?
Yes.
Okay. And then use case B, that's venous is prompted due to volume of tests, but tests would prompt FS if ordered individually. What did you understand that scenario to be about?
My understanding now is that if the tests were validated on fingerstick, but that there were so many of them that you wouldn't be able to run them all from a single visit's worth of fingerstick.
Okay, so in other words, I think you mentioned something about there, a single fingerstick draw. If the person was a good bleeder, you could actually run 30 tests. So you think that in this scenario, this person might come in with more than 30 tests to be performed?
I'm speculating. I don't know what he meant, but that's my best guess in looking at it right now.
Okay, fair enough. And then if you go to the sub-bullet points underneath, it says remove enough tests in SM to allow patient to proceed with FS. What is SM?
I don't know.
Is that the name of some system that Theranos uses?
I mean, I could speculate that it's a piece of software, but I'm not sure.
And the next sub-bullet under that will determine what combination of CTNs are required to complete the full order and communicate this before she brings the IP into the draw room. What does CTN stand for?
Capillary tubes and nanotuners.
And then the next bullet point will collect the number of CTNs required with as few sticks as possible. She will flag the samples so that they are handled with extra care when they arrive at the lab. And finally, there are the negatives. The first bullet point, if VIP is a self-pay patient, cash or credit, then the receipt printed by the app will only show the test transcribed, which will not include all the tests on the order. And the second bullet point says, if they notice missing tests on the receipt, they may ask the WAG tech about it. Worst case, they would make a call to tell them everything is fine. Also be able to come out of the draw room once check-in is complete to welcome them into the room and distract them from looking at the receipt. Why was it necessary to distract the person from looking at the receipt?
I don't know why this was written here. My understanding is that we followed exactly what the SOP is that we did at retail, which is this case A. That would have been my expectation, and I believe that's what we did for this visit.
What's your basis for that belief? Did you review some other documents that suggest the SOP was followed?
I did not review other documents, but it's my understanding that that's what we always did.
Have you spoken with about this document?
I have not.
And just to check on a couple of things. So here, when this is referring to...
I don't know. I think so, but I don't know.
And then...
I think so.
And at Theranos?
She was, yes.
She was, okay. Okay, you can put that one aside. Handing to you what's been marked Theranos Exhibit 204. Exhibit 204 purports to be an October 13th, 2014 email to Elizabeth Holmes with a copy to Sunny Balwani, and subject line is retesting in Arizona with starting dates number THPFM 000-130-8054. Have you seen Exhibit 204 before?
I believe so, at least parts of it.
What is Exhibit 204?
An email exchange. It looks like it's actually several email exchanges. Originally between me and Rob Walton, and then it looks like later from our team to me and others in the company.
Did you receive and review Exhibit 204 on or about October 13th, 2014?
I don't remember that, but I don't have any reason to doubt this.
Okay. It's on the subject line of the email. Were there discussions between Theranos and Rob Walton at this time in October 13th, 2014?
I'm looking back at the original email, which is dated September. I believe that I met him in September and had discussions with him at that time.
And what were those discussions about?
Those are the conversations we were talking about earlier about the vision initially for what this could be with Walmart and what we were trying to do with low-cost testing.
Were you also having discussions with him possibly with the possibility of Mr. Walton investing in Theranos as well?
So we later had those discussions with Greg Penner, who's part of Madrone, which is the fund that Rob is affiliated with.
Okay, and when were the discussions with Madrone?
I don't know specifically. Around this time frame or slightly later.
Okay.
Did you meet Rob Walton at that BDT presentation or around that time?
Yes.
Which one was it? Did you meet him at the presentation, or did you meet him around the time of the presentation?
Around the time of the presentation, I had a physical meeting with him in Chicago while that conference was underway. I don't know that I met him there, but I met him around then, if that makes sense.
So I'm assuming your presentation was some amount of time. You spent more than that amount of time in Chicago and
had meetings.
And to the best of your recollection, he was one of the people you met there. whether at a BDT organized event or otherwise?
Yes, I had a meeting with him during that trip.
Okay.
Yes.
Okay, so if you look at, I think you're looking at that, the last page of the document, which has Bates number 63 on it. So the first email from Rob Walton to you is an email where he says it was great to meet you in Chicago last week. Do you see that?
Yes.
Then you respond back to him and you tell him that it was great to meet him as well. You then write, can arrange the tests and appointments for you and we'll follow up on this note directly. Do you see that?
Yes.
So you're referring there to, when you were referring there to arranging the tests and appointments, had you discussed with him the possibility of him coming in for some testing?
So I don't remember specifically, just looking at this document now, it looks like it's referencing an invitation that we'd made to try to show them what the wellness center experience could be like in the context of what we were trying to roll out, and if we were to partner with Walmart at that time.
So did you say that you believe that he wanted to experience the experience if you were to roll out with Walmart? Is that what you just said?
What that experience would be like.
What that experience
Yes.
would be like, okay. And would that include testing on the Theranos device?
Not necessarily on the device, but using the nanotainer for fingerstick collection.
Okay. And so did he tell you, I just want the experience with the nanotainer, but I don't mind which device you're going to be using to conduct the testing?
I don't believe there were ever conversations on what devices were being used to conduct testing in the clinical lab. It was more, we'll collect some samples from fingerstick and show you the experience of collecting a fingerstick.
So you never had any discussions with him about the actual devices that would be rolled out as part of a Walmart relationship with Theranos?
I don't remember the specific conversations. To the extent we would have discussed what we've been referring to as phase 2 of our model, we would have talked about our TSPU devices, but I can't remember a specific conversation with him about that. I, again, believe that this conversation, particularly with Walmart, was about low-cost testing.
Okay, so if you turn to 61, which is 2 pages in front of the page you're looking at. There's an email from, I think you've passed it already, so it's the page after that page. There's an email in the middle of the page from Rob Walton he's listing a number of tests that his doctor has ordered for him to do. Do you see that list?
I'm just reading it. Yes.
Okay, and if you turn another page over, actually 2 more pages on 59, there's an email towards the bottom of the page that's written by you on October 6th, and you're writing to a number of questions, it looks like. You asked, do we have our sign and branding on the door to the Wellness Center? You asked if there are desktop little bamboo trees in the room and either a small waterfall or some LCD display of fish. Do you see that? Mm-hmm. Okay. Why are you asking him whether or not those things are in the room?
Because we wanted to make sure that the specific wellness center that he would go to would be representative of what we hoped to have discussions with him about rolling out more broadly.
And then actually you'll see that before your email is on the top of that page. There's an email from writing back to you, and he says, please see my comments below. Mm-hmm. So does it look like he incorporated some of his answers into your questions in your email?
I think so. I can't.
So, for instance, on the first one, do we have our sign and branding on the door to the Wellness Center over the Wellness Center? And there's a dash. Is going to the store today to check it out. This will be there if it's not all there already. Would that have been a response to you?
I think so.
Okay. So, going back to that same page
Yes.
on 59. So, after you ask those questions, you say you should loop in on this to ensure it is PM'd perfectly, to which responds done. And then you go on to say, also get his order in our system in advance so his identity remains confidential. Do you see that?
I do.
And responds, this will be done. Indicated that she will need to call the physician to confirm which liver function test to perform. Do you see that?
I do.
Okay. And then going up the page to your response back, it's on the same page. And this is still October 6, 2014. You then respond, do not have a call the physician, work with which ones we can run from the least number of CTNs, and we will do that. Why were you telling to instruct not to call the physician?
I don't know. I can speculate just on reading this now that it's because those are well-defined tests. It's a standard.
The well-defined?
I'm sorry. I can speculate just in looking at this right now that these are well-defined tests, so we didn't need to call a physician to ask what they were. Liver function is a defined panel.
Okay. So you're saying that it's asking, was telling you that would call the physician to see which test would be performed under the liver panel, and that you thought there was no reason to call the physician because you knew which liver panel tests needed to be performed.
I'm guessing, but just in looking at it here, that's my interpretation of this.
Okay. So why would you say work with which ones we can run from the least number of CTNs, and we will do that?
I think that in general we were trying to have as few finger sticks and as little amount of blood as possible for this and our demos.
Okay. Why, and in the end, did you end up telling Mr. Walton that there were certain tests that you decided to run and certain tests that were not run because you were trying to reduce the number of finger stick draws that would be necessary?
I don't know what tests ended up being run for that.
Okay, but did you tell him that there might have been certain tests that were dropped off the list?
I don't know that the tests were dropped off the list. I think we may actually have satisfied his order. I'm not sure.
But you don't recall any conversation of that nature happening with him?
I don't. I don't think I specifically interfaced with him on the demonstration, but again, to the extent we would do that, we had an SOP for that at retail.
Okay, you can put that aside. Handing to you what's been marked Theranos Exhibit 205. Exhibit 205 purports to be a December 31st, 2014 email from Elizabeth Holmes with a copy to Balwani and with subject line re-VIP tomorrow -PT PTT with starting dates number THPFM 0000331112. Have you seen Exhibit 205 before?
I believe so.
What is Exhibit 205?
I think it's an internal series of email exchanges about a demonstration.
Did you draft and send Exhibit 205 on or about December 31st, 2014?
I don't remember it, but I don't have reason to question the document.
Okay. So if you turn to 1116, which is the last page of the document, there's an email from, he writes in his email, there's a VIP coming in tomorrow with PT, PTT on his lab order. It would be greatly preferred to collect via finger stick. Would it be possible to run PT and PTT from a CTN? Was VIP a term that you used to refer to people coming in for demonstrations, such as investors, prospective investors, business partners, the board?
I've seen the term. I'm not quite sure who specifically they used it for. I can infer that it was demonstrations that they thought were important, but I don't know exactly what types of people generally fell in that category.
Did you ever use the term VIP?
I don't know. I don't have memory of it. I might have. I don't think so. I may have adopted it if other people were using it.
Did you ever tell the project management team that certain demonstrations were important?
I'm sure I did. I can't sit here and remember one right now, but we always wanted to make the demonstrations go really well.
So, and actually going back to his statement where he says it would be greatly preferred to collect via a finger stick, why would that be preferred?
Again, it's my understanding that sometimes when people were telling us they were coming for a demonstration, they would explicitly communicate, we really would like to experience a finger stick, and we tried to do that.
Okay. If you turn the page to 1115, you'll see there's some back and forth that follows to answer questions. So, do you know who she is?
I do.
Who is she?
She's a scientist and now a team lead at Theranos.
Team lead, so what does that mean?
She manages a group of scientists.
Okay, and what does she do? What kind of science does she do?
Clinical chemistry.
Clinical chemistry. So what does that mean in terms of the Theranos business?
There's certain tests that her group focuses on that she has worked to get on the mini lab, and now we've just hired a new head of product development, and he's expanding her responsibilities to broader groups of tests.
Okay, so does she work on the assays or the chemistries?
Yes.
She does. So she's a team lead for one of the assay groups.
She is now. At this point in time, I'm not sure exactly what her role was. She may have been affiliated with the clinical lab at that point. I don't know.
Which of the assay groups is she a team lead of now?
The clinical chemistry.
Oh, clinical chemistry. Okay, and what does that mean in terms of what types of tests fall in the clinical chemistry group?
Chemistry panels like the metabolic panel. Again, her responsibilities are at this exact moment expanding because of the new leadership we've brought in on the product side. And we're particularly focused on only Zika right now, but the team of people that she's leading right now have expertise on those types of chemistries.
Okay. And there's also another person on here that we haven't talked about before. Who is she?
I believe she worked in the clinical lab, but I'm not sure what her official role was.
Okay. Right. I don't think we can run PT and PTT on a FS right now. Previous runs were on TCAN in 1601. Since we pulled PT from TCAN a while back, I'm not sure either PT or PTT is validated using that method. Also not sure if there are still validated lots of reagents and controls in Normandy. The last PT demo I did was in October. I do have a good working PT protocol on FS, but it is far from validated. So there are a number of acronyms here. What are PT and PTT?
I believe this is referring to two tests for prothrombin time, and I don't know what PTT stands for, but I think it's affiliated with birth, thrombin time.
Okay. And the TCAN, what is that referring to?
I mean, reading this now, I believe this references to another one of the open platforms on which we could put our proprietary chemistries in the clinical lab.
Okay, and then 1601, is that referring to your office address?
The building that we were in at that time, yes.
Okay. And then finally, she talks about how there are still validated lots of reagents and controls in Normandy. What is Normandy referring to?
I'm not sure.
Is there a part of your CLIA lab that is called the Normandy lab?
I know they used that word to describe the sort of small sample finger stick operations at that time, and yes, they may have referred to a part of the lab that way. I'm not sure.
When you say they, who are you referring to?
Our team at Theranos.
You mean everyone at Theranos might have referred to the lab as Normandy?
I don't know who. I'm guessing.
Did you ever refer to the lab, to portions of the lab as Normandy?
I can't remember specific instances sitting here, but I could have. I don't remember.
So is what she's trying to say here that there's no validated method that can perform the PT and PTT test on finger stick?
I don't know that that's what she's trying to say. Reading this now, I read this as she's saying they've pulled the PT and PTT proprietary tests that we were, I assume, running from this email on finger stick, but I'm not sure.
Okay. So I'm sorry. How is that different from what I was asking you?
I understood the question to mean, is she saying you can't run PT and PTT? And I was responding that I think she's talking specifically about the use of our proprietary chemistry on TCAN. I believe there were other ways to run PT and PTT in the lab at that time.
Okay, and would those other methods be on finger stick?
I don't know.
Okay. So then if you go up one email from back to, he says, confirmed with Sunny that we need to make this happen for this particular patient. And then he says, note that we can run and report this as a technology demonstration. Why is he making that distinction?
I'm not sure.
Do you know who the VIP patient was that came in?
I don't know.
So if you keep going back, now we're on 1113 and 1114. At the bottom of 1113, you'll see an email from back to the group, and she says on 1114, the next page, I was thinking about this through my whole workout, so fun, and I think the best use of my time would be to practice doing the assays manually. And then if you flip to 1113, on the email that's Sunny Balwani writes back to her, back to her and maybe as well, he says, run manually but needs to be accurate. So do you recall that certain assays were being run manually?
I don't have specific recollections of it. Again, I was trying to speculate earlier about my best understanding of how these technology demonstrations were done outside of the clinical lab process, but I'm not sure.
Okay, and so who would have the best understanding as to how the demonstrations were run in the CLIA lab?
I believe Sunny would be the best person to ask.
For VIPs, would Sunny let you know how the demonstrations went?
I'm sure he did sometimes. I don't have memory of specific conversations with him. And sitting here now, I would assume that I would have heard if it was a problem probably from the person that I was interacting with, because to the extent I was involved in this, it was because I had a relationship with that person generally.
Do you recall an instance where any sort of VIP expressed any concerns or had an issue with their tech demonstration?
I can't remember any time where that happened sitting here. I wouldn't be surprised if it did. I mean, we've been a startup, but I don't have a specific memory of one.
How about any instances where Sonny communicated that he had concerns about a demo to you? Can you recall any instances of that?
No.
Okay, and then turning back one more page to 1112, sorry, the other way around, turning to the front page. On December 30th, 2014, there's an email from, and he says, all results are ready to be released. Mentioned we should not report CL since it's so high. What does CL refer to?
I'm not sure. I could guess that it's chloride, but I'm not. I don't know that for sure.
Okay, and then he goes on to write, for added background, there are no apparent anomalies in the daily processing. Both ADVIA's past QC and daily samples, ISE, are within TAE with no consistent offset. Is QC quality control?
I believe so, yes.
And what does ISE stand for?
I don't know what it means in the context of this sentence. I know those words to mean ion selective electrode, but I don't know if that makes sense in this sentence.
And what about TAE?
I believe it's a reference to total allowable error.
And then he goes on to say, should we report with CL pending redraw per usual protocol, or better in this case to go another route, i.e. not including I think he means CL, on the report, etc. Do you see that?
I do.
What did he mean? What did you understand him to mean? Should we report with CL pending redraw per usual protocol? What was your usual protocol?
I don't know. Reading this now, I interpret it to mean, do we include the value on the report and then say pending redraw or not? But I'm not sure.
Was that your practice for clinical testing? If something was out of range to include it on the report? But
I don't know. No.
Who would know the answer to that?
Our laboratory director.
Okay, who else would know besides the laboratory director?
Sonny might. I'm not sure.
Okay. And then you respond back on December 30th as well. And you write, it was that high on rerun too. What do we think happened? To which then responds back to you, yes, high on rerun. Do you see that?
I do.
And then you respond back, okay, don't include on report. So are you instructing the team there not to include the CL test on the report?
I'm not sure. Reading it now, I read this to mean if you have concerns about the value, don't report the value. But again, I don't have recollection of this email exchange.
Okay. Why wouldn't you tell them to just include it on the report, but ask the patient for a redraw?
So I'm speculating here, but my understanding was if you think that the concentration is incorrect, then you should not include it.
Okay, but I guess I'm just wondering, why wouldn't you just include it but say, you know, this is too high, we can't rely on it, let's do a redraw?
I mean, I'm not a laboratory professional, but my understanding is if you believe it's wrong, you can't report it.
Okay, and so do you know if the person who was tested here was told that this result wasn't reported on his lab report?
I don't.
Did you make decisions like this for lab reports routinely?
No.
Okay. Why were you making that decision this time?
Again, I can't remember this particular exchange. If it was someone who I was communicating with, then I would have been in the loop on these. And in general, my philosophy on all of this has been, if there's a question about a result, don't report it.
Okay, and you also mentioned that the the lab director would know what the practice was. Who was the lab director at this time? Was it still?
I think so, but I'm not sure.
So why wasn't he included on this email change?
I don't know. It looks like this was done as what's being referred to as a technology demonstration.
Was the lab director not involved in technology demonstrations?
I don't know.
Who would know whether that was the case?
Again, I would talk to Sunny.
Do you know if the same kind of review, which is, certain test results are coming back too high, should we remove it or should we keep it on? Do you know if those types of conversations were taking place within Theranos with respect to regular patient testing?
They should have been, but I now know that we had not effectively implemented our quality system.
Okay, and who would have been managing that process, reviewing patient results?
It was the job of the lab director and the director of quality for the clinical lab.
Okay, and who did they report to?
Functionally up to Sunny.
Okay. Did you have any supervision, or did you have any responsibility for overseeing that part of the business?
To the extent I'm the CEO of the company, I'm responsible for the company, but no, I was not engaged in it.
Why don't we take a short break, a little over an hour?
Sure.
This concludes media number 3 of Elizabeth Holmes. We're off the record at 3:46. We are back on the record at the beginning of media number 4 of Elizabeth Holmes. The time is 4:03.
Ms. Holmes, did we have any substantive conversations off the record during the break?
No.
So I want to turn gears a little bit, and you can put that exhibit aside. But I want to change gears a little bit and now focus on Theranos' relationship with Walgreens. Why don't you tell us from the beginning sort of why Theranos was interested in engaging with Walgreens, and conversely, what your understanding was of why Walgreens was interested in partnering with Theranos.
Well, it had evolved over a long period of time. We were interested in partnering with Walgreens because of the retail footprint, and we understood that they were interested in partnering with us to bring lab services to retail.
Okay, so when did you first start discussions with Walgreens?
I don't know specifically. I believe it was in 2010.
Who were your contacts at Walgreens at that time?
So it evolved over a period of time, amongst others, and
and you said it evolved over time. Were there others who entered the mix after 2010?
Yes.
Who else were you in conversations with at Walgreens after that date?
I know there was a team at Walgreens that was dedicated to working with us, and we tried to put a team in place on our side too.
Who was the main Theranos contact at Walgreens that you were working with? I'm talking about besides.
I don't know who the point was. Sunny was the point for our project team, and he had a counterpart at Walgreens. I don't know who specifically it was.
Do you know someone named?
I do.
Do you know what his role was at Walgreens?
I believe it also changed over time. I think we first met him when he was involved with construction in the stores. And then after the Boots acquisition, he took on a different role.
After the Boots acquisition, when was the Boots acquisition?
I don't know specifically, I want to guess in 2014, but I could be wrong. It might have been 15.
Was there a time when he became more closely involved in the Theranos-Walgreens relationship?
I think so, but I don't know. I didn't interface with him very much directly.
And you don't know who Sunny Balwani was interfacing with at Walgreens?
I know he did interface with, I don't know if it was his primary point of contact.
So, at the time that the 2010 contract was signed, was there a contract that was signed in 2010?
I think so.
Okay. At the time that it was signed in 2010, what did you understand that contract to provide? What services would Theranos provide, and conversely, what services would Walgreens provide to Theranos?
The original concept was that we would take our TSPU and place it in Walgreens stores to provide testing, and then try to bring other services like pharmaceutical trials and other things around it.
Okay. You said the original concept was to put the TSPU in stores.
Mm-hmm.
So at the time in 2010, I think you mentioned earlier in testimony that the TSPU was validated to perform about 15 tests. Do you recall that?
In the 15 tests were brought up in the clinical lab
Right.
in 2013.
But were being performed on the TSPU.
In the clinical lab.
Right. Is that your understanding? In 2010, that the TSPU was performing or was validated to perform about 15 tests in the clinical setting?
No, the CLIA lab didn't happen until after 2010.
Okay. So when you said previously in testimony that the TSPU could conduct 15 tests and was validated to conduct 15 tests, do you recall that testimony earlier today?
Yeah, I'm sorry if I didn't say it clearly. My understanding is there were 15 tests that were validated in the clinical lab, and then there were other tests that were validated in an R&D setting.
Okay, so the 15 tests that were validated in the clinical lab setting, then, that was your understanding as to the TSPU's capabilities to perform testing. Is that right?
No, my understanding was based on the work we did in the R&D setting and all the tests we developed and we thought validated, including on the TSPU.
Okay, and so what were the types of tests that you understood the TSPU was capable of performing? What were the categories of tests?
In 2013?
In 2010.
In 2010, by that time we'd invented the architecture of the 4 series system, I believe, and so we thought that we could run a broad range of methods on it. I don't know how many of the 300 tests were validated at that time.
So now you just brought up the 4 series. So my understanding of your earlier testimony was that the 4 series was still in development and was not actually running tests at that time. Is that not correct?
Maybe I'm sorry if I don't understand the question. I thought you were asking about what we thought the TSPU was capable of doing in 2010.
Yes. So I think you earlier said that the TSPU was performing about 15 tests, was validated to perform 15 tests in the clinical lab.
We did, yes.
Okay. So now you're saying that there was the mini lab 4 that was also conducting tests?
So we developed a few hundred tests in an R&D setting and developed, and I'm using the word validated to refer to our understanding of how they were validated at that time. About 90 or so of them went on the TSPU, the 3 series version of it. The others were on other hardware platforms. Later, about 15 of those were into the clinical lab.
Okay, so there were 90 that were developed for the TSPU 3.5, but 15 were validated for the clinical lab, and the rest were on what devices?
I don't know off the top of my head. I'm not sure.
Were these analyzers that Theranos developed and manufactured?
Some of them, like for the nucleic acid testing, might have been. Some of them would have been the reference platforms.
The reference platforms, what do you mean by that?
Hardware that was originally manufactured by third parties.
Okay, so I think earlier you said that so let me just step back because I want to make sure that I understand this because it's an important point. So I want to understand what were the platforms that Theranos was using for clinical testing in 2010. I think we talked about the TSPU version 3.5.
So Theranos wasn't doing clinical testing in 2010.
Okay, so what platforms then did Theranos have ready to perform clinical testing at that time?
Our concept in 2010 was to take our TSPU through the FDA to try to get FDA clearance and CLIA waiver, which was what was contemplated in the original Walgreens agreement.
Right. Okay, but that I would just want to go back to my question. So
Yeah.
what were the platforms that Theranos had ready to conduct clinical testing in 2010?
So the one we've done, and I'm sorry I'm getting hung up on the concept of clinical testing. Just to be clear, we couldn't do clinical testing without either having a CLIA lab or an FDA clearance. So until you have those things, you can't do clinical testing. We had put a large number of assays on our TSPU 3.5, and we're planning on taking either that and or our 4 series platform into the FDA.
Okay, so there's a 3.5 and there's the 4 series platform. The 3.5, you said, Theranos had developed how many tests to run on that device?
That's the one that I believe there were ultimately 90 or so assays. I don't know exactly the number.
Okay, so there were about 90 or so that had been developed for the 3.5.
Yes.
Of the 90, 15 had been validated in preparation for clinical testing. Is that fair to say?
So I believe in 2011 we became certified as a clinical lab, and then in 2013 15 were brought up in the clinical lab as laboratory developed tests, or around then. It may have been in the few months after the opening of the clinical lab.
Right, and so I don't want to talk about CLIA certification or any of the regulatory approvals that you would need to get in order to put these devices in stores, but I wanted to focus on what the devices that Theranos had manufactured, what those devices were ready to perform in terms of testing. Okay, so the 3.5, you said 90 were developed to put on the TSPU 3.5.
Yeah.
Of those 90, 15 were validated in preparation for clinical testing. Is that right?
Later, yes.
What do you mean by later?
As I understood it, you were asking about the 2010 timeframe. That work was specific to the clinical lab being live in 2013.
Okay, so the 15 had not been validated yet at that time. Is that right?
In 2010.
In 2010.
Not in a CLIA lab setting.
Okay, so only 90 had been developed at the time, but no validation work had happened yet in 2010.
So I don't know exactly when all 90 were developed. I know that ultimately about 90 were on the TSPU 3.5. We had done what we internally referred to as development and validation on the TSPU, which was to these FDA guidance documents as we interpreted them. And again, there's a separate process that is associated with validation of a lab-developed test in the clinical lab, which we had not done in 2010.
Okay. So then there's the 4 series mini lab. So what tests have you developed for the 4 series mini lab? How many tests?
Again in 2010.
Again in 2010.
Again, I don't know if or how many of the chemistries that we'd created we had put on it in 2010. I believe what we were mostly focused on then is demonstrating the ability to add these additional detection systems and essentially proof of concept of the additional capability of the mini lab.
Okay, so you're not sure as to how many tests, if even the tests were put on the mini lab yet?
Correct.
And you're not sure of how many tests could be performed if they had already been put on the mini lab?
Correct.
Okay. So what were the other platforms that Theranos was using or was planning to use for clinical testing besides the TSPU 3.5 and the 4 series mini lab
In 2010?
in 2010?
As we saw in the emails, there may have been other multiple iterations of the 4 series platform, but generally that was what we had intended to take into the FDA.
Okay, so there were other platforms that were similar to the 4 series.
There were multiple 4 series platforms,
Okay,
yes.
and what is your understanding as to what tests those devices were capable of performing?
It's the same generally across the 4 series.
Meaning that you're not sure whether they could perform the tests or how many?
In 2010, I am not sure what tests we put on the devices or how many, if any, I don't know.
Okay. Were there any other platforms besides the TSPU 3.5 and the various 4 series mini labs that you were preparing for clinical testing in 2010?
Our chemistries had previously run on open systems like the TCAN-like robots. I don't think in 2010 we were preparing for testing on anything except for these TSPU platforms that we wanted to get cleared for use at point of care.
Okay. So besides the TCAN devices then, was there anything else?
I don't know. That's what I can remember.
Okay. So as far as you know then, in the 2010 timeframe, there was one device that you know for sure, the TSPU, that was performing or that was capable of performing about 90 tests.
There was the TSPU, which ultimately we developed about 90 tests for. There was the 4 series platforms, and there were other hardware platforms we'd used over the years in our laboratories.
Okay, but I'm trying to understand, you know, out of all of the platforms that you were using at the time, as far as you know back in 2010, there was one platform that you know for sure was capable of performing about 90 tests, and that was the TSPU 3.5.
Yes.
Okay. And what were those 90 tests consist of? Like, what category of tests were they?
Proteins, small molecules, antibody tests, generally.
Okay. Are those the same as general chemistry? I think there's serology.
Some of them are serology tests.
Okay.
Some of them are immunology tests. They fall into multiple categories, as defined that way.
All right. And I think we talked a little bit about how at some point, so at first the parties were considering putting the TSPUs in stores, in Walgreens stores.
Yes.
Is that right? And at some point that business model changed. So what, and you might have mentioned this before, but I just want to make sure that we get this right again. So what caused the business model to change? And when did the business model change?
I don't know specifically when it changed. It was the result of continuous engagement with the Walgreens team to address some of the business model concerns that they had and to try to work with regulatory counsel to figure out the right way to do this that led to the decision to pursue what I've been referring to as a phase 1, phase 2 approach.
Okay, so it was because of a regulatory issue that you and Walgreens decided to go to a phase 1, phase 2 approach where in phase 1 you would resort to a central lab model where samples would be sent to a central lab and processed there. Is that right? And phase 2, the TSPUs would then be put in stores?
Yes, and I don't know if it was only a regulatory issue. There may have been other drivers as well, but certainly working with regulatory counsel was one of the drivers.
And so ultimately, did Theranos roll out its services in Walgreens stores?
We did ultimately with the phase 1, phase 2 model, the clinical lab.
Okay, and when did that happen?
The first patients were served toward the end of 2013.
And how many stores, what was the maximum number of stores that you were aware Theranos services had been rolled out to?
I think it was 41.
Why did it stop at 41?
We couldn't make the relationship successful beyond that.
Why was that?
I think there were many reasons. The Boots acquisition, the requirements that we had around what we wanted the wellness centers to look like, and then ultimately the issues that we had in our clinical lab and disagreements about the contract.
Okay, so let's go through each one of those. So the Boots acquisition, why was that a limiting factor to the rollout taking place beyond 41 stores?
We had worked really closely with the original Walgreens leadership around the vision for what this partnership could look like. The new leadership had a different vision for what they wanted to do with Walgreens, and wanted to reevaluate the contract we'd put in place.
What was the new vision that new management had at Walgreens?
My impression is that the old leadership team was much more focused on healthcare services, and the new leadership team was focused on instituting some of the same services that Boots had employed in the UK.
And what is that?
It was more of a health and beauty focus that they had made really successful in Europe.
How'd you gain that understanding?
I think it's my impression based on conversations with people in the industry and people who are familiar with the Boots leadership team.
I guess, did you have a lot of personal interaction with the Boots leadership team when they came on board?
I have not had a lot of interaction with them.
Who did you understand was leading the Boots team?
I don't know who was leading the Boots team.
And then you mentioned there were some clinical lab issues.
I mean, I know it's very actively involved. Yes.
Okay. I think you mentioned also there were some clinical lab issues that came to light. What was that about?
Our lab. We failed in the implementation of our quality systems and our execution, and Walgreens used that as a means to terminate the contract.
Okay, and then I think there was a third factor, which is escaping me right now. So you mentioned...
Was it the store setup?
The store setup. So was that a significant issue in the discussions with Walgreens?
It's my understanding that it was, that specifically we wanted to have effectively a leasing type relationship with them, and that we wanted a certain footprint and a certain build out, like a bathroom near where you're doing the collection, and there was a lot of discussions around the kind of investment that would be required to go into the stores for that.
When were those discussions occurring?
They happened over a period of time, even before the Boots acquisition happened with the old Walgreens management team, and we had believed, based on amendments to our contract, that we were going to proceed with rollout.
Okay, so you mentioned that the parties started discussing a rental model. When did that happen?
I don't know when those discussions started.
Who was involved in those discussions from Theranos?
Sunny Balwani led them.
Did he share whatever discussions he was having with Walgreens with you at that time?
I'm sure we had discussions about it. I don't have memory of specific conversations with him about a rental model, but I'm sure we talked about it.
Okay. And so what was the rental model about?
Once we became a clinical lab, the wellness centers in the stores were our service centers. And so instead of trying to sell devices and cartridges to Walgreens, which was the original concept, now we were effectively just using their space to provide a lab service. And so essentially it was about amending our contract to move to paying them for rent as opposed to a more integrated model.
Okay, and what did that mean for Theranos? Would Theranos then, of course, Theranos would now be paying rent, and where previously Theranos didn't have to pay rent, is that right?
Previously, we would have sold devices and cartridges to Walgreens under the original model.
Previously, you would have sold devices and cartridges, so you would be receiving money from Walgreens in exchange for the use of these. And when you say devices, are you
Correct.
talking about the
TSPs.
nanotainers?
TSPUs being placed at Walgreens.
Oh, you're talking about the actual analyzers
Correct.
being placed at Walgreens.
Yeah.
Okay, I thought we had been past the phase where the parties were talking about putting the TSPUs in Walgreens, and we were now on the phase 1, phase 2 business
sorry,
model.
I didn't realize we'd switched to that.
Okay, well, I guess maybe it makes sense. So when did the rental model discussions happen in relation to the phase 1, phase 2 business model?
After
taking
the
shape?
establishment of the phase 1, phase 2 business model.
Okay, so the phase 1, phase 2 model, though, no devices were going to be sold to Walgreens. Is that right?
At least in the first phase.
In the first phase, correct.
Okay,
Yes.
at least in the first phase.
Yep.
So how was changing it around to the rental model? How was that different from the phase 1 model?
It's the way the economics could have worked in the phase 1 model.
Okay, so in the phase 1 model, were you also charging Walgreens for any of the consumables or the cartridges?
No.
Okay, so how would Theranos be, or how was Theranos generating its revenues from the phase 1 model?
Billing insurance companies and occasionally consumers directly.
And were those revenues split with Walgreens?
We paid Walgreens for the services that they were providing, which is essentially the space and, in some occasions, labor.
So Walgreens was providing labor for the wellness centers?
Correct.
What labor was that?
In the beginning, it was their technicians for doing finger stick, and then as we began doing venous straws, it was, I think we just used their check-in labor. There may have been other things that they did in the store.
And then when the parties started talking about the rental model then, was one of the changes that Theranos would be taking over the labor costs?
My understanding is that we took over the labor when we decided to do venous straws in addition to finger sticks. The rental model was a different way to pay them for the services they were providing.
Okay, so maybe I should ask it in a different way. So how did the economics change between the two models, between phase 1 and the rental model?
I think that was something that was being negotiated. It was never fully defined.
Okay, were there other costs that you were discussing Theranos would be responsible for under the rental model that Theranos previously wasn't responsible for under phase 1?
I don't know.
Was Theranos, were you discussing possibly taking some share of the build-out costs in the rental model?
I think at points in time when we were negotiating with them, we may have offered to do that. But I don't know what our sort of end thinking on the right way to do it was.
Were there any other factors besides the 3 that we just talked about that led to the rollout being limited to the 41 stores?
I mean, I'm sure there were multiple, factors. As with any business relationship, I think of those 3 as the first that come to mind sitting here right now.
Did Walgreens have any concerns about the operations of the partnership and the fact that, not enough patients were coming out to the store?
They had concerns after the initial Wall Street Journal articles about our clinical lab and operations from that perspective. I don't recall discussion about not enough patients. They might have. I don't remember any direct discussions about that.
You don't recall any discussions with Walgreens where Walgreens expressed a concern about the number of patients being too little or too few?
I don't recall any that I was involved in. It's possible that those conversations happened. I don't know.
Did Sunny Palwani ever explain to you that Walgreens was concerned about patient traffic at the 41 stores?
I don't think so. I mean, I know certainly patient traffic was their primary financial driver. I had in my head that they had originally wanted to see something like 10 patients a day, and we ended up in a lot of the stores hitting much more than that.
I guess I'm just trying to understand. You said you don't recall any direct conversations about this kind of patient traffic issue. Do you recall any indirect conversations about the patient traffic issue?
No, I was just trying to say that that may have been something that Walgreens talked to him or to others at Theranos about, and I just don't know about it.
So you mentioned that you knew that one of the sort of measures that Walgreens was using was number of patients per day in stores. Is that right?
I was saying that I know that they cared in general about foot traffic. I think that was the value of Theranos to them.
Okay, and you said that they were looking to at least have about 10 patients.
That was the
in
number
store
that
per day?
I had in my head as sort of the goal.
Okay, what was your understanding as to the number of patients per store per day on average Theranos was receiving in Walgreens stores?
I don't know sitting here now exactly what it was. I remember some stores hitting over 40 patients, and I think there's some where there was like 1 or 2, which was part of trying to optimize the retail footprint, because there's some retail locations that just nobody goes to, and there's some that you get a lot of traffic.
Do you recall ever having any discussions with Walgreens about the Venus draw percentage that they were seeing in stores?
I don't think I ever had any direct conversations with them about it, but I know that that was something that was discussed between us.
Okay, how do you know that?
Just as I've gone back and tried to look at documents and what happened.
Okay, at the time though, in end of 2013, 2014, did you have any discussions with Mr. Balwani about the fact that Walgreens was concerned about how high the Venus draw percentage was in stores?
I don't remember any conversation with Sunny about that. I knew that there were people at Walgreens who cared about how much we were doing on fingerstick. When I had engaged with Walgreens, which was primarily with their executives, and when the Boots team got involved with their U.S. executive, the conversation was largely about foot traffic. So I don't know specifically what interactions happened around the fingerstick percentage.
Okay, I'm going to go through some documents with you. Handing to you what's been marked Theranos Exhibit 206. This is tab 2. Exhibit 206 purports to be a March 29th, 2010 email from to subject line is forward follow-up to our meeting today, with the starting dates number WAG-TH-00006784, with an attached presentation starting at WAG-TH-00006786. Have you seen Exhibit 206 before?
I don't recognize the first sheet.
Okay. Do you recognize the presentation that's attached?
Do you mind if we take a minute to look at it?
Sure.
I don't remember it specifically, but it looks like one of our slide decks.
Okay. And actually, if you head back to the email, the parent email to the attachment, on the second page, well, bottom of the first page, the second page of the email.
Sorry.
On the first page. At the bottom of the first page is the heading for your email. If you turn back to the first page of the document, at the very bottom, you'll see
Yes.
that there's an email from you with a copy. Do you recognize this email?
I don't, but I don't have any reason to doubt it.
And did you send that email on or about March 23rd, 2010?
I don't know, but I, again, don't have any reason to doubt it.
Okay. So in your email, which is on 6785, the second page of your email,
Yes.
you say, "It was great to meet you. As promised, please find the presentation that we presented today." Do you recall what meeting you were having that day and who it was with?
I don't.
It sounds like attended. Do you know if anyone else did?
I don't remember.
And what role at Walgreens?
I remember him but I know he sort of spearheaded a number of strategic initiatives there.
And what about role? What was his role there?
He was involved, I think, initially with their, and then over time, I think in medical affairs or innovation. I'm not sure.
So do you think that this was around the time of your initial discussions with Walgreens in March 2010?
Again, I don't remember when exactly those conversations started, but that sounds about right.
Okay. If you turn to the presentation, you mentioned that it looked like a Theranos slide deck. With respect to slide decks that you would be presenting on occasions such as this, where you're discussing with a potential business partner certain opportunities, how would you prepare materials to be presented?
So my memory is we generally had a core set of slides that we used based on what the discussion was with different parties, and we would build on that deck. There was a broad range of topics in it, and my memory is we wouldn't actually present these whole decks. You would just present subsections of it based on what we were talking about at the meeting, or use a slide to support a discussion.
Okay, so you think that you might have had this slide deck with you, but you might have only used a portion at the meeting?
Yes.
And you referred to we had the slide deck. Is that you and Mr. Balwani? Or?
So my memory is that internally at Theranos there was sort of one master deck that we would just add content to as the business grew and expanded, and myself, Sunny, and anybody else who needed a deck to support meetings would use certain content from that deck depending on what the meeting was about and what content was needed.
I guess to your knowledge, was there anyone other than yourself and Mr. Balwani who would make these sort of external-facing presentations on behalf of Theranos?
When we were working with pharmaceutical companies, we had a small sales team, and they would create content that I think is in some of these decks and make presentations themselves. Then it's likely that other people within the company would have done the same. I can't sit here with a specific memory of someone.
Do you recall putting together this presentation for that meeting?
I don't.
So do you know who would have put this together?
I don't.
Do you recall Sunny Balwani attending the meeting with you?
You know, I don't know what meeting this was. I know that Sunny was generally involved, I think, in all the meetings that we had at Walgreens at this time, but I'm not sure.
Okay. So if you can turn to 6788. The slide says in the first bullet point, Theranos' proprietary patented technology runs comprehensive blood tests from a finger stick in real time at the point of care outside of traditional lab settings. What do you mean here by comprehensive blood tests?
I think we were trying to convey that unlike what was on the market for point of care, like a glucose meter that could only run one test on the device, this device was capable of handling a range of tests based on how it was designed.
Okay, so instead of one, it could do several tests.
It could do a whole range.
Okay, by comprehensive, were you trying to convey that it could do all routine lab tests? That a patient could come into or could use Theranos' technology to run a whole range of tests that would otherwise be available through, any commercial lab?
I don't think that's what this specific bullet point was referring to. I think this bullet point was just trying to distinguish the power of having robotics inside a device from a traditional point of care device.
Okay, so maybe I don't understand that now. So what do you mean by this was trying to distinguish between having a robotic device?
So my memory is the way we would introduce our invention was that what was different about the Minilab family was that it was capable, because there was a robot in it, of running a broad range of tests, whereas a glucose meter is only capable of running glucose, right? And what we were trying to do was differentiate from other point of care technology.
Okay, so you weren't talking about the fact that your blood analyzer could conduct many, many tests. It was just that there was a robotic arm in the machine that could allow that machine to test many tests at the same time?
To test many types of tests, which to our knowledge had never been done in point of care before.
Okay, so test many types of tests, but it sounded when you were gesturing there, and I know I said before not to gesture, but that you were trying to depict a way for a machine to use a robotic arm to perform many tests at the same time. Is that what you were trying to convey by this?
No, just that we had invented technology that could be programmed to do a range of different types of tests, and we thought and think we were the first to do that.
Okay, and so what's the significance of using the robotic arm then?
It's a different architecture that's used in traditional point of care, and it creates versatility with what tests can be run, so you can program it and allow it to perform different steps, just like a tech could in the lab, versus a glucose meter or the point of care devices that were on the market. It's a little strip, and you flow liquid over it, so you could never get it to perform other types of tests.
Okay. And then you go on to note on the same slide, in the third bullet point, our current and past clients include 10 of the top 15 major pharmaceutical companies, mid-sized biopharmas, prominent research institutions in the U.S., and foreign government, health, and military organizations. Do you see that?
I do.
What U.S. governmental health and military organizations were clients of Theranos at this time in 2010?
I think this was referring to the work that was being done with the Institute of Surgical Research in San Antonio, which is the burn study that we talked about. And there may have been others at that time, like Walter Reed. I'm not sure. I can't remember in 2010.
What was Walter Reed?
We had invested in a program, I think around this time, for helping to do diabetes research. I'm not sure exactly when it was or how many of those entities we were working with as of 2010.
Okay, and what about the foreign government, health, and military organizations? What are you referring to there?
I think the foreign government references to modeling work that we had done for people at the IMSS in Mexico for H1N1, and I believe we worked with some health research institutes in Thailand around H1N1 as well.
Okay, and you mentioned, or you state here that there were clients of yours. Did you receive money from them or revenues from them for the work that you performed?
We did from the Institute of Surgical Research. We did not from IMSS or the entities in Thailand.
Okay. And then the fourth bullet point says Theranos is launching Theranos systems to consumers in 2010. What did you mean by that?
What we had talked about with Walgreens to try to do that year, which is take the systems into FDA and try to get CLIA waiver.
Okay, but this is one of the initial presentations that was presented to Walgreens, right? This was in March 2010, so
yeah.
Do you still think you were referring to your relationship with Walgreens when this is one of the initial presentations you're presenting to them?
I don't know. Looking at it now, what it meant then, my read sitting here now is that that was our objective for 2010.
And then turning to 6790. The title of the slide is Overview, Theranos Systems, and there's a picture of the devices. What is this a picture of?
I believe it's a 3 Series TSPU. I'm not sure which one.
So are you trying to convey here that the devices that are part of the Theranos systems that Theranos had developed, that was the 3 Series device?
I think we were just trying to show that the Theranos system had a device, a cartridge, and we were investing in a lot of software.
Okay. But this was the device that was part of the Theranos systems that you were hoping to roll out in Walgreens?
I don't think that's what we were trying to convey with this slide. I think we were just trying to convey that the system had multiple components to it. It wasn't just a consumable or a piece of hardware, that there was a lot of software around it.
Okay. And then again on 6791, there's a bigger picture of the device there. What were you trying to convey by including this in the presentation?
I don't remember.
Okay. Turning the page to 6792, the title of the slide is Validation of Theranos Systems. The slide says Theranos systems have been comprehensively validated over the course of the last 7 years by 10 of the 15 largest pharmaceutical companies. What did you mean by that, and what were you referring to there?
What we've been talking about here today, that we had confidence in our ability to implement this technology based on the experience we'd had with the pharma companies we'd worked with. Had the pharmaceutical companies validated the Theranos, I guess you say Theranos systems here, did that include the 3 Series analyzer? Yes. Okay, and did the pharmaceutical companies validate the 3 Series analyzer during the course of the work that you were performing for With them? the tests that were validated, yes.
Okay, so what do you mean by with the tests that they validated?
So the tests that we ran for the different pharma companies that we worked with were on TSPUs. They were on 3 Series TSPUs.
Did you ever give a TSPU device to any of the pharmaceutical companies that you were in contract with so that they could run their own testing on those machines?
Yes.
Which ones did you give the devices to?
This quote here from GSK was one of them. There were others as well. I believe at one point we sent one to the lab at Sharing Plow, and the program that we did with Pfizer, the devices were actually in people's homes. And I believe with Centicor, I have in my memory that we deployed for them in Belgium at one of their facilities. And I think in a US site as well, but I can't remember. It was multiple instances.
Any other pharmaceutical companies that you recall sending a device to?
I'm just thinking back. I'm not sure. We may have. I know we. I don't know. I'm not sure.
Okay, and then the third bullet point, or the third paragraph on this slide, says Theranos systems are GLP, GCP, and 21 CFR compliant and are validated under FDA ICH guidelines. Do you see that?
I do.
The FDA guidelines, is that the FDA guideline document you were referring to earlier?
I think so.
Okay, and what does it mean when you say Theranos systems are GLP, GCP, and 21 CFR compliant?
I'm not sure. I don't know.
Who drafted this?
I don't know.
Did you ever ask questions about what that meant?
I can't remember at the time. I believe if we were presenting on this slide, would have been confident in it, but I can't remember interactions around it.
And then you go on to say the systems are classified as non-significant risk devices. Regulatory filings are ongoing in preparation for launch to consumers. Do you see that?
I do.
What did that mean to you?
I'm not sure. Sitting here now, I believe the non-significant risk classification was something we had engaged either with the FDA or with regulatory counsel on previously. And I'm assuming this was reflecting the fact that we thought we were going to take the technology into FDA to try to get clearance and CLIA waiver.
Were you involved in those FDA discussions previously?
I don't think at this time I had been directly involved with the FDA.
Okay, so you just mentioned that there was some classification of the device as non-significant risk in connection with discussions with FDA.
It was either with FDA or with outside counsel or regulatory advisors that we'd had. I don't know which one.
And then you say regulatory filings are ongoing in preparation for launch to consumers. So which regulatory filings were you referring to there?
I don't know.
Okay, let's turn to 6799. The title of the slide is Theranos Systems Products, and there are 3 categories of tests there. There's general chemistry tests, wellness tests, and diagnostic and predictive women's and men's health tests. So the general chemistry tests, were those part of the 90 that could be conducted on the TSPU 3.5?
So I was, just as I was flipping through it, looking at another slide here where I read it as being related to sort of a set of standardized tests that could be run at retail. So I'm not sure. I'm not sure specifically what we meant by general chemistry at that time.
What were you trying to convey from this slide?
I don't know then. Sitting here now, my read on it is that we were saying this is what we wanted to try to do with whoever we partnered with at retail to bring to consumers.
So you think that these were the tests that you had told Walgreens that you were trying to achieve on the TSPU?
No, I think that this is, and if I remember it with Walgreens right, we had sort of designed a multi-phased model in which we would start with routine testing if we were going to put the device at Walgreens and then over time ultimately do what we were referring to as predictive tests. So I think this was sort of the vision for what we would want to do with the TSPU at retail.
Okay. And then if we turn to 6803 and 04. So you've got some Theranos pricing here for various tests. And you just said that you were hoping to be able to develop the test to be able to be used in clinical testing. Is that right?
Generally, yes. I mean, we'd obviously deployed some tests for pharma companies and had others that we'd already developed, but again, as these had not been into the FDA yet.
Were these tests already developed on the TSPU? The ones on these 2 pages?
On the pricing list?
Yes.
I think these were just slides on the kind of business model that you could have with representative tests. I don't know what the status of these assays was.
Okay. So why would you have pricing if these were tests that were supposed to be representative tests that may or may not have been developed at the time?
Because we were, I'm reading this now, my interpretation is we were trying to convey that there could be a really good business in competing with other labs like Quest that charged much higher prices for lab tests.
Okay, but how would you know what price you'd be able to offer those tests for if you hadn't developed the tests yet?
But, I mean, again, I don't remember this deck or the meeting, but reading it now, my understanding of this kind of content is we were saying we want to try to bring these devices to retail. We make them ourselves. We make the cartridge ourselves. We make the chemistry ourselves. This is the kind of business that we think we could create with it.
Okay, and so how did you come up with these numbers then if you weren't sure if the tests had been developed yet?
I don't know.
Is it fair to say that this theme of reduced cost testing was whether or not you remember it in the context of this particular Walgreens meeting, that remained a constant throughout your discussions with Walgreens. Is that fair?
Absolutely.
And that was true even after you sort of switched to the phase 1, phase 2 approach. Is that?
Yes.
Did Theranos sort of consider the pricing it was offering customers in light of its switch to using modified third-party devices?
I don't know. I don't know.
I guess, do you recall doing any sort of analysis about whether Theranos could, I guess, sustainably offer, cheaper tests under the model that it was operating in the retail pharmacy in late 2013 or 2014?
Yeah, I wouldn't have been the person that would have done that, but I believed, based on my ongoing conversations with Sunny, that we thought it could be a financially viable model, and in fact, a better model than if you tried to use TSPUs in a centralized setting, because you'd need so many devices since they could only process one at a time.
Okay. Then turning to 6810. The title of the slide is Real-Time Fingerstick-Based Tests for Launch at Walgreens in 2010. And there are 3 categories of tests. There's general chemistry panels and standard blood tests, influenza, and fertility. Were all of those tests being performed, or were those tests capable of being performed on the TSPU 3.5 at this time?
So again, I don't know what exactly we were referring to as general chemistry. I believe yes, as to influenza and fertility.
Okay, so all of these tests could be run on the TSPU 3.5 in 2010.
Again, yes, as to influenza and fertility. I don't know what we meant by general chemistry at that time.
Who would know? Somebody put together this presentation and you ended up sending it to Walgreens. Who would know what you were talking about in these slides?
We could look back and try to piece it together. I mean, maybe Sunny. I don't know.
And was it your practice to be sending materials to people where you weren't sure of the information that was being presented in the materials?
I don't think so.
So, did you review this presentation prior to sending it to Walgreens?
I don't know. It was a long time ago.
Do you think, based on your practice in your business, that you would have reviewed the materials prior to sending it to Walgreens?
I think that we would have had a deck that was an amalgamation of slides that we shared very openly with people. I don't know that we would have reviewed the whole deck before we sent it out at that time.
Okay. And if you saw something in the slide deck that you weren't sure of, or that you weren't as familiar with, would you have asked questions about it and wondered why it was being included?
Yes.
And have you done that before?
On a slide deck?
Yes.
I can't sit here with a specific memory of that now, but I'm sure I have. On any content that I'm engaging in.
Okay, you can put that one aside. I'm handing to you what's been marked Theranos Exhibit 209.
207.
Oh, I'm sorry. It's 207. No, 207. Exhibit 207 purports to be a May 7th, 2010 email from Elizabeth Holmes with a copy to Sunny Balwani. Subject line is Regulatory Overview Summary with starting Bates number THPFM 000416490 with an attachment with Bates number ending 416492. Have you seen Exhibit 207 before?
I don't remember it, but I don't have reason to doubt this email.
Did you draft and send Exhibit 207 on or about May 7th, 2010?
I don't know, but again, I don't have reason to doubt it.
So you mentioned in this email that you're attaching a document as requested. What did request?
I don't know.
If you look at the attachment, the title is Regulatory Summary. Do you remember discussions with him about Theranos' regulatory strategy?
I know there were a lot of discussions with Walgreens about our regulatory strategy. I don't have memory of specific discussions about it, but I know it was something we were actively engaged with Walgreens on.
So, and as you look back at this attachment, do you recall who put this together?
I don't.
Did you put it together?
Do you mind if I take a minute to read it?
Sure.
I'm not sure. I don't know. I don't recognize some of the content in it. I'm not sure.
If you didn't write this document, who would have written it?
I believe we were actively engaged with regulatory counsel and advisors during this period, including on helping us figure out how best to communicate with Walgreens on our regulatory strategy.
So you think it could have been regulatory counsel that put this information together for you?
I don't know. It has reference to words I don't recognize, so I'm not quite sure where the content came from.
Who was your regulatory counsel at this time?
It's 2010. We may have been working with FDA, who was an FDA expert, and I don't know if we'd yet engaged. May have been later, but I think this time.
Okay, so if you look at the document, in the first paragraph it says Theranos systems were first reviewed by FDA in 2005. At that time, FDA determined that Theranos systems were classified as non-significant risk devices and non-invasive, and therefore did not require an IDE under this particular regulation. Do you see that?
I do.
What discussions did Theranos have with FDA in 2005?
I believe this is referring to a meeting our team did to determine the classification of the devices for clinical studies with pharma partners.
Who was involved at that meeting?
I don't know everyone. I believe who worked for us at the time was a part of or led it. I know there was multiple people from Theranos. I don't know who else was there.
And what did FDA review at that time to make this determination that it was a non-significant risk device?
I don't know.
Were you at that meeting?
No.
Were you involved at all in the preparation for that meeting?
I don't know.
Was at that meeting?
In 2005?
Yes.
I don't think we started working with them until much later.
So I'm trying to bridge who would have had knowledge of that and who would have been writing this document. So who do you think would have given you or whoever drafted this document information about a 2005 meeting?
I don't know. I could speculate that there was some documentation from this meeting that this language was taken from, because it's very specific, but I don't know where it came from.
Okay. So let's move on to the fourth paragraph down, starting with assays. Do you see that?
I do.
Okay, so it says assays on Theranos systems were validated for a broad range of tests, including PK assays, PD assays, and general chemistries. What are PK assays?
Pharmacokinetic assays.
Okay, what are those?
They're generally used to measure drug levels or metabolites of drugs.
Okay, and what about PD assays?
Pharmacodynamic assays.
And what are those tests?
Tests that look at the efficacy of a drug or the safety of a drug.
Could Theranos' TSPU perform all three of these tests, general chemistries, PK assays, and PD assays?
Yes.
And then the next sentence after that, it says, after receiving endorsement from FDA. Do you see that?
I do.
What endorsement do you understand Theranos received from FDA?
I don't know. Reading this now, I can infer this is about pharmaceutical partners talking to the FDA about use of our systems in their studies, but I'm not sure.
I'm sorry, and so you're saying you can infer that this was pharmaceutical partners talking to FDA?
I think so, but I'm speculating. I'm not sure what exactly it's referring to.
So how does that amount to an endorsement from the FDA?
Again, I'm not sure what it's referring to. Sitting here now, I read it as meaning that we believed we had blessing to use these types of systems in clinical trials for data generation that would then be submitted to FDA by pharma companies for their studies.
Okay, and then focusing now at the second to last paragraph of the document, starting Theranos is confirmed. Do you see that? It says Theranos is confirmed with regulatory authorities that the 510K in the US and CE mark in Europe are not required for the systems to be used as the sole platform for data collection and analytics, including for all blood sample processing in registrational clinical studies or in certified laboratory settings. Do you see that?
I do.
Which regulatory authorities are you talking about here?
Again, I don't know specifically. I, sitting here now, believe this is referring to the discussions with the pharma partners about what regulatory certifications would be needed for data collection in clinical studies.
Okay, but it says Theranos is confirmed with regulatory authorities, so this wouldn't have been a confirmation with your pharmaceutical partners. Do you recall any discussions with regulatory authorities about this?
I don't. Again, I believe that both through Theranos' early interaction with the FDA and through its engagement with pharma companies, we understood that the device did not need these certifications for use in pharmaceutical clinical trials.
Okay, you can put that on the side.
Maybe we take a short break if you're moving on to a different document.
Sure. We're off the record at 5:15 p.m.
We are back on the record at 5:27.
Ms. Holmes, did you have any substantive conversations with the SEC staff during the break?
I did not.
I'm handing to you what's been previously marked as Theranos Exhibit 44. Theranos Exhibit 44 purports to be a document titled Theranos Master Purchase Agreement dated July 30th, 2010, with starting dates number WAG-TH-000000006. That's 7 zeros and a 6. Have you seen Exhibit 44 before?
I recognize it as what I believe is our original contract with Walgreens.
And did you review and sign Exhibit 44 on or about July 30th, 2010?
I don't remember exactly when I signed it, but I see my signature here and know that I did.
So this is your signature that you're seeing on page 7?
Yes.
Okay. If you turn to the page with base number ending 8, which is the next page, this is a Schedule A to the agreement called Program Overview. And under background, it says Theranos has developed and is developing generations of mini lab devices that can run any blood test in real time for less than the traditional cost of central lab tests. And then there's a picture of a device on the right. Is that a picture of the mini lab device?
The 3 series version of it, I believe.
Okay. Okay, actually, you can actually set that one aside. Handing to you what's been marked Theranos Exhibit 208.
Thank you.
Exhibit 208 purports to be an email from Elizabeth Holmes with a copy to Sunny Balwani. Subject line is Forward Hopkins, with starting base number THPFM 000-562-0882. And there's an attachment with base number ending 562-0883. Have you seen Exhibit 208 before?
I don't remember it, but I see it as an email, forwarding an email.
And did you draft and send Exhibit 208 on or about September 10th, 2010?
Again, I don't have memory of it, but I don't have any reason to doubt it.
Well, wait, can we just clear something up? When you say 208, you mean the first page of 208? Because there's an attachment to it. Are you asking her if she drafted the attachment too?
Oh, I'm actually asking if she drafted an, I'm sorry, you're right. Okay, so did you draft the email that came with the attachment?
Just the first
On
page is
Exhibit
asking about
208?
it.
Got it. Yeah, I assume I did. I don't remember it, but I don't have reason to doubt this chain.
So you assume you drafted the email?
Yes, not the
Okay.
attachment. Thank you.
Right.
Sorry.
And did you send the email with the attachment then on or about September 10th, 2010?
I believe so, based on this email.
So what is this email and the attachment about?
What is the attachment about?
Yes, or what are the circumstances for which you sent this email to?
I don't know what the circumstances were. I read from looking at it right now that I was just forwarding what I'd gotten from Walgreens.
And if you do turn to the attachment then, the attachment is titled Summary of Hopkins Walgreens Theranos Meeting, April 27th, 2010. Do you recall attending that meeting?
I do.
Who else attended with you?
I see the attendees here and don't have any reason to doubt this list.
Okay, so do you think that, do you recall Sunny Balwani attending that meeting with you?
I do.
And in terms of the attendee list on the first page of these meeting minutes, is this an accurate reflection of who would have attended that meeting?
I believe so. I don't remember all of them, but I believe this is accurate.
What was the purpose of this meeting?
Walgreens asked us to go to Johns Hopkins to talk about what we'd invented.
Do you remember attending the meeting?
I remember, I remember being there.
So you think that's just a...
I think so. Yeah. And then I recognize the other names and have general memories of others being there.
What happened at this meeting?
We presented essentially the architecture of what we had invented, and the Hopkins team asked questions about it, and I believe looked at some of the data on the chemistries that we had at that time.
And what did Hopkins do after the meeting?
I don't know.
Did you ever present to Hopkins a device so that they could run their own tests on the device?
We brought a TSPU to this meeting, and I believe they did, or we did, run something on it in that meeting. I'm not sure about that, but I think we did. And then later we just gave the device to Walgreens to run at their site in Chicago.
What was your understanding as to why Walgreens was including Johns Hopkins at this meeting?
I don't know. My guess is that they were asking Hopkins to assess the invention.
Okay, and if you go to the page, flip the page to 884, there's a number of key findings here. What was your understanding as to what these key findings were based on?
The meeting that we had, the discussion that we had during that meeting, I think some of the data on the chemistries that we looked at, but mostly the architecture of the invention.
And how long was the meeting?
I don't know.
Do you know if it was a full day, a half a day, an hour?
I'm guessing. I think about half a day, at least half a day. It might have been a whole day. I'm not sure.
And did Theranos ever enter into any relationship with Johns Hopkins?
I don't think Theranos did formally. I know Walgreens had one.
Okay. Was Theranos ever in discussions with Johns Hopkins to enter into a relationship?
I'm not sure. I think we might have been at different points in time at Walgreens' urging, but I don't think we ever did.
Okay, so in terms of Johns Hopkins, access or interactions with your device, would that have taken place just at this meeting then, or were there other opportunities in which they had a chance to review your device and data?
I don't know. I know that Walgreens had many interactions with them. I don't know what they shared.
Okay, but in terms of your interactions with Johns Hopkins, would that have just been this one meeting with them?
So we had previously known, we were asked to do this meeting by Walgreens. Later, after we had the partnership in place with Walgreens, there were further interactions with Hopkins, and then even later with some of the Hopkins team as I worked to build out scientific and medical advisory boards.
At any of those interactions with her, those conversations that you were just referring to, did you present any additional data to them on Theranos' analyzers?
So I don't know what had seen before this. I know he was engaged with some people who were working with Theranos. I don't know in the course of the Walgreens relationship what additional data Hopkins had access to. I know that was involved as I was working to build out the Scientific and Medical Advisory Board, I think in early 2016, and he saw a lot of Theranos data in that context.
Okay, so that was in 2016.
Yeah.
Do you know as of, I guess, 2010 to 2014, whether there were any other discussions with, or did you have any other discussions with Johns Hopkins about Theranos' analyzers or the data underlying those devices?
I don't know if it was in that time period. I believe at one point Walgreens came with the person who was doing pediatric testing at Hopkins to talk about what generally the small sample assays could mean for pediatric testing, and we did not have bandwidth to follow up on focusing on that relationship and didn't. But other than that, I don't know of any specific interactions. I wouldn't be surprised if there were more, but I don't think I was involved personally in any of them.
When did the meeting with the pediatric person take place?
Again, I don't know specifically when. I don't know, it may have been around the 2014 timeframe, but it could have been 2015, I'm not sure.
Did you present data to that person during the meeting?
I don't know.
Was there any follow-up after this meeting in April of 2010 between Theranos and Johns Hopkins?
I don't think there was direct engagement with Theranos. I know Walgreens had follow-up with them.
And did Walgreens ever relay what those discussions were about to you?
I don't think so, at least not to my knowledge.
You can put that one aside. I think we have no further questions for today, so we will be adjourning until Thursday, July 13th, 2017. And you understand that you're still under subpoena
I do.
to appear for that date.
Yes.
I think we are off the record at 5:40 p.m.
This concludes media number 4 and volume 1 of Elizabeth Holmes.
So should we